Hello. This is going to be a video about my hyperkinetic gallbladder by Ghost Guide. I go by Ghost Guide on YouTube. So in this video, I'll just like say hi and whatever, and then I'll talk about the symptoms that I experienced for a few years, and then all the research that I did to finally get a diagnosis, and then the surgery, spoilers, I got surgery, and then the situation after surgery, recovering, and all that stuff. Cool. So, who am I? I go by Ghost Guide on the internet. I mostly just make video game videos. Like, I make guides for Final Fantasy 14, and on this specific channel, I just play through the older Final Fantasy games. But the thing is, like, I always ramble and talk about other things in my life all the time. And so at one point in one of the videos, I was standing in front of this boss and I was just monologuing about something, and the boss is just like looking at me. And so I thought I could make a video that's a bit more focused, and so, you know, the boss isn't just staring at me waiting for me to continue the game and like all this stuff. Anyway, but also I think when I was doing research for all this gallbladder stuff, I would actively search for other people's like anecdotal evidences, stories and stuff. I would read other people's stories, watch other people's videos and whatever, and so I wanted to contribute to that and also be, you know, whatever useful contributing member of society for the gallbladder people stuff. Yeah, so that's why I want to talk about this, because there's just a lot. Like, I like talking, and two, I wanted to try to be a bit more focused and not just have this information lost in one of my like let's plays of Final Fantasy. And this format specifically, I made a presentation for it because I have ADHD and I will totally lose focus if I don't have an outline somewhere. So yeah, that's what this is, okay? It's probably gonna be long, not gonna lie. I talk a lot, no one's here to stop me, and so I'm just gonna keep talking. I have a smoothie, I got some snacks, I have water, I got cough drops, you know, it's a whole thing. I'm recovering from COVID that I caught for the first time earlier this month, and so if I'm clearing my throat a lot, it's likely because of that. And what else? Yeah, when I was talking to my roommate about it, I was like, how long do you think this video is gonna be? And he was like, I don't know, 45 minutes. And I was like, I was thinking like 3 hours. I made a 3-hour video before. And he was like, oh, okay. So we'll see how long it is. It's probably gonna be long because it's gonna be jam-packed with like the research that I did, and then also just random stories that I will ramble about. Okay, sound good. I will probably do the timestamp thingy, so you know, if you're here for specific stuff, you can click through it and all that. Let's be a little professional here. Okay, to start off, this is the human body here, okay? I wanted to give an overview of some of the anatomy and physiology of the organs inside. This specific thing is like the organs. This is, I zoomed in, I made it bigger. So, to start off, when you eat something, like in your mouth, food will go down the esophagus, okay? And so I made it bigger over here. So food will go down the esophagus, and then it will hit this valve, a sphincter. And LES stands for lower esophageal sphincter. Okay, so there's like a doorway here, basically. We're going down here. This is the heart, okay? But behind the heart, the esophagus connects to the stomach, which is what we're seeing here, this big thing here. So the food will go down your esophagus, your throat, basically, and then through the doorway, the valve, the sphincter, into the stomach, where the stomach would do stomach acid stuff and like start breaking down some of the stuff. And then we have another doorway, which is the pyloric valve, okay, which connects the stomach to the small intestine, and that's around here, this section right here. You can see my mouse, right? You see this little ghost? Yeah, this is what I use for my guides. So it's a little right there. And so we'll look on this side. We got some stuff over here. Oh wait, also let me go over this. This is the esophagus, this is the lung, these are lungs, this is the heart, this is the stomach, this is the liver, okay, the liver. This little green thing here is the gallbladder. And then we got the swirly stuff around here is the small intestine. The purple stuff that I drew is the large intestine. And somewhere in there is the pancreas. It's a little hard to see. But yeah, okay, so that's what all that stuff is. And so food goes down the throat, the esophagus, into the stomach, and then it goes through the lower esophageal sphincter, stomach, and then the pyloric valve. Pyloric basically just means stomach stuff. Okay. It is a mishmash of like, I'm gonna use like lay people terms, like common people terms, and also like scientific terms. I'm gonna interchange a bunch of them because all these things mean basically the same things, and just in different contexts they mean other things. And so I'm just gonna, naturally use this or that to familiarize anyone who is interested in learning more about the scientific part of this whole situation. Okay, so if you aren't following along, then my apologies. Sometimes I'll say pyloric, sometimes I'll just say stomach, that kind of thing. Anyway, point is, it goes through there, and so now we're over here. Okay, so it goes through this juncture right here, though, after it passes through the pyloric valve, at this juncture, this little opening near the pyloric valve, we got some other stuff going on. And there's like, we got some situations here. So here, the liver processes a lot of stuff, okay, in general, like the toxins and stuff. And it also, like the toxins are like things that we eat and whatever. It also creates bile. And what bile does down here, it helps digest fats. Bile will basically like attach to fat molecules. It'll be like a little bubble. Have you seen like bubbles that like basically absorb other bubbles and then it turns into a big bubble? It's kind of like that, but it's not that it gets bigger. It's like the opposite. It helps break down the fat a little bit. Like it makes the fat molecules a little smaller, like that, and then other digestive enzymes from the pancreas come out, and then it actually like breaks it down, like lipase and things like that. But yeah, so bile, but if that's too complicating, just consider bile helping to digest fats. Okay, so the bile is created in the liver, and then the liver, well, the liver creates the bile, and then the bile goes through these ducts. There's the right hepatic duct and then the left hepatic duct. None of this really matters, but I'm saying it anyway. And then it goes down here, which is the I thought I wrote in this one, but it's the common hepatic duct, I believe is what it's called. And then this is the common bile duct. I'm pretty sure. Let's spoilers. You guys see how many like things I have. I drew it down here. Look at all these slides we're gonna look at later. Where is it? I drew a better picture here. This one. So this is the liver, okay? It makes the bile, and then it goes either down the right hepatic duct or the left hepatic duct. Like it just depends whichever side the stuff comes closer to. And then yeah, the common hepatic duct is right here. And then there's a juncture here. It is like all the bile is like going down, but then there's a little detour and it goes to here. This is the gallbladder, okay? And these are the arteries and that kind of stuff. It hangs out in the gallbladder, and then when the body needs some bile to help digest fat, the gallbladder will contract and then shoot out some of the bile, and then it will go down here, the common bile duct. As you can see though, like this tube right here, it's all lined up, but the way that the science people have named things is that when you're above the cystic duct is what goes towards the gallbladder. Cyst, cyst, you get a cyst on your skin, it's like a pocket of fluid. If you get a cyst on like your ovaries or your uterus, it's basically a pocket of fluid. A cyst is essentially a pocket of fluid. And this gallbladder is essentially a pocket of fluid because bile is fluid, and this thing just holds it, okay? So that's why it's called cystic duct, because it's like it's the highway towards this pocket of fluid. Anyway, but my point was, this whole long road right here is, it's all attached, but they decided to name it two separate things. So anatomic, like in terms of directions to navigate where you're at. And so between the right hepatic duct and the left hepatic duct, like up here, this line right here, there's a bit of the highway, but before the cystic duct, this chunk right here, that's called the common hepatic duct, because we're still closer to the liver. But after you pass the cystic duct, after you bypass like all the gallbladder stuff, then the rest of the highway is called the common bile duct. Like all the bile comes out right here. Because the thing is, some of the bile will like move down into the gallbladder, but some of the bile just goes directly down. The gallbladder only takes, I think, like 30% of the bile that's produced along this whole situation. And then the rest of it just goes directly into the small intestine. This might be overkill. So I'm just gonna scroll back up. We've got other things to talk about. I'll eventually talk about it because I'm talking about everything. But yeah, so that other picture is basically this, right? Like, as you can later in the slide production line, I got a little bit more involved in making things more like anatomically professional. So that's why, we got this level of quality here in the earlier slides. But yeah, so, but the stuff's the same. The liver makes the bile, and bile is this like liquid-y substance. It's a little bit viscous, but it's mostly liquid. It has like stuff, cholesterol and other just things that help digest the fat, like connect to the fat and things like that. Because cholesterol is fatty. You know what I'm saying? That's why people would be like, you gotta decrease your cholesterol. You got too much fat in like visceral fat. They're gonna clog your arteries and all that stuff. Fat attaches to fat. You know what I'm saying? Like how like if you're cooking and there's like oil and like water in the same thing, they don't touch each other. They don't mix. But if you add more fat to a thing, the fat will touch each other. And so the bile has fat in it by way of like cholesterol, and so that's why it can attach to other fat that you eat. Am I getting too sciencey? Oh my god. Okay. And so yeah, the bile goes down, and then some of it goes into the gallbladder, and then the other bile goes down here, and if you eat, then the gallbladder will constrict, and then the concentrated bile in the gallbladder will, I made it darker green. It's more concentrated. It will also shoot that down into the small intestine. The thing is, over down here, we have the pancreatic duct, because the pancreas is around here too. And so the common bile duct and the pancreatic duct kind of converge a little bit before the next doorway. And the doorway to the small intestine is called the sphincter of Oddi. Okay? So one more time. Let's go back. You eat food, it goes in the esophagus, it goes through the door, the lower esophageal sphincter, it goes into the stomach like uses stomach acid to break things down more. Ideally you're chewing your food, so you're helping to break things down. Stomach uses stomach acid to start breaking down more, goes through the doorway of the pyloric valve, and then it hits it's like, hey, we need some stuff, and then the gallbladder's like, hell yeah, I got stuff. I'm gonna constrict and give you some concentrated stuff, while the other bile is always kind of doing a constant drip. Pancreas is like, yeah, I'll give you some stuff to help digest the stuff. And then the sphincter of Oddi, which is this sphincter, it's also a valve or a doorway, however you want to think, opens up, so we got the digestive stuff to help us break things down into the small intestine. And then all that stuff, the food, the digestive juices, the digestive enzymes, all go into this, not that, complicating thing, okay? And they're all mixing together, breaking down, and it takes a while, however long, 4 to 6 hours, depending on what you're eating. And then it goes into the ileocecal valve, another doorway. When that opens up into the large intestine, here, okay, so it travels, and then there's a little kink here, got to turn, there's another kink here, you got to turn again, another little kink here, and this is the rectum where you're pooping out. And so by the time it gets to the large intestine, you'll have digested what you want, you taken out whatever you want, and then the large intestine basically makes the poop. It processes what you're gonna dispose. It takes the water out of all the stuff for the body to reabsorb and things like that. And so that's how the body like processes your food. Like this is the digestive system of all this, okay? And you already saw this, but this is the long form of what I just explained. If you want to read this, I'll just, you can pause it here if you really want to get into like the timing of some of this stuff. Okay, oh yeah, here I wrote here that gall means bile and bladder means pouch, so the gallbladder is a pouch for the bile, things like that. If you want to really break it down, and the food that gets processed is called chyme and all that stuff. Okay, so if you're interested, then you can read all this. Okay, let's move on, because this is a gallbladder talk. Typical gallbladder issues. So most people who have gallbladder issues are going to have gallstones. And so like I explained before, the bile, which is usually liquid, it has a bunch of stuff in it, okay? And the issue is sometimes that stuff starts attaching to each other, and then it starts forming these rocks, these stones that are the size of sand, but then it can increase over the years to the size of like golf balls and stuff. You see, it gets progressively bigger. And so it's like these cholesterol things and all this other stuff starts attaching to each other, and then it gets hardened and stuff. So this is like the whole situation with clogging your arteries. If cholesterol starts getting stuck in the arteries and it starts building up and it solidifies, it becomes an issue. And so this is the situation in the gallbladder itself. The bile sits there, and then it just starts building up, and then you create these stones. And the issue with the stones is it can block the bile ducts. It can cause a lot of other issues. Let me segue here to sludge. Sludge is not necessarily stones yet. It just makes it so the liquid part of the bile, it starts thickening. You go from like iced tea, okay? The color of iced tea, the viscosity of iced tea, it's liquid, it's good, it's always good. But you add more sugar. We're not talking about sugar with the gallbladder. This is an example. But you keep adding more sugar, and then the iced tea starts getting more viscous, right? And then you start adding even more sugar, and that sugar can turn to syrup. And syrup starts getting thicker and thicker and thicker, and it's harder to move that around. So that's kind of the same thing that's going on here. You have bile that's liquid, but you keep adding more stuff to it, like the cholesterol and other minerals and things that make up the bile, and then it starts getting thicker into this sludge. And then sometimes it could also turn into gallstones. The thing is, some people don't get sludge at all. Some people it goes straight to gallstones, and then you still have liquid bile. But then other people, they never get gallstones, they only get the sludge. And so that, I think, is still kind of getting research into like why that happens. But a very common thing that a common consensus seems to be that our modern diet does not really require us to have a gallbladder anymore. And so that's probably why we get a lot of gallbladder issues. And that there's a whole thingy about that, which I might have a slide about, but it's just like there isn't a lot of concrete evidence of it, because honestly, the medical field has advanced a lot in a very short amount of time. Okay, like I'm just thinking about the whole history of the medical field, and I am not going to get into that because that's going to turn into an even longer segue. But basically, it wasn't that long ago that humanity were in the hunter-gatherer period, okay? Like when we look at this, the gallbladder concentrates the bile, and then it's like, oh shoot, we're going to eat a hefty meal of like this boar that these guys brought back from the forest. Okay, this is our big meal of the day. We need concentrated bile to break down the fattiness of this boar that we're about to eat, okay? And so the body has this concentrated stuff, and it's like the souped up security guards of digestion. Yeah, we're gonna get in there to help digest this stuff. And then, you know, and then you eat like your vegetables and whatever, and then the next day you catch another thing, and then you have a big meal again, that kind of thing. But you know, these days, food, at least in like Western society, for example, is pretty readily available. Like, you don't have to actively hunt for stuff. You can eat a burger for breakfast, lunch, and dinner. You can like have all the like bacon and sausage and like all these really fatty things, and it's no big deal. You just go to the grocery store, or you go to fast food and things like that. And so the gallbladder, the concentrated bile in the gallbladder is not as necessary, but at the same time it does, in a way it kind of holds us back, because it's like, oh shoot, you're eating a fatty meal, okay, I'm doing the thing. And so in some ways it's overworked, and in some ways it's like not overworked, because like it's very complicated to explain, because this is not something that happens to everyone, but it's common enough that a lot of people have gallbladder issues. And so, I mean, I don't want to just say stuff and have it seem like that is the way it is, but from what I have gathered, a lot of it is due to the fact that we have food more readily available, and a lot of it is processed, a lot of it is very fatty and heavy, carb heavy, fatty, and all that stuff. And so that, I don't want, it's a correlation versus causation situation here. I'm not saying this is causing it, but there definitely is a correlation between our current diet, our current modern diet, versus like gallbladder issues. And so here, it just seems like it's becoming more common that people have gallbladder issues. That, or, you know, just, you know, a few decades ago, like, they didn't have all the current technology to be testing for this stuff or seeing this stuff, and maybe people were dying to this stuff and we didn't know about it because the science and medical research wasn't there. Who knows? But yes, but now this is a thing. This is the most common thing that people have issues with, these gallstones. And then people also have sludge. So both gallstones and sludge can cause issues, block the bile ducts, cause cholecystitis, it's hard to pronounce, or pancreatitis. So if you have itis after a thing, that means inflammation, and this is basically inflammation of the gallbladder. I have a slide later where I break down all this stuff. And so basically down here, if you have a stone and it blocks this thing, and then stuff is trying to get through it, but there's something blocked, that's gonna hurt. And if it keeps trying to push against it and like contract and whatever, but there's a blockage there, then the gallbladder can get inflamed and swell up and all this stuff. And it's like, what's going on here? I'm trying to do my job, but like something's stopping me, and then everything gets backed up and it causes issues, okay? Additionally, if you have a stone stuck right here, in this juncture where it's next to the pancreatic duct, and then the pancreas is trying to bring down its own stuff, its own like digestive stuff, and it gets blocked, then the pancreas can get inflamed. It's like, hey, I'm trying to send my stuff, what's going on? And it keeps pushing and pushing, and then that gets blocked. So it can like cause issues there. Same with the sludge. The thickened sludge can also cause blockages. Okay, so that's how they can affect things, and it can be painful. You get right upper quadrant pain that can also turn into pain elsewhere in the body because things are getting backed up and stuff. Gallstone and sludge usually result from poor diet, fasting, losing weight too quickly. Okay, so I think I already went over the diet situation. Like if you're eating a lot of fatty stuff, it kind of causes the gallbladder to like require more bile, but then also it can kind of mess with like it doesn't give it a break, but also there might be there's science to it, okay? There's like science articles you can read all about that, but we're already at 24 minutes. Okay, I'm only on like the third or fourth slide. Let's go. Fasting can cause issues because as much as you don't want to overwork your gallbladder, if you underwork your gallbladder, that can cause stones. Okay, so like here we have this pouch, and its job is to constrict and send out bile. But if it's just hanging out and more bile just sits in there and it's just chilling, you know, like you're watching TV slouched on the couch and you just keep adding more laundry on top of you, more like paper plates and like all this stuff, eventually things start getting sticky and hardened, okay? And then you're just stuck there. Did I paint the picture? Okay, so like if you're fasting, you're not using the gallbladder. The body's not calling for any bile, because it's like, oh yeah, we don't need it right now because we're not eating. We'll just keep storing it. You keep storing more and more and more, and then things just start sitting there. They sit and just morph into the furniture, and then literally gallstones can adhere to the gallbladder, and that turns into this thing they call the strawberry gallbladder. It's a whole thing. And yeah, and so fasting can cause gallstones and such because it starts just like causing less movement of the gallbladder. It stops like churning through bile, you know. The bile just gets old, and then more bile is put on top of it, and then it gets older and older and older, and then it morphs into other stuff. And so you do want to keep utilizing the gallbladder regularly, like not too much, not too little. There's like a healthy amount, like a healthy diet, basically. Hormone shift, losing weight too quickly can also cause issues because in general, losing weight too quickly can cause a lot of issues in your body. Like it's a very stressful thing for the body to be breaking down a bunch of stuff so quickly. Your skin sags, your gallbladder is also like, you know, trying to deal with, you know, the thing is, people who lose weight too quickly are usually also having diet stuff such as fasting, okay? And or they're eating a minimal amount and it's not as healthy, and so the body doesn't have as many resources to just work like baseline like functions and stuff, and so that causes strain on the organs, and then there's just a lot of changes happening, and the gallbladder is susceptible to getting damaged because of all those changes, okay? And then specifically when the bile just hangs out there too, and then starts congealing into hardened stones and stuff. Okay, hormone shifts, especially in pregnant women. Okay, so this is progesterone increases and lowers gallbladder motility by way of making CCK less receptive, and therefore gallbladder doesn't contract as much, bile stagnates and starts forming gallstones. Okay, this, I do have slides about this later, but it basically, when you're pregnant, your hormones shift in order to create a nice space for the life that you are creating in your body. However, that shift in hormones can cause a bunch of issues, and that's why there is a significant subsection of people who have gallbladder issues being pregnant women. Okay, it's either like during pregnancy they're like, oh my god, like I'm getting this pain, and like what is this, blah blah blah, and then they get diagnosed with gallbladder issues, or immediately after like they give birth and stuff, they start developing issues, and then they discover gallbladder issues. And so a lot of like hormones can affect the gallbladder too, and again we'll go into that more deeply later. Okay, so about me, when I was 19, I got very sick. This was a very trying time in my personal life, and it was very stressful and blah 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 blah, and so I was like, maybe that's why I'm getting sick, but you know, who knows. I'm just listing it here anyway. I started getting full body hives, legit. I mean, my arms, my chest, and my torso, my leg, my thighs, my legs, like my hands. It was just hives all over, and it was rough. It was very difficult to figure out what to do about it, and the only thing that really helped was I left home, you know what I'm saying, get away from that stressful situation. But anyway, around that time I also realized I couldn't drink milk anymore. Like I'd get really sick, and so I was like, oh, I guess I'm lactose intolerant now. I'm Asian, okay, I guess that's normal, whatever. But then I also started developing like GERD, heart heartburn problem. Like I had a little bubble like in the middle of my chest for some reason. I was like, I don't know what this is. But at the same time, I was very stressed out. And so I thought maybe it really is just all the stress. Just gonna put that out there. A few years later, the hives were going away a bit, but I was still just having problems with it. And the new doctors that I went to was just like, just use hydrocortisone and this other stuff. And so I got a bunch of like eczema creams and things like that. And so just put that out there. A few years later, I started developing some soreness in my ribs, specifically on the right side. But I was exercising, I was like going in for like a competition of some sort. And so I was like, it's probably just stress because I've been working out too much or whatever. But I did get it checked out and things like that. And so just putting that out there, okay? And then a year later, I noticed some other symptoms and I found out that I had some thyroid issues. And this is a longer story that I'm not going to get into now, but I ended up stopping the creams that I was using for the skin stuff. Because like doctors over the time, they were just telling me things like, oh, you can totally still keep using this. Like there's no long-term like issues with this and blah, 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 blah. But I was like, I don't know. I feel like blah, blah. I did research. I found out this, and this. And I was like, I'm going to stop this stuff. Went through that whole situation. And then I basically fixed my thyroid issues. And so I reversed the thyroid issues. So I was like, okay, I think this is fine. Maybe this is all fine. I write all this here because what I have discovered, you know, it says 29 here. I'm 35 now. I just turned 35. And so in the time from when I was 29 until now, I've been doing research, I've been feeling all these other things, and so it's a situation. So I think all of these things are all kind of connected. And this is what the the ribs look like. Okay, you got your sternum here, and these are the ribs. The bottom ribs are connected to the sternum through cartilage. Okay, and then this stuff here is red, that's the muscle. So that's what costochondritis is. You have muscles between your ribs, and the itis, remember, it means inflammation. It starts like straining, swelling a little bit, and it hurts. Okay, so this is the muscles between your ribs start hurting. That is costochondritis. And I drew this one because I was trying to be like, you know, when you eat ribs and like you pull the bone apart and it's all tender and stuff, and then you eat the meat. And that's what's painful here in my body. Like I get costochondritis stuff all the time. Anyway, so that's that. That's where we're coming from. That's where we're starting. Okay, so the symptoms of more applicable gallbladder related stuff. Okay, right upper quadrant pain is where I felt most of my issues. So in 2018, when I was 28, okay, I was practicing exercising and doing stuff because I was going to do a dance competition. And around that time, I had white chalky pale stool. And I was like, damn, that looks sus. What is this? That's very different than what my poop usually looks like. So I was like, what is this? What is that? And I messaged my roommate, and we were just like, oh my God, is it this? Is it this? Is it cancer? Is it this? And I was like, I don't want to worry about this. I got a competition to deal with. I'm just going to go to the doctor. So I went to the doctor and I told him all about that. And then I told him about like kind of this like tension, this pain that I was feeling a little bit. It wasn't that bad, but like I definitely felt a little bit of tension there. And they was like, oh, it's probably just because you're working out too much for your competition. But also the stool means poop, okay? The stool, yeah, it will. If this was the only time it happened, it's okay. You'll be fine. If it happens again, come back. But then I also mentioned, like, I was reading through the notes while I was making this presentation. I read through the notes, and apparently somebody else was like recommending an ultrasound or like some more blood work and things like that. And then the main doctor person was like, no, that's not necessary. They're fine. Like, don't worry about it. If it happens again, then yeah, we could do that. But I really wanted to be able to compete in my dance competition. And so I was just like, I'm gonna trust the main doctor and just believe it's okay. And so I didn't do any extra testing, and I didn't do any extra like blood work or anything like that. Okay, we're just saying, we'll leave that there, okay? Spoilers though. The thing with white chalky pale stool is that you probably got some bile issues, okay? Because bile is what helps create that brown color in the stool. Just saying. Just saying. Okay, flash forward a few years and I had right upper quadrant pain. RUQ is right upper quadrant pain, okay? And so this is essentially at the base of my ribs. Okay, like my upper abdominal area at the base of my ribs. And so I was like, is this a rib issue again? Or is this something else? But it was so painful. And I'm someone who, you know, has a pretty high pain tolerance, but I was like, this is not going away. I tried to sleep it off, it was not going away. So I ended up, we called 911 and I explained the situation, and I think the way that it was radiating, it was just like the right side of my body. And so there was some concern that it might be appendicitis. And so they're like, oh shoot, if that bursts, then you gotta like get it removed or else stuff happens, and it's like not pretty. And so it's like a emergency. And so like, you should take the ambulance to like the emergency room right now. And I was like, okay. So I went to the hospital, got a CT scan. They checked the thing and they were just like, oh yeah, we basically don't know what's going on here. It could be ovarian cyst. It could be a liver problem. It could be just muscle pain, but we don't know. You should just check with your regular doctor. And I was like, the heck? Okay. They gave me some pain meds and like sent me on my way. And then when I went to talk to my doctor like a week or two later, most of the pain had subsided. And so at that point he was like, okay, let's just like wait and see. And I was like, okay, sure, man. All right. But then the next year, bruh, it happened again. I was like, is this a coincidence or what? Like, why is this happening again? Like, exactly a year later, basically. I was like, is it because of my birthday? Like, my birthday is in this general area. Like, is it actually stress related? Am I stressing my ribs out? Am I stressing something? Or maybe, you know, because I was born at around this time, like maybe I have an annual hormone situation that has followed me since birth. Maybe I was like going off all sorts of theories. And ultimately, we were like, let's do an ultrasound. And I prepped for this one. And so you can't eat a few hours before the thing so they can get a better scan of the stuff and stuff. And so I went in for an ultrasound and it was just normal. Everything was fine. And I was like, okay, but this still feels painful. And so I just started, like, they were like, you should take ibuprofen. I was like, okay. And so I just took ibuprofen for that year. And then the next year comes around, and around my birthday, I was like, I'm gonna be so careful. I'm not gonna stress out. I'm not gonna eat a bunch of junk, whatever. It passed my birthday in 2023, and I was like, oh, I avoided the situation. I'm good, you know, like I fixed my right upper quadrant pain. It's not gonna be a cyclical annual thing. But then a few months later, it happened again, and it was painful. And I was just like, you know, the last few years when this has happened, they always just told me to take ibuprofen and like, or Tylenol, and then they would just send me home. And so maybe I'll just go do that. But then I was concerned about whether I should take the ibuprofen or Tylenol. I'm someone who did not grow up taking medicine because my family was like not for that. And so I was like, how do I do this? And so I went to urgent care instead of directly to the ER and, you know, whatever. I went to urgent care and I was just like, so can I take, I just want to know if I can take ibuprofen because my stomach's still kind of hurting a bit, but like this right side pain's also hurting. So is that okay? And they're like, let's examine you. The guy pressed down and I was like, and he was startled. He immediately backed up and was like, okay, this is more an emergency than we can take care of. You should go to the emergency room. And I was like, no, I think it's fine. Like, it's just, I mean, it was just because you're pressing on it. And he was like, I'm gonna examine you again. And I was like, well, if you examine me again, it's gonna hurt again. And he was like, well, I gotta check It's a protocol. And I was like, okay. So he pressed again, and I was like, ah. It was like such a involuntary reaction. Like, I'm usually pretty chill. As much as I'm talking now, when I'm outside doing stuff, everyone just knows me as this like super calm, polite, like well-rounded, respectable, responsible person who says things only when needed. You know, that was the type of person I was shaped up to be, and that's why probably I talk on the internet so much, because outside, you know, the mask is there, the societal pressure is there, and it's taking a long time to unwrap that. But like I'm saying, I went to the doctor and I was just like, hello, I have right upper quadrant pain, and I've been having this for the past 3 years, and I just want to know if I can take ibuprofen and how much. And then she's like, oh, okay, yeah, you can take ibuprofen, but just to be sure, let's press on it. And then it's like, oh my fucking God, what are you doing? I'm about to start crying. How dare you touch me like a, you know, so it definitely unmasked me feeling that much in pain. And so he was like, is this how bad you've been feeling for the past week? And I was like, I just don't press on it like that, okay? And he's like, you gotta go to the ER. And I was like, okay, can you like call a car for me or something? And he was like, the protocol is that you have to take an ambulance all the way over there or find your own ride. And at this point in time, I think my roommate was in Japan. And so I was by myself, and I was like, okay, I don't want to take the bus, and I don't feel like being in pain in like an Uber or Lyft. And so yes, just call an ambulance. It's fine. I think my health insurance can help me. I don't really care. I'm in so much pain right now. And so they called an ambulance for me. And honestly, the first time I was in the ambulance, and even the second time I was in the ambulance, it was so painful, because when you go into the ambulance, they put you on the stretcher, right? And then they wheel you out, and the sidewalk, fine, but the road with the rocks, not fine. And then they have to lift up the bed and shove it into the ambulance thing and lock it all up and stuff. And then you gotta wear a seatbelt. Everything was like jostling around and hurting my right side. And so that sucked. And then the road to the ER was also painful, because it's like the freeway, we're going through all these bumps and stuff. Every little bump, I felt everything because of how painful the right side was. And that was like, anyway, I go to the ER, and then they're like, okay, let's do all the things, blah, blah, blah. And I was like, I got pretty good health insurance now. You do all the testing. I've been experiencing this for 3 years. Let's get it done. I want to know what this situation is. I am so tired of this, okay? And so they're like, okay, we'll get a CT scan. We're also going to do transvaginal. And so they put a rod into your vagina, and then like they scan the whole uterus and all that stuff. And so I was like, okay, fine, whatever, do that. If it's an ovarian cyst, I would like to know that it's always this, and then I can, like, you know, go talk to the women's doctor and be like, what am I doing? What do I gotta do about these ovarian cysts and whatever? But then the CT scan would scan the rest of the stuff, and if it's any like other organs and whatever. And so I got all that done. Again, they were just like, everything's normal, blah, 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 blah. And I'm just like, what is this pain then, dude? But then also the technician that did the ultrasound for me, she was just so casual. She was very nice, you know, very nice and chill, and like comforting and stuff. She was like making sure I felt okay. But then she's doing the scan. She's like, okay, so you have blah blah that measures blah blah and blah blah blah. And like, oh, you also have a retroverted uterus. Okay, and I was like, whoa whoa whoa, what does that mean? And she was like, oh, it's so normal. It's completely normal. It just means it hangs in the back rather than the front. And I was like, what? And so like she let me look at the thing. And so apparently, yeah, some people have a uterus that instead of like just hanging forward, it like tilts towards the back. And I'm like, is that like not good? Is that bad or something? She's like, no, it's just different. But you know, I did some research later, and I found out that some people, when their uterus is retroverted, it points to the back, you get more back pain. And I'm like, I always get back pain. It's nice to know now where the back pain is probably coming from around the time when I get my period, you know what I'm saying? Information is helpful, gosh. But yeah, she was so casual about saying that it was like not a big deal, and I was just like, this is changing my understanding of myself a little bit here. Anyways, okay. So, but now I had that information, which I put down on here because later during recovery after surgery, I was like, I need to utilize all the information I have to alleviate the pain that I'm feeling post-surgery. And then I found out that because of my retroverted uterus hanging back, it was, you know, making my back pain a lot worse, which combined with the surgery pain. So I did very specific yoga exercises to help with the uterus position, so it would move to this other position, so it wouldn't sit on my spine, so it wouldn't. I was just like, I am so glad I am logic based and have science to back things up, and it translates into me not feeling horrible sometimes. Okay, anyway. Okay, but so that in 2023, again, I didn't really get anything out of it, and they were just like, yeah, just take Tylenol. And I was like, y'all, if this happens again next year, I'm definitely not letting this go. 4 years, you're gonna let. Okay, so the next year, it got a bit more messy. The next year, as in this past year, around July, I started getting headaches and shoulder pain. Well, I started getting headaches, and I thought, oh, like, it started when I was watching some school videos, and I was like, I think whenever I hear this one particular voice in this video, my head starts hurting, but the other voice doesn't bother me. Like, what's going on here? I was trying to like notice the pattern, but then like 3 or 4 days later, I was like, actually, you know what? Both voices are bothering me. What is going on with these headaches? And then the headaches turned into just constant. It was just like, well, it wasn't like continuous. It was more like every 30 minutes, 20, 30 minutes, I'd have a headache that would last 20 or 30 minutes. And then I'd have a little bit of time to just like not have a headache. And then it would come back. And I was like, this is lasting too long. So I went to urgent care. Urgent care was just, I keep going to urgent care because like it's so hard to get an appointment with primary care, you know what I'm saying? And so I went to urgent care, and I was just like, okay, this is really bothering me now. But I noticed that sometimes if I massage my shoulder, my head doesn't hurt as much. And I was like, is this actually like shoulder pain that's going to my head, or is this actually or something else? You know, referred pain can go all up everywhere in your body. And so I was like, if I massage my shoulder to the point where my shoulder hurts, my head doesn't hurt. But if my shoulder is okay, then my head hurts. And I'm like, this is bothersome. And so, but I noticed that. And so I went there and I talked to them. They're just like, oh yeah, we don't know. We'll refer you to the headache clinic. And I was like, okay. But then it took forever to get an appointment with the headache clinic. It was a whole thing. I don't want to get into it, but basically they're like, yeah, you have to fax this and blah, this. Oh, actually your insurance doesn't blah, 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 blah. And that took a while. And I'm honestly gonna say it contributed to the headache. You know what I'm saying? Wait, I have a smoothie. I haven't eaten or had any snacks this whole time. This is what I'm saying. I just talk continuously, you know what I'm saying? So yeah, it was really hard to get the headache appointment. Finally, weeks later, the headache people call me. And they're like, oh yeah, hey, we got your referral. We don't have any appointments available for the next 6 months. And so you would have to wait until the end of the 6 months to make an appointment. But we're also not opening up the wait list right now. And I was like, you're telling me there's literally nothing I can do with you guys then? Is that the situation? I have to wait 6 months, and then also like what do I do at the end of the 6 months? What's the point of the 6 months? They're just like, yeah, so do you want to be put on the list for when we open our wait list? And I was like, there's like 2 wait lists. There's a wait list to be put on the wait list to them. I was just like, yes, I want to be in your system. I want to eventually be able to see somebody about this. And I was like, man, healthcare is no wonder people are always complaining about the healthcare system. Oh my god. At this point, yeah, the headaches were, it was like August, September or something. I was having those headaches for like 2 months already. And or the shoulder pain. I was going around to like massage chair shops to try to get massages from the massage chair, and I was like, maybe this will help like my shoulder pain, and it was nice. But I was also like, I can't afford a $10,000 massage chair, and so I would hit up other massage chair places just to like try to get a massage. And then I actually did go to like massage places like in the mall and stuff to see if that would help, and it felt nice for a bit, but then it still was like issues. And then I bought like a massage gun to give myself a massage. Eventually it was still an issue, and so by like, I think at the beginning of October, I went to urgent care again, and I was like, dude, this has been lasting a really long time, and I can't get an appointment with the headache clinic until probably next year when I get off the wait list of the wait list. Okay, so I need help. Like, what? Someone help me, do something, please. This is like going on too long. And so this time, the guy that I saw happened to be the guy that I saw back here when he pressed on my abdomen and then sent me to the ER. He was like, oh, nice to see you again. I was like, you remember me? Anyway, he examined my shoulder, and we did some like arm exercise to test like my range of motion, all that stuff. He was like, your shoulder seems fine. It does seem a little bit tense in the upper shoulder stuff, and this is where stress comes in. We made small talk, and he was like, this is what happens. Yeah, if you're in school, like math is also stressful, and like blah, blah, blah. Like it's not like, even if you like math, it is a stress. It's a mentally, stressful thing for the brain to like use. And I know that. I got dyscalculia. It's stressful to do math, even if you like it. It requires, there's a cost to it. It requires just energy to do it. So anyway, point is, he was like, it could be because you're in school, you're gonna move soon, like all the stress can be going up to your shoulders and all this stuff. And I was like, okay, that's fine, but like, what can I do about it? That's what I want to know, because this has been going on too long. I've been trying to do shoulder exercises, I've been doing the massage stuff, and like all these like physical therapy type things, and it's not going away. And then I did mention in the past few years, I've been having these right upper quadrant pains, and I was just kind of curious if that could possibly, cause referred pain up the nerve that goes to blah, blah, blah. Like it's all connected, you guys. And he was like, okay, well, we can try muscle relaxers. And so I tried muscle relaxers, and it did help my shoulder and the headaches, but it gave me bad anxiety. And so I was like, I think I would rather the pressure in my head than feel any of this anxiety. But yeah, the muscle relaxer, it was only prescribed for like 10 days. And after the 10 days, I was like, that was nice, but also not nice. I think I'm just gonna not re-up on this prescription. Like, there's gotta be something else that's going on. I don't want to live off of muscle relaxers, And so like a week or two later, I was able to get an appointment with my primary care, and then we're talking about this stuff, and I was just like, so yeah, remember how I was having issues with the right upper quadrant pain the whole time? Like, do you think that could be blah, blah, blah? And he was like, no, what you're talking about is like not really related, and like, even if it was like blah, blah, blah. He was just saying all this stuff. But basically he wanted me to, like, he said, oh, okay, if the muscle relaxers did help, but it gave you anxiety, maybe we can try vitamins, and we'll just see what that does, and blah, blah, blah. So he put me on some vitamins, B2 and magnesium. And then he was also, kind of as an aside, was like, yeah, if it had anything to do with your gallbladder, then the magnesium can also help flush it out. And I did some research and found out that, yeah, magnesium can help relax the muscles, it can help, like, in all sorts of areas in your body and stuff like that. And so with the gallbladder, it's like it can help relax the gallbladder and the bile duct, and you kind of move things along. And I was like, okay. Also B2, if you have excess of that, your pee is like neon yellow. That was like, ooh, I'm so glad I found out about that before it happened. I would have panicked a little, but no, it's not. But yeah, so I took those. A week later, I had severe pain in the left upper quadrant, so on the other side, and I was like, I think I might be dying. It was so fucking painful. Like legit, I was like, I don't know about this. I crawled to my roommate's room and I was like, I need help. I can't talk, just I need help. And I was like hunched over and I was like, this is worse than before, but it's on the left side. I don't know what this is. And so he was like, okay, I'm gonna call 911. I was like, okay. And I was just trying to focus on my breathing and stuff. And then they were talking about this and that. And 911 was on speaker and I was trying to answer questions and whatever. And they were just like, yeah, you need to go to the emergency room. And we were just like, okay, we're gonna go. I took a Tylenol and we went to the emergency room and they did a CT scan and they were like, no, everything's fine. They also did the EKG, I think that's what it's called, like to check my heart and stuff because of like, it was on the left side and all these things. And they were just like, yeah, no, everything honestly looks fine. And I was like, why is it so painful that literally, like if I move at all, it hurts so bad. And so like when I got into the bed area that they put me in, the little room, I was like, do I have to sit down? Do I have to lay down? Can I just stay standing? Because if I stand and don't move at all, I think I'll be okay. Like I can at least think a little bit. I can at least breathe. And they're like, you need to be on the bed for us to examine you. And I was like, oh my God. And so it was so painful to like go into the bed. And I was like, at least put this in sitting position. I'm not laying down. Like this is too painful. So they put it in sitting position and it was just all this stuff. And they gave me some drugs. They gave me some pain drugs and I was like, when does it kick in? Or is it? Yeah, it was very difficult. And at that point I was just like, I am so done with like these 4 years of having these miscellaneous painful experiences either in my right upper quadrant or from my head to my shoulder to now the left side of my body. I am solving this. I am not gonna let this go anymore. Like, I'm not just gonna trust these doctors when they say everything is fine, when this has been an issue. I'm gonna get to the bottom of this. And yeah, I was just so done, you know? I was like, I thought I was dying. It was so painful. And if I'm going to die anyway, I'm gonna at least know before I die what I'm dying to, okay? And I'm not gonna wait until after the autopsy. By then you can't even let me know because I'll be dead. I want to know what I'm dying to. And so yeah, that's what turned into the diagnosis section. We're at almost an hour. Watch this. That's what I'm saying. I thought it was going to take 3 hours. We're only at part 2. Yeah, usually when like I make really long videos, I'll say something like, hope people are taking breaks or brought snacks already. I'll be honest, sometimes when I can't sleep, I'll put my own videos on just to hear me ramble about stuff. I'm just like, oh yeah, that's pretty funny. Wow, what happened? Wow, that happened to me too. Okay, let's move on. So October 2024, it was like half a year ago. That was when I had the left upper quadrant pain. By the next month, like a week later, November 2024, I had moved like to another city and I was like, I am done going to that urgent care, to my primary care, to that same emergency room. I'm switching it up because now I'm in a new city. I'm gonna be more aggressive about this stuff. And I just experienced pain so bad that I almost wanted to just die. I thought I was gonna die and I was accepting that I was gonna die. Like, ain't no way I'm gonna keep letting that happen. So when I moved, I was like, I'm getting a new doctor. I found a doctor. It's like some new healthcare system type thing. It's like where it's a bit more, I'd say, part of the tech industry, if anything. They're more systematic about stuff. They're like, yeah, you can get an appointment the same day. We'll refer you out to blah, blah, blah. And I was just like, okay, I don't like waiting like a month or two to be able to see my primary care person, because then I'm just relying on urgent care and the emergency room when I got this issue that I'm trying to solve. And so I decided to go with this other like cool, modern, innovative like healthcare place that said that they also do primary care. And I was like, sure. I like their scheduling system where I can make an appointment like the next day or the same day if they have an appointment. I was like, that's way better. And so I got a new doctor. And then at that time though, I was still kind of dealing with the left side pain. And so I talked to this new doctor person about it. And they're just like, okay, we'll prescribe you some, since it's on the left side, we'll prescribe you some like stomach stuff. At the previous ER place, they're like, oh, since it's on the left side, it might be like stomach issues. And so you should take omeprazole, which helps you like decrease your stomach acid or neutralize it. It just does stomach stuff, okay? I didn't really put that in here because it was a detour. It was a side quest that didn't really, but I took some stomach stuff, and then this other doctor was like, here's some more stomach stuff and blah blah blah. After I took the second stomach stuff though, I was like, dude, now the left side pain is like moving to the right side. Like, what the heck is all this? Blah blah blah, right? And so I went back to that place. I was like, yeah, you guys same day appointments? Hell yeah. And so it was like around midnight that happened. And then so I was able to set an appointment for later in the day. And I was like, hey, the right side's hurting now. And so she was like, yeah, okay, so I think because you went to the emergency room basically a week ago and then I saw you later and we tried this and all of a sudden it's like moving here. I think we should get another CT scan or get another like test done. I was like, but I got a CT scan like a week ago, like 2 weeks ago already. Like, isn't it too soon for that? And she's like, well, I mean, we can take the aggressive approach and get all this testing, or we can just we can just wait and see. As soon as she said wait and see, I just remembered the past 4 years when people were just saying, you should just wait and see. And I was like, never mind. If I need to get another CT scan, I'll get another CT scan. Let's go. And so it happened that they have this other thingy nearby to go, their version of an emergency room. And so I went there, and that's where they have like all the testing stuff. And I explained the situation. They're like, okay, you can either get an ultrasound or a CT scan. And I was like, what's the benefit? There's a risk of getting too many CT scans, but at the same time, like, you know, for example, cancer patients get testing all the time. You gotta weigh the costs and benefits and things like that, and like the risk and benefits. And I was like, okay, but then also the ultrasound, blah blah blah. And ultimately, I chose to just get another CT scan because I was like, it will at least look over like the left and right side. Like, why did it move? Why did the pain move? You know. So we got another CT scan, and yeah, it came up clean. And I was like, I swear to God. All this time too, I'm like getting so many blood draws. I'm getting ultrasound, and so my veins were really getting poked up all this time. It was hard to get blood. It was a whole thing. It was a whole thing. And so if you're experiencing this, just know it's gonna be a whole thing, okay? But you gotta. I'm gonna take a segue here. If you're going through all this and you're resonating with like all the things that I'm saying, just know that while it is painful, you are the only person who's going to be able to really take care of yourself. You have to advocate for yourself. You got to push through all the bureaucracy and all the patient, the waiting for appointments and all that stuff, because you don't want to live with the pain, okay? If you do want to live with the pain, then go live with the pain. But if you don't want to live with the pain, then you just have to understand the system and know that you can only move through the system the way the system works. Other people are just trying to do their jobs. They're not out to get you necessarily. It's just the way the system works. And it would take too much to untangle society and the way all these systems are created. You gotta focus on yourself. So that's what I was doing, right? I was just like, if I have to maneuver this direction to get answers, I'm gonna maneuver. So I changed the doctor. I got another CT scan. It didn't turn into anything. I got a referral to go see a gastroenterologist, okay? I was just like, if you guys can't help me as primary care or the emergency room, get me someone who will look into this. And so I got a referral out to see a gastroenterologist. The people who look at the gastro as in like the stomach, and then enteral. I believe that's with the liver stuff. Hang on, let's look it up. I don't want to be saying the wrong thing. Here, let me put it off over to the side. Enterology. Yeah, branch of medicine that specifically focused on the intestines. Okay, so gastroenterology, yeah, it considers the esophagus, stomach, colon, rectum, all the things, okay? All the things. So I was like, okay, cool. Eventually I went to go see this person. And I had to go all the way back to the other city. It was a very long bus ride. I don't drive, so like, or I don't have a car to be able to drive, and I didn't want to pay for it, so I took the bus. It was like an hour or two to get there, but I was like, I'm gonna do this. I put everything else in my life on hold. Over time, like from the summertime, from what was it, July, when I started the headaches, up until November, I was slowly having to stop everything I was doing. I was like, wow, I was setting myself up for my life to be able to do this, and this, and now it's all getting stripped away. And now I'm just like, I gotta just focus on my health then. Nothing else matters. Literally, if I die, nothing else matters. I wasn't depressed necessarily. I keep like kind of saying, oh, if I die, but it felt so bad. It really put into my life into perspective. Like, I gotta just fix this so I can continue my life, really. And so I saw the enterologist, and I explained all this stuff, the details of every year, what I experienced, the results of those things, but also the this. And he was so like logical, and he was just like, do you work in the medical field? And I was like, no. He was like, oh, the way that you're explaining it is so like methodical and logical and like backed by like medical evidence. And I was just like, oh yeah. And he was like, do you like to read? And I was like, I do like to read. He's like, that's what it is, because you read a lot. And I was like, okay, thank you. And so we got along pretty well. And ultimately I was just like, yeah, I've been concerned about whether I have gallbladder issues for like the past 4 years. And now I got some stomach issues, but I feel like that's not bothering me right now. It was bothering me for a week, but then it's moved to the right side. And so I want to know if my gallbladder stuff is now starting to spread and affect other stuff. You know what I'm saying? He's like, I know what you're saying. He didn't say it like that. He wasn't chill in that way. He was very much like, yes, that's a good theory. You know, he was very much more logical and professional. But basically he was saying, I know what you mean. And so we were gonna pivot that way, you know. We were gonna do an ultrasound again and get that situated. What I wanted with this was a hida scan, okay? When I went to see my primary care way back here in October, when he gave me the vitamins, I was just like, can I get a hida scan so I can just check my gallbladder? He was like, no, I don't think it's really that. And so that's when he gave me the vitamins. When I went to gastroenterologist, I was just like, I would like to get a hida scan because of that. And so he was just like, okay, you're currently still on the stomach medicine thing, the omeprazole. Let's keep you on that, okay, for now. Maybe it's helping, maybe it's not, but let's just keep you on that for now. We will get the ultrasound of the gallbladder. If anything shows up, then we can move forward with the hida scan and check more of the gallbladder stuff. If the ultrasound is fine, then maybe we will do endoscopy, which is where they put a camera down your throat, and they put a camera down your throat, and then they look all up in here, you know? They look at everything. They check to see if there's like an ulcer in the stomach or there's like other issues, okay? So what the gastroenterologist was saying is like, okay, we will go and look at this side, the right side, the gallbladder, the liver, and that stuff first. We'll just rule it out, and then we'll check the stomach. Based on everything that I was saying, And especially because of like my history of the past 4 years dealing with this stuff, we would just rule it out. And I was like, thank you. That's what I'm saying. Don't like, I'm so tired of other people like, oh yeah, maybe it's nice, probably not. Give me definitive evidence that says it's not. The CT scans were not where it's at. And then even I was like, yeah, the CT scans, like, they just might not catch it, right? And then even the doctor was like, yeah, sometimes depending on the angle of the blah, 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 it might not catch the crystallization of the blah, blah. And I was like, that's what I'm saying. You're a good guy. You're a good guy. And so with this ultrasound, like, I fasted, you know. I did the thing, and by fasting, it concentrates the bile. It concentrates like any situation stuff if you got stuff in there. And so I did that, and then actually when I went to get the ultrasound, I was definitely talking to the person, the technician. We're making small talk, and I was being so personal. I was being so friendly and blah, blah, blah. And it's like, yeah, I've been going through this thing for 4 years. I'm really trying to pinpoint down what's going on. It's like, it really hurts me. And she's like, oh no, like, yeah, that must be painful. You really got shit. Do you know about the hida scan? I was like, I know about the hida. I'm trying to get them to let me get a hida scan. She was like, yeah, exactly. Like, I always tell people who come in here with this problem that you gotta get the hida scan, because that's what's gonna show up really well. But yeah, let me try to get you like good pictures of the ultrasound, because the situation is the ultrasound is only as good as the technician who takes the pictures. Okay, when you get an ultrasound, they put the putty on, whatever, and then they put the little camera or whatever thing in, and then they, you know, well, it's not a camera. It's kind of like the device they put on you, so then it pipes in and then you can see it on the screen. The person has to be able to maneuver and like understand the techniques and stuff and the angles and whatever to be able to capture the picture, to be able to capture and basically find anything. Okay, and so sometimes it's like it might be uncomfortable if they're jamming that thing up into your ribs, but I'm just like, jam it in there to get the picture, bruh. Okay, if there are any stones in there or if there's sludge, I want you to be able to capture it. Okay, just do whatever you gotta do. You gotta get from the back area, that's fine. Just you know, that's what we're paying money for. So you just gotta deal with the discomfort, so they can do their jobs as best as they can, so you can get the results that actually shows on paper somewhere that you do have a problem and you're not just making up the pain, whatever. And so, flash forward, we get the results. Well, it actually took a while. Like, I had to call them like every week to make sure they got the. It was like during a holiday thing or something like that, and so it was a situation. But eventually, they got the thing, and they were just like, okay, well, there is a minimal amount of sludge. And it almost is like nothing, but they did notice that there's a minimal amount of sludge. And I was like, well, let's look. Can we get the hida scan? Can we go, just like, if there is a little bit of a problem in the gallbladder, let's go to, maybe I'm so sensitive, I picked it up before, you know what I'm saying? And then he was like, you're right, because in the actual gastroenterologist, his notes, he told, I had to talk to the nurse through the messaging system. Like, I didn't actually go back. I didn't take the bus all the way back. I was just talking to them after the first appointment. I was just talking to them through the online messaging system. And so the nurse was very nice to me and saying like, oh yeah, so we can either continue looking at the gallbladder stuff, or we can go and do like schedule you for an endoscopy to check your stomach. And then I went to go actually look at the doctor's notes, because, you know, I can read the doctor's notes at this point. Like, man, yo, hanging out in the medical studies area, you gotta learn some vocabulary. So I read what he wrote, which is that, yeah, like the sludge could be something or it could be nothing, but sometimes just some sludge can cause a lot of issues. And so just ask the patient how her symptoms have gone. Has the omeprazole helped at all? With her stomach or pain? And so I sent a whole bullet point list of all the symptoms that I still had. I maxed out that messaging thing, you know what I'm saying? And at the end, it was just like, yeah, all right, we'll send a referral for you to get a hida scan. Okay, now we're in December, finally, right? I get the hida scan. Wow, let me get some smoothie. This is the whole thing. And I'm saying, like, it's taking me a long time to tell these stories, because I like talking, but legit, in reality, it also takes a long time to get all this done. So, the hida scan. I was gonna make a slide on it, but I thought I'm probably at this point gonna be telling so many stories that it might be too much. So I just drew a picture. So, what happens during a hida scan is, well, you fast. You can't eat for a while, right? And they will add a dye into your body. And basically this dye, this radioactive dye, will go to your gallbladder. And then they will give you another thing. Either synthetic CCK, which I'm going to go over later. CCK is a hormone that makes your gallbladder contract. They either give you that, or they have you drink a fatty drink, like an Ensure. They're just like a brand of some like a nutritional drink. It's just a fatty drink of some sort. Or they give you CCK. The idea is they put this radioactive dye into your gallbladder, and then they make you contract the gallbladder, and then they time it to see how long it takes the dye to leave the gallbladder. And so what this does, the hida scan, it tests the functionality of the gallbladder. So in anatomy and physiology, anatomy is the name of the organs, the systems, all this stuff. It's the labeling of it. Physiology is what it actually does. The movement, the verb. Anatomy is more like the noun. Physiology is more like the verb of like describing what things do. Okay, and so with the CT scans, with the ultrasound, you're taking pictures of the organs. And if someone had a deteriorated gallbladder, for example, then maybe the CT scan will pick it up. Maybe the ultrasound will be able to actually see gallstones and stuff. But that doesn't always give you an idea of what's happening. It will give you particular moments in time, pictures of those moments in time. But again, if the technician taking it isn't that good, or the body is turned, like you try to lay flat and like stay still when you take these images and stuff, and they're pretty good, but there's still so much room for error. Nothing is perfect. Like the medical industry is still growing, it's still advancing, innovation's still happening, and so sometimes these things aren't good enough. The testing's not good enough. That's why we have so many different types of testing. And so the hida scan, which stands for a very long name that you can look up. Yeah, it's a very long name, but just shorten it to hida scan. The hida scan tests the motility, the functionality, the physiology of the gallbladder. Okay, instead of just taking a picture of the gallbladder, eventually you do kind of see a picture of it. It tests to see how much it functions. So you get a radioactive dye, so it will show up on the computer screen, and then you make the gallbladder do its job, contract, and you see how much of that works. Maybe I should have made a whole slide of this. But yeah, so in reality, what happens is I fasted, and then I went to the place. Like I had to take, it was gonna be like a 2 hour bus ride, but I had to go at like 7 in the morning, and that means I would have had to waken up at like 4 in the morning, and that's when I usually go to sleep. And so I was like, ain't no way that's time. So I took a car. I took a lift or something up there. Okay, and so I went up there to this like other hospital system, and they sent me to this like radioactivity room, examination room, and there was this really big device, really big thing. I laid on this thing, this platform, and then they moved the platform down, and then this huge like kind of screen, like wall, metal thingy was all up in my face. Okay, and they're just like, all right, are you comfortable? I was like, as comfortable as I can be in this situation. And then all through the side was a screen where I could kind of watch the stuff happening. Some people like just listen to music. I think in some places they might have like a TV where you can like watch movies or whatever. I was just like, I'm fine, and I just kind of dazed. I was like so sleepy, and so I was just like going in and out of like dozing off and stuff like that. But I could see the development of the thing. Like I got the injection of the radioactive. You have to sign for all this stuff, okay? So I got injected with the radioactive dye, and it's the compound's a very specific thing, and so the body knows where to send it, okay? So it sends it over to the gallbladder. It takes a while. You gotta wait a while for it to do its job, but it's honestly still pretty fascinating the way that the body just like the science compared to the body, like they figured out how to do this stuff. And so I was just like, this is pretty cool. Yeah. After a while, it was all there. All the dye was like hanging out in this little like blobby patch or whatever. And then they're like, okay, we're gonna inject you with the CCK now. And so, like I said, the CCK is a hormone that causes the gallbladder to contract. This happens normally in your body, like when you eat, when other stuff, whatever. So they injected me with synthetic CCK. It does the same thing as what natural CCK does. And then for the next 45 minutes, for another hour, like I'm not doing anything. I just lay there. I just have to lay there and be still as possible. But yeah, I just slowly watched stuff like move around and stuff like that. And then after 45 minutes, an hour, they're like, okay, we're done. And then I was basically good to go. And they're like, yeah, we'll send the results to your doctor, the referral person, like within X amount of days or whatever. And I was like, okay. Segue. Afterwards, I was like so tired because it was, by the time I left, it was probably like 10 or something, 9, 10, sometime in the morning. And I was like, this is usually when I'm sleepy. I'm a night owl. And so I was just wandering around kind of in a daze, like hanging out, doing stuff. And then there was like a little shopping area. It was very nice. I was like, damn, this place is bougie. I'm gonna hang out. There's a Whole Foods. Okay, I'll go to Whole Foods. And like I was like, yeah, because I couldn't eat like for like a while because I had to fast for this thing. I was like, I'm gonna go to Whole Foods and like, I don't know, get a banana or like, I don't know, like bread or something. So I went to Whole Foods. I got a banana. I sat in their cafeteria area and I was like, yeah, it's fine. I'm fine. I'm cool. Yeah. I was just like so chill and sleepy. And I was like, if I take a car again, I want to wake up a little bit more because I don't want to be falling asleep in someone else's car. But also, if I don't take a car, it's going to be a 2-hour bus ride back. And so I got to like make sure I'm also awake for, being able to move around and like switch buses and whatever. So I'm just hanging out in Whole Foods. And at some point my stomach starts rumbling and I'm like, yeah, get that banana, start digesting, hell yeah. But then it felt like crampy and I was like, this is just what happens after you don't eat for a while and then you finally get food, right? It's okay. Eventually, I go to the bathroom and it's fine, I just pee and wash my hands and then I leave. And I'm like, I think I'll explore a bit, There's some nice fancy shops around here. There's like Barnes and Noble. There's, this whatever stuff. And then I'm like a few blocks away, a few stores away. And all of a sudden I felt the call. And I was like, oh shit, this is literally the shit call. Like, there's like a Panda Express somewhere or like a McDonald's somewhere. There's fast food restaurants somewhere around here in this bougie area, and I'm pretty sure according to regulations of blah blah, if you're selling food you have to have restrooms for your business. So I can go to these places and use their toilet. And then I was like, you know what, I already went to the Whole Foods bathroom, I know what to expect there, I'm just gonna go all the way back there. And so I walked all the way back, and let me say, I've been learning expressions lately. I'm also autistic, and so expressions are hard for me, so I've been actively trying to learn like expressions and sayings. And there's like this saying of like radioactive stuff, like radioactive poop. And I feel like I made a pact with that Whole Foods. We're like buddies now. We're soul buddies, you know. We connected so well with each other in my moment of need. That Whole Foods bathroom was there for me, and I just have the utmost respect for that general area, in like that whole bougie shopping area. Like, they gave me the hida scan, they took care of me when I needed to use the toilet, and just like, you know, they had a bookstore, and it was really nice. It was great. And I feel like, I talked to my friend later about it. He was like, I think you're one of the few people who can actually say you literally had radioactive poop. And I was like, yeah, exactly, dude. Like, I got rid of all that radioactivity. Like, I hope no children were gonna go into that bathroom anytime. Like, when I was doing the hida scan, the technician asked me, do you have kids at home? And I was like, no. And she was like, okay. And I was like, wait, why? And she's like, well, it's just, we're putting radioactivity into you. And so, like, you don't want to hang out with kids for a few hours after you get out of here. And I was like, oh, interesting. Yeah, no, I don't have any kids. I'm going to be around any kids. And so, yeah, anyway, so after that situation, I just decided to hang out in the Whole Foods area again, just to, like, you know, recoup some energy after the situation that I went through. And then I decided to, you know, just go back just in case to the bathroom, and just, yeah. So if you get a hida scan, you should prepare for something like that. Maybe it doesn't happen to everyone, but it was a very, like, sudden experience for me, and the timing worked out, and I was like, I'm pretty sure this might have something to do with it, but I don't know. But also, this is what I experienced, okay? And so I'm just saying. And I was also glad that I didn't decide to just immediately get on the bus after I was done with the hida scan, and then I hung out in a civilized area for a bit, where there were, you know, services that could take care of things. Yeah. So that was the hida scan. Okay. A few days later, or a week later, I don't know, at some point, I get the results. I see the results before the gastroenterologist messaged back. And I saw that the results show, the results technically said everything was normal, but I saw that I had 100% EF. EF stands for ejection fraction, okay? It is an algorithm, a formula, if you will, of how long it took for the dye to move through their system, to move through the bile ducts. And they calculate that and then determine how well the gallbladder functions. Not well as in good or bad, but just like the numerical value of how much it functions. And so typically anything above 30 to 35% higher is normal. They would say is normal. And so if you get the hida scan and it is lower than 30, that means your gallbladder is under functioning. It's not working enough. You are not shooting out enough concentrated bile to produce, to help your body digest. Okay, so like, for example, like a normal functioning gallbladder will like shoot out X amount of milliliters of bile to help out stuff. And so we can say roughly around 30% of the concentrated bile is how much you want to shoot out to help digest the food that you have. And then, you know, the rest of the stuff in the gallbladder is still hanging out, you know, concentrating itself. So then for your next meal, you still have some, right? But if you're only shooting out like 5% of that concentrated bile when you're eating something, then you don't have enough bile to help digest that fat stuff, and that can cause problems. And what likely could happen, since the most common gallbladder issue is gallstones, is that you have a blockage somewhere. And that blockage, you got a blockage somewhere, and that blockage makes it so that you can't shoot out more bile. And so if you have a blockage right here and you have that radioactive dye hanging out in your gallbladder and it tries to like move through, it's just like, oh yeah, never mind. Like we're only getting a little bit of it. and so your gallbladder's not functioning very well, either because the gallbladder itself is messed up or because you have a blockage or any other thing. They're just there testing to see the number of it, the ejection fat, how much you're ejecting. So my situation is I had done a bunch of research, and I was like, when I was watching this thing, I was like, man, I don't really know how to read this that well, because there's not as much like stuff I can read about hida scans. Like the actual process of how to read the imaging and all that, I'd have to dig deeper into like the textbooks and stuff. But I do know that there are more recent studies, newer studies being done of this thing called a hyperkinetic gallbladder. Okay, we're getting there. We're finally getting to the hyperkinetic part. If your ejection fraction EF is above 80%, then there's a good chance you have a hyperkinetic gallbladder. Okay, and I have a whole other slides that go through a lot of this stuff. Okay, well, we're gonna get to it. But when I saw that it was 100%, I was like, that is clear. That is so clear. There's no questioning that I've got this rare gallbladder condition. Because it's like, if it was like, I don't know, like 60 or 70, I'd be like, I guess that's kind of normal. If it's like 80 or 90, I'd be like, yeah, it might be the hyperkinetic thing, but it might not be. It was 100% overachiever here. You know what I'm saying? I've been trying to work on my perfectionism stuff for a long time. I know I'm a perfectionist. It causes me stress, and I'm trying to learn how to chill out. But my body physically is also a perfectionist. It's like, oh shit, you need bile? I'll give you everything. Here you go. And then the problem is, if every time I eat, it gives me everything, that, one is probably why I don't have gallstones, because the bile does not even have enough time to hang out in there. But that also causes problems, because if the bile doesn't have enough time to hang out there and it's not getting concentrated, then I might have a harder time digesting fats. You know what I'm saying? Because the concentrated bile is what helps break down some of the fats. Bile itself, normal bile, will help with the fat situation, but the concentrated bile is what really helps with like heavy fatty meals. And I, for basically my whole life, have always tried to stay away from very heavy fatty meals because it makes me feel bad, my tummy hurts. But now I'm just like, well, hold up, is it because I don't have heavily concentrated bile to like help me out with this stuff now? The gears were churning in my mind. Like, I was making all these connections of like, if I have a hyperkinetic gallbladder, is that why this happened? And like all this stuff. And so at that point, I got the information I needed. I went through the pipelines. Like the gastroenterologist was just like, oh yeah, we got the scan back. Your gallbladder is totally fine, and so let us know if you want to do the endoscopy. And I was just like, okay, thanks. No, I'm just gonna wait on the endoscopy thing. I'm just gonna do it. And it was like whatever. At that point, I wasn't going in for an appointment. They were still just messaging me on like the intranet thing, and so. It's not like they were getting more money from me, and so I think it was very clear cut. All right, just cut her off. But I got what I wanted, which was the hida scan. I had the information, and so I was like, this is the path. I'm taking this path. I fucking knew it. I was like, I think it might be this rare thing, but at the same time, I don't want to be like overthinking and exaggerating and be like, oh, I'm so special, I have this like rare condition, blah blah. And I'm just like, who are you even talking to that is like talking to you like that? I'm like, well, probably all these like 4 years of doctors and like tests and stuff that say that everything is fine and normal, but honestly they're just checking for like normal stuff. But actually I got this rare thing, you know what I'm saying? I was like, damn, you got a good point. And so anyway, I got the thing, and I was like, I'm gonna start researching even more about the hyperkinetic thing. So I joined a Facebook group. I read more stuff, medical studies and Reddit things and whatever. And it was actually the gastroenterologist, even though they said the hida scan was fine, technically, because I had sludge, they were like, okay, when we got the ultrasound back, wait, hang on, let me adjust my chair. It's one of those like bar stools, and so sometimes like after you sit for a while, and I've been sitting for like an hour and 30 minutes, it like goes down. Hang on, now it's the wrong height. The bar stool, like the pneumatic mechanism doesn't work on it. Okay, well now I'm too tall. Okay, it's fine. So like back when I had the ultrasound, they were like, okay, yeah, sure, you can get the hida scan. Do you also want a referral to go talk to a surgeon? Because like if you have a little bit of sludge, which I finally, you know, the technician who did the ultrasound was able to capture a little bit of sludge. Yeah, you can just talk to a surgeon. And I was like, okay, great. And so I had that lined up. I was gonna get the hida scan like early in the week, and I was gonna have the surgeon consult like later in the week. And I was just like, man, I hope the surgeon is gonna be able to see the results of this and blah, blah, blah. So I go have a consultation with a surgeon, and she was all right, but she was also like, well, the symptoms kind of seem like questionable, but also like the hida scan does say it's normal. And so at that point I was like, she's not up on like the most current research, but at the same time, but then she was like, yeah, so let me see. And she reviewed all the stuff and stuff, and she was like, yeah, if you want to get it removed, I can remove it for you, but if you're not ready for that, we can also wait. We can basically have you sign this, and it's basically like a permission slip, and we'll just keep it on hold for like the next, you know, few months. If you change your mind, you just come back, we'll just set you an appointment because you already signed the form. But if you don't want to do it, we'll just shred it in like 6 months. And I was like, okay, sounds good, thank you. And she was like, but before you, like, let me examine you. She examines me, and she presses down on that side that one guy pressed down on, and she was like, oh. And so the thing happened again, where when I'm talking to people in public, in a professional setting, I'm just like, yes, so these are my symptoms, and this is how I feel. On a scale of 1 to 10, I would say it's like an 8 or 9, depending. And but actually right now I would say it's more of a 6 or 7 if I sit in this very particular way, you know. And so it's just like, yeah, I guess it doesn't seem like it was that bad, but maybe you can try. But as soon as they fucking touch the area, I'm guarding. I'm like, oh man, what the heck? Oh, for sure. You know, I'm not cursing necessarily, but like I'm clearly having a reaction. And so her expression, she was like shocked. She like stepped back a little bit, and she was like surprised at my reaction. She was like, okay, well, you know what? Given how you responded to the exam testing, like just like seeing the tenderness of that area, yeah, I would say let's do the permission slip, and you should just think about it for a bit. And I was like, okay, I'm gonna sign the permission slip. So I did that. But then I was also like, okay, if I end up getting surgery, I would prefer to go to a closer hospital to me. Like I ended up going all the way back to like the other city. Basically, I think it was connected to the other emergency room that I had already gone to, or I don't remember exactly, but it was back over there. Yeah, it was the same like emergency room. And so like they had information about me, but I was also just like, nah, the vibes. But also it was just so far, and I was like, I would prefer to go somewhere closer in case something happens and like whatever. And so, and I also wanted another consultation with like someone else. You know, sometimes you want to shop around. You gotta trust the surgeon, you know. And she was fine, but I didn't feel really connected, and so I didn't want to just like have this life-changing event with someone who I was like okay with, but you know. So anyway, by then that was like mid-December, and then by the next year in January, at that point I was eating bread and avocado and broth and maybe just chicken breast and yeah, drinking water. And I was like, anything else is just hurting me. Like my quality of life was like decreasing so much, but I was also so logical about it. I was like, well, what is quality of life anyway? What is it? And I think I was just so in it. I got so used to tolerating how much my life was being stripped away, that I was like, yeah, I guess it's not that bad. Do I really want surgery? And I was just like, well, what am I doing with my life? And so it was rough. And as I was trying to decide if I wanted surgery or not, and I realized there were some like mental health, emotional health, like existential thoughts going on. And I was like, I am going to try to get a therapist so I can kind of work through these thoughts and feelings as I make the decision to go get surgery or not. And even if like I end up getting the surgery, I'll probably want to talk to someone about the whole situation, because when you get surgery, you get all the drugs and you got all the pain of all this stuff, and that can cause issues, and you're gonna get emotional. And so having someone to talk to is also nice. Now, I've been trying to get a therapist for years, okay? Like since I turned into an adult, before I turned into an adult, when I was still a teenager, I was trying to get a therapist, and it hasn't panned out for me. That's a long story, it doesn't matter. But finally, I get a therapist, and it was just, we clicked. It was fine. And what I had to do was find someone who was a woman, someone who is also autistic, also has ADHD. And I was like, now I can just talk to this person like a regular person. It's not an uphill battle to fight about any women issue. It's not an uphill battle to talk about any autism or ADHD issues. 100%. She's also Asian, and so it's not an uphill battle having to talk about the things that happen in Asian culture. And I was just like, dang, that like logically it just makes sense. Anyway, so then I can just talk about like basic human behavior stuff, and then all these other things do interplay. But it's like I didn't feel like I had to work against it. That like, oh, that's just what happens when you're a woman. It's like, I know that because I'm experiencing it. Don't like dismiss me because but then here it's like with this therapist, it's just like, yeah, I know what it's like. Yeah, as a woman, sometimes these things can be hard. And I was just like, thank you for the acknowledgement. Anyway, point is, I got a therapist. And then finally, actually, I was able to get an appointment with the headache clinic. Remember that from the summer? Like, I had gotten an appointment, and then I was put on a wait list. I got off the wait list to get an appointment, and then there was a cancellation, and I had decided to when I was on all the different wait lists, they were like, do you want to be on the wait list if there's a cancellation too? I was like, put me on all the wait lists. And so I was on another wait list, and then there was a cancellation, and so they're like, yeah, do you want this appointment? I was like, yeah. And so I ended up having an appointment with the headache doctor like a week or two before my second consultation. And so I talked about the headaches, and I was like, okay. So when I made this appointment, I was going through a lot of stuff, and there was a headache and there was shoulder pain, but I'm currently focusing now on my gallbladder. Like, I thought it might be referred pain from my gallbladder, and now I'm dealing with my gallbladder stuff. And the curious thing is that when I had the headache, my shoulder was fine, but when I had shoulder pain, my headache would go away. And now I have right side pain, and I don't have a headache or a shoulder pain. Like, I don't know if that's related or it's just a coincidence, but there's a lot of stuff, and I actually have a lot of other stuff going on right now with the gallbladder, like surgery, blah blah blah. And so the doctor guy I saw, he was actually really chill and cool. And at some point we did talk about potential headache stuff we could do, but then I was just like, so there's a whole hour in this appointment. He's like, yeah. And I was like, so can we just talk about other stuff now or something? And he's like, yeah, what do you want to talk about? So then I started talking to him about all the research I was doing, like all the aggressive research I was doing with like hormones and whatever stuff and the gallbladder stuff. And it was a great time. That guy was so chill. And yeah, that was nice to just chit chat. Eventually I was like, so how was med school? Like what did you go through? Like, was residency hard for you? And then it was fun. It was fun. So that whole situation with the headaches ended up having like a more positive ending, being able to chat with this guy. At the end, we ended up scheduling me for another appointment like a few months out to see if the surgery for my gallbladder helped with the headaches, you know. So that was cool. He was really chill and cool about that. Anyway, later in the month, I have my second surgeon consult, and I had done a lot of research on this person. I was like, okay, he's got a lot of rewards on this and this. He's got a lot of experience with this technology and this and this, the different types of surgery technologies. And the hospital that he works out of is very close to where I live. And so I can basically just walk here if I'm able to walk. Okay, checking off all the things, you know. I found videos of him talking about his work. He sounds like a really knowledgeable and calm individual, which is what I would want for a surgeon, who can be calm, you know. When you're working someone's body and their organs and stuff, you gotta be calm. Yeah, I don't want them panicking, you know what I'm saying? When you panic, you can't think as well, but when you're calm, you can have higher. Sometimes people think when you're stressed out, you work with, but that's like emergency situations. So you gotta think about long-term goals, not just short-term goals. But at the same time, he seems so knowledgeable that if something did happen, yeah, I felt like he could handle it. Anyway, so I got an appointment with this guy, and it was good. He read the documents I sent, like all the things I filled out. And then when we talked about the hida scan, and I told him about the EF, and I was like, have you heard of hyperkinetic gallbladders? And he was like, yes, I know about them. And then even without me having to say it, he was like, did you have symptoms when they gave you the CCK? And I was like, oh shit, this guy knows what he's talking about. Because that is a key factor with the hyperkinetic gallbladder thing. When you get the CCK, it causes pain. In people, it can cause pain. In people with hyperkinetic gallbladders, let me preface. There aren't necessarily medical studies that are research backed to claim all these things, because studies take a long time. However, there's a lot of stories from patients and other things that have is producing a pattern of this, okay? So I knew that type of way of speaking, it's a liability thing, okay? And so when the doctor was saying things like that, where he's like, well, there aren't that many medical studies of it, but I have noticed that a lot of patients who have had this specific, so I could read between the lines because I did all of my own research. I could see that he's basically agreeing with me, but was not allowed to specifically say very specific things as a liability thing. And I was like, that's good enough for me because I know what you're trying to say. And so we were in agreement. When someone with hyperkinetic gallbladder gets the CCK during the hida scan, you have the radioactive stuff inside your gallbladder, okay? It's in there. The radioactive stuff is in there. They send the CCK, the gallbladder constricts. It squeezes up like you're squeezing a pouch, and everything goes out. The thing is, with the hyperkinetic gallbladder, the hyperkinetic part, hyper means like a lot of energy, like more like you imagine like a hyper kid, they're like all over the place. And so it's like a lot. And then kinetic comes from like kinesiology, and then it's like movement. So it's like a lot of movement, which means it constricts a lot. And what happens there is, that's why it's 100% ejection fraction for me. It constricted so much, it sent everything out. Oh yeah, I didn't finish talking about that. Most people, healthy gallbladders will send 30% of it out. It'll squeeze and be like, hey, there you go. But with a hyperkinetic gallbladder, like mine, it squeezes as if it's wringing out a rag, okay? It's getting every little drop out, and then it shoots it out. And the problem there is that when that happens, if you're squeezing a pouch so much and you're wringing it out, that can cause damage to the pouch itself. It gets all wrinkly, it's swollen, and stuff like that. And so my gallbladder basically was constricting so much, it was damaging itself. It was getting inflammation issues. And so I had constant right upper quadrant pain, and it's probably because my gallbladder was just trying to like deal with the fact it was getting constricted so much, and just like, hey, I just want to chill, and like, oh, you're eating again, okay, here's some more, and it keeps getting squeezed, and it doesn't have time to heal and stuff. And so what, so when I got the CCK injection during the hida scan thing, it's like, oh shit, you got squeezed again. I squeezed, and then it hurt a little bit, and then for like the next week my back was hurting in like my upper back side area. That was hurting a lot, in addition to the upper quadrant pain that I was already experiencing. And so the fact that the surgeon asked if I had a recreation of symptoms when I had the CCK during the hida scan, all those specific things indicated to me this guy knows what he's talking about, because I know what I'm talking about, because I spent a long ass time researching this. He knows what he's talking about. I can trust him. And like, it was building that trust. And so I was like, yeah, it hurt. And then I spent a whole week with back pain, and side pain. It was a lot. And so we talked about that and all this stuff. And then he was like, oh, let me look at your ultrasound again. Like, they didn't send it over. And I was like, oh, that's weird. But yeah, it's like from the place across the street. Blah, blah, blah. And so we did that. I left the appointment. He looked up the ultrasound, and then he sent a thingy that was just like, yeah, you want to get surgery, let's get surgery. And so I signed all the things online, and I was like, let's set it up. And then he was like, yeah, like my assistant will schedule the appointment, they'll say. And so like an hour or two later, I got a call, and I was like, oh shit, they are efficient, damn. And they were like, okay, so we have an appointment like a month from now, but also there was a cancellation, so we also have an appointment next week. And I was like, and by next week I was just like it was so soon, right? I think my appointment was with the surgeon was on a Tuesday, and then so they were saying the next Monday they were gonna have an appointment open for surgery. And I was like, oh shoot, wait, let me check. I'm pretty sure that's what it was. Yeah. And so I very quickly was talking to my roommate. I was like, because my roommate was gonna go visit his mom. He was gonna go fly and visit his mom for like a week or so. And I was like, okay, dude, like, I would like for you to be there when I have surgery and also help take care of me after the surgery. But they're saying either in a month or literally next week. And he was like, well, what do you want to do? And I was like, I'm in so much pain, I just want to get this over with, but I also feel like maybe a week is like not enough time to like take care of everything I need to take care of. And he was like, okay, well, if you want to get it next week, I can just postpone my trip with my mom, and I'll just stay here, take care of you, and blah, blah, blah. But if you want to do it like a month from now, that's also fine. You have more time to blah. And I was like, I really want to do it next week, but also I don't want to stress myself out. So maybe I should just do like a month from now. And then I went back to the call with the lady, and I was like, yeah, I'll just do next month. And then, so we got the financing and stuff. And then my roommate was like, oh, I'm surprised. I thought you would have done like next week. And then I was like, yeah, I don't know. I'm a little stressed out. It's too sudden. It feels like too sudden. But I have to do this, and this. And then I took a moment, and I was like, actually, I have like 6 days to do that. I think I can do that. I can do that all in 6 days. And then he was like, okay, do you want to take some time to think about this a little bit more? And I was like, okay. And then I ate some food. And then a few hours later, like, he was getting ready to sleep, and I was just like, hey, can you postpone your trip to see your mom? And like, I think I want to try to get it done next week. And he was like, okay. And then I was like, wait, don't postpone your trip yet. Let me just make sure, like, I mean, they called me at like 6 p.m. and so I'm pretty sure I was like one of the last people they called. And so if I send them an email now or call them early in the morning, hopefully no one else took the appointment time because it was a cancellation. So I sent an email, and like in the middle of the night, and I was like, hey, I was wondering if you still had that appointment available. And then in the morning, I was gonna wait until like 8 a.m. to call, or like 9 or something, to try to call as soon as possible. But then they called me. Like, I stayed up, you know. I'm usually sleeping in the morning, but I stayed up to try to just get this all lined up. they called me and they're like, hey, saw your email that you're available for the test. So I'm just confirming that you still want to get the appointment. And I was like, yes, I do. And then she's like, okay, well, it's all good on our end. I just need to confirm with the hospital that they can still give us that slot. And so I'll send you an email about this and then send the packet, blah, blah, blah. And I was like, okay, sounds good. Sounds good. And then a few hours later, I got another call from like the nurse at the hospital, and they're like, sounds like you're getting a surgery, so you gotta put it in. And I was like, okay, yes, I'm putting it in. And then these whole other things, and then I just added it to the list of things that I needed to do to prepare for all that. And then afterwards, I told my roommate, yeah, it's penciled in, dude. And he was like, okay, I'm gonna reschedule my plane flight to my mom, and I'll tell my mom, and then I spent the next week just doing all that stuff. Wow. Finally moving away from the slide. Incoming wall of research. Okay, this is gonna be a whole thing. Okay, this is a lot of stuff. Hang on. Like, I mean, I talked about some of this stuff already in the previous stuff. Oh, we're almost at 2 hours. This is what I'm saying. Like, I talk too much. That's a smoothie. You should take a break too. Like, get a snack if you're still watching stuff. I knew that I was gonna be like this and like continuously talk and like, and so I've been holding off on recording this thing for a few weeks because like I was recovering from COVID and I was still like coughing. Like I'm still needing to like cough up some mucus from my lungs, but it's a lot better now than it was like a week or two ago. And so yeah, I wanted to wait on that. Wow. This is a wild slide. Oh, I was hyper focusing though when I made it. I was like, they need to know this and this. No. Oh god. This is gonna be sciencey terminology. I think I mentioned this before. The gall means bile, okay? Col also means bile, and gall. All these things basically mean the same thing. And they all come from like other old languages and stuff, okay? They just, like in the medical field, they use certain like language, and then in other medical, but not specifically the hospital setting, they use different language, and then in like common people terminology, they use different language. And so that's why you got a lot of different things that basically mean the same thing, okay? But all this means is the digestive fluid produced by the liver that helps digest fats. That stuff that I've been talking about this whole time. Okay, let's go down this side, because I remember this is like the way that I started talking about it. A cyst is a sac. I talked about that before. Similarly, a bladder is like a sac or a pocket, okay? But in this way, we're calling it a sac. Oh, a sac here. So col, which comes from here, bile, gall, okay? So the fluid stuff. So the col sac, the cyst is a sac, so the col sac, okay, is relating to the gallbladder. The gall is bile, the digestive fluid, the stuff. Bladder is a pocket or a sac. And so cholecyst basically is the same thing as gallbladder, okay? In regular people terms, we say gallbladder. In medical field terms, they call it cholecyst, okay? Itis, I've talked about, is inflammation. You can add this to all sorts of things at the end, and it just means inflammation of that thing you've attached to. And so here, cholecyst, relating to the gallbladder, itis, cholecystitis, is inflammation of the gallbladder. Okay, this is all making sense. You gotta put the puzzles together. Ectomy means surgical removal. You get surgery and they remove something. So cholecyst, relating to the gallbladder. Ectomy means gallbladder removal surgery. Okay, it all makes sense now, right? We're going here. I might be pronouncing these things wrong, but this is like, I watch so many videos, and sometimes, I'm listening to American doctors, sometimes I'm listening to British doctors, sometimes I listen to Indian doctors, sometimes I listen to Asian doctors. They all pronounce things a little differently, and so I'm just going off of like the general vibe of what I hear people call these things. Cholecyst, okay? If it's wrong, it's wrong, but it's in writing, and so argue with me if you want. Don't argue with me. If you're gonna argue with me, I'm just being like, okay, but also I don't care. Okay, some other stuff. Biliary biliary relates to organs and ducts that transport bile. Okay, bile, you know, like that is related. Okay, and so we have bile ducts, but then we have biliary that includes the organs, like biliary organs and like whatever, all this stuff. Okay, and so this just relates to the stuff that is involved with the bile. Common gallbladder, gallstones, I talked about that. Sludge, I talked about that. So biliary, okay, relating to the organs and ducts that transport bile. Dyschensia. So dyschensia, we're gonna break that down. Kinesia, okay, is movement. Like people who get kinesiology degrees, and then they become physical like therapists, or they become physical education teachers. Kinesiology has to do with the movement of things, the muscles and things like that. And then here, this, if you add it at the beginning, this, it means it's not good, it's abnormal. This is different than what most people experience, okay? It's not good. And so when you have biliary dyskinesia, however you want to pronounce it, I've been pronouncing it dyschensia, but it could be dyskinesia. I don't know, it doesn't matter. Biliary dyschensia, okay, that's what I'm saying. You can look it up somewhere else. But that means that the movement of the biliary stuff, the organs and ducts, is not good, okay? And so that's where we're getting, you need the hida scan to test the actual functionality of the gallbladder, rather than just a CT scan or ultrasound, which just takes a picture of them basically. Different ways of taking pictures. The hida scan shows the actual movement of stuff, and this is where you're more likely to get a diagnosis of biliary dyschensia, where the movement's not good. Okay, but then we break it down from there. Hypokinesia is more common. Hypo means not a lot. Hyper means too much, okay? Like if you have hypothyroidism, your thyroid's not doing great. It's not working enough. If you have hyperthyroidism, your thyroid is doing too much. I bring up the thyroid just because I think most people know about thyroid stuff, right? It's a common thing too. There are issues. And so with this, hypokinesia, biliary hypokinesia, means the gallbladder is not moving a lot, okay? Not a lot of movement. But then you get this other one, biliary hyperkinesia. The movement is too much, it is doing too much, okay? So the organs and ducts that transport the bile, related to that, the movement of it is too much. Like mine, where I had 100% movement, okay? I shot out everything inside the gallbladder. Everything was removed. All the radioactivity stuff, that the dye that they put inside my gallbladder during the hida test, the scan, like it removed all of it by a certain amount of time, and then they calculated the ejection fraction. And so this is a more rare one. Biliary hypokinesia is more common, mostly because you probably got some stones or sludge like stuck in there, or some other issues are like happening inside the muscles or the ducts and things like that. This seems a lower ejection fraction. Like some people get like 0, so there's no movement. Some people get like 10 ejection fraction. That means it's like spluttering a little bit of bile out. It's so, you know, and so there's not that much movement. This is, if you have, from what I have read of the stories of all these people, and also medical industry, all this stuff, from all the research I have done for all this for myself, I've noticed that it's more common if people have movement issues, that they'll have the hypokinesia problem. If they don't have gallstones or sludge or whatever, and it's only a movement issue, like the functionality itself of the gallbladder, it's usually the hypo one. What happens is it can cause the cholecystitis, the inflammation of gallbladder. Like both of these, anything that has to do with the movement usually has to do with then the muscles of the stuff. And if the muscles are having issues, usually it's inflammation issues, okay? Inflammation. And so a more rare condition is the biliary, the organ stuff, hyperkinesia, which people then call hyperkinetic gallbladder, because it, you know, instead of saying kinesia, kinetic, hyperkinetic is, yeah, gallbladder. You know, you say it like that. This can turn into the cholecystitis, so it can turn into inflammation too. because you're like constantly constricting and things like that. So that's where we're at. And it's rare only mainly because it's like it hasn't been given a proper diagnosis or name. The medical studies, the formal like process of getting a formal diagnosis of this, giving this a name, that the medical field takes a long time, okay? Science takes a long time because you got to cross-reference this and that. And so when I read about people being like, shouldn't the doctors know? Dude, the doctors are humans too, okay? Collectively, it takes a long time for humanity to push the bounds of stuff, and it is amazing that we've gotten this far already, that we can fix issues like this instead of just letting people die from it like years ago, okay? And so the name itself is only starting to pop up. And so some people, this is the whole correlation versus causation thing, okay? Some people are just like, oh, they only recently started diagnosing hyperkinetic gallbladder. It's probably because of COVID. It's probably because of this and this. If you really read through the studies, okay? If you do retroactive studies, you can see that there are people who had very similar symptoms, who had the very high ejection fraction, like scans done, their hida scan results, and they had to remove their gallbladders because of But back then, like a decade ago or 2 days ago, they didn't have this name, okay? They were just like, well, it's normal. Everything comes back normal. But, you know, the person was in so much pain, we decided to remove it anyway. It turns out it was inflamed. And it was just like, and it's like, oh, that was curious. Okay. But after so many curiosities over the course of decades and having further scientific research done and like better tools and just more anecdotal, like, experiences, it's just like, you know what, kind of noticing a pattern here. And then that is when you gotta figure out how to get funding and then let the scientists be curious and figure out, is this actually a thing that's like happening to a bunch of people over a broad spectrum of ages and races, ethnicity, like all over the world? Yeah, that stuff takes time, okay? So anyway, listen, I don't know that much about COVID either, but the first time I caught COVID was this month. It was not great. That's a whole separate story. But I did not catch COVID and it caused my gallbladder issue. That's what I'm saying, okay? That wasn't my problem. It was something else going on. Maybe other people catch COVID and then it causes some stuff, but what's more likely is that there was already these problems happening. The reason why I brought up my whole background here from age 19, 21, all this stuff is because the stories that I've read about other people having hyperkinetic gallbladder issues is that they also had a history of basically a decade of random situations happening, inflammation of this, and this, and they're just like, I don't know what this is. And then they have their gallbladders removed and all of a sudden, all these things go away. I thought I couldn't have dairy. Oh, I can have dairy now. I thought I couldn't have this. I can have this now. Like, it just changed my whole digestive system. And so, yeah. Again, I'm not a for real scientist. I'm not a for real researcher, but I'm noticing some patterns here that, yeah, there's some people who have very similar issues of me, and then eventually it points to the gallbladder, and then it's not even the more common gallbladder issue. It's not gallstone. I didn't have any gallstones. These other people didn't have gallstones either. It's just a motility issue, the kinesia issue, the kinetic issue. It's too much. We're doing too much. It's getting inflamed. I'm not holding back. I'm sending all the bile. That's causing so much inflammation. The whole sac, the whole gallbladder is like getting messed up. It's causing pain. Okay, that's what I'm saying. That's what this whole thing's about. We're breaking it all down, and then it's just so whether it's a rare condition or not, you know, eventually this might turn into one of the common gallbladder issues. I think the gallstones is still gonna be kind of the top ranking one because that seems to still be high up on there. A lot of people get gallstones, but this muscle issue, the kinesia issue, seems to be picking up. I think they're able to have better testing, and doctors are slowly becoming more knowledgeable about this stuff. The thing is, primary care, you go through your schooling, whatever, and then like every now and then you do the conferences and whatever to maintain kind of like keep up to date with stuff, but not everybody has a lot of time to be researching all the like most recent up and coming blah blah blah, blah, blah. And that's why you get referred to specialists who will go read specifically about the stomach, specifically about the gallbladder. Surgeons who specifically have to learn about this, and this, because they're actually going into your body to do this and this, okay? So it just takes time. And so I think what's causing me to say all this like this is that when I was reading all this stuff, there was just so much like vitriol and like projection of like emotions towards the medical field. And like, listen, the healthcare system, the way that it's structured itself, yeah, it's got some problems. Insurance is this, the whole thing has got some problems too. But the scientific community, my heart goes out to them, because it's like they're doing the best they can with what they got, okay? It's not easy creating new tools. How long did it take for humans to make that one rock axe, hammer, wheel, whatever, make fire, you know? It took a while. And now we've advanced to the point where it's in, and it's just like, oh yeah, it's taking a while, but eventually I'm gonna find out how to find the receptors of this very specific cell that's in this very specific area of the body that does this that nobody cares about, but actually I realize that this is the impetus of this, and this is why you've been sick for the past 20 years. You know, like that kind of stuff takes some time to sit down and think and research and all this stuff. Okay, so that's what I'm saying. Like, let the people do their work. Don't project all your emotional stuff on them, because then it takes away from the work. And there's, but at the same time, if you gotta vent, okay? But there's just it's a whole thing. I'm more logical than emotional. I'm working on it. But like, man, look at this. I wouldn't have been able to like make this whole slide if it wasn't for humanity's like researchability, you know? All this stuff came from people cross-checking each other and doing all this stuff. It's very fascinating. Okay, incoming more research. Walls of text. Okay, this stuff, I'm not gonna read through it, but you know, you can pause and read it if you want. I will go over basically the situation. This was after I got the hida scan. I was talking to my friend about the research that I thought about and how things basically came to be, possibly. And so yeah, if you want to pause and read this stuff, that's cool, you can do that. I'm also going to just share the link to this slideshow, so if you want to read all that. But basically what I was writing and all that is, I was wondering, if I have a hyperkinetic gallbladder, why? And so when I did the hida scan, when they gave me the synthetic CCK, which is a hormone that makes the gallbladder constrict, why was my gallbladder so sensitive to it? Because I'm going off the idea that my gallbladder is sensitive to CCK, which is why it constricts so hard, okay? And so I did some further research, and one path I went down, one hypothesis is that PG is progesterone. If you have a high amount of progesterone, it makes it so that your body is less sensitive to CCK, which means if it's less sensitive to CCK, the gallbladder movement, this is what I shorthand, goes down. Higher progesterone, gallbladder movement goes down, that means more gallstones. I put GB for gallstones, gallbladder stones, okay? This tracks with the idea of the pregnant women. When you are pregnant, the body creates more progesterone to create a hospitable environment for your child. It's very much required. Honestly, I'm pretty sure most people who get pregnant get put on progesterone pills and stuff to maintain that for their baby and stuff. And so a higher level of progesterone means less gallbladder movement because CCK will be less sensitive. And you want to know how? Okay, well now you got to read up on all this stuff. But there's a lot of like biochemical stuff going on with receptors and things. I won't get into that. It's too much. It's too much for this. We're already at 2 hours and 13 minutes. Okay. But yeah, so less gallbladder movement means the bile just hangs out in the gallbladder because it's not getting pushed out. It's just hanging out there. And remember, when the bile just hangs out in there, you're sinking into the couch. You got paper plates hanging out on your gut. You got laundry placed on yourself and you're just like, you know, getting crusted in there, and it hardens and it turns into stones, okay? Conversely, if you have less progesterone, then gallbladder motility goes up, because now the progesterone is not holding back the CCK. Progesterone here, up here, is holding back CCK, and it's like, nah, don't, we're not gonna be so sensitive about this, okay? Let the gallbladder just chill. We're gonna chill. You chill too much, you get gallstones, probably. But progesterone is low. Gallbladder is like, yeah, I'm just gonna be as sensitive as I wanna be. CCK is all up in here, and it's like, okay, let's move it, let's do it. That means you have less bile inside your gallbladder, because now your gallbladder is pushing it all out. You get a little bit from the liver, and it pushes it all out. Like me, I had 100% ejection fraction, you know? I pushed everything out instead of just 30% like a normal person. It's more forceful contractions because I'm more sensitive. And it's like, oh, okay, I should do this a reasonable amount? No, I'm very sensitive. I'm gonna go all the way. I'm gonna do 100%. I'm gonna be a perfectionist. I'm gonna give you everything. And that causes less bile. And so, well, maybe that's why I don't have stones. I don't know. I'm not a scientist. Maybe. Now, because of this, I'm just like, well, I'm not pregnant. I probably have a lower level of progesterone, though, if we're going off this thing. My situation is I got probably less bile, hyperkinetic. I have less bile in my gallbladder. I have more forceful connection. That's probably this situation right here. Why? Why is my progesterone level so low? Well, it turns out, you know, for one thing, I have, like, for the past few years, like 5 years or something like that, I've tracked my mood swings, my physical symptoms, and blah, blah, to my menstrual cycle, and blah, blah, and it just seemed more so than what most people would say was their issue with, like, regular PMS, premenstrual syndromes, and things like that. I found out there's a thing called PMDD, which is premenstrual dysphoric disorder, something like that. It's shortened for PMDD. And it's more just like, it's a heightened PMS situation. And the thing is, people with PMDD who have these more heightened symptoms before their period seem to have less progesterone. There's a hormone imbalance. When you have less progesterone, it could be that you have estrogen dominance. By that, it means that the delicate ratio between estrogen and progesterone, which are two female hormones that interplay to help take care of the body and things like that. If you have way more estrogen, then that causes some issues, and it causes this estrogen dominance. And so it's like, when you get tested for your hormones, your estrogen might be in the normal level, your progesterone might be in the normal level, but the ratio between them could be off. And it could be you have estrogen dominance, and that can cause PMDD or whatever. You know, they're still doing research. You know, women's health research is not all up in there. You know, it's because we live in a patriarchy, and so they're still trying to do research on it. Okay, but basically, this is where we're at right now. The theory of all this. I got PMDD, probably got estrogen dominance, therefore my progesterone is low. But also, it turns out, living a stressful life, had a difficult childhood, struggling with this and that, found out I'm autistic, got ADHD, when society doesn't necessarily like accommodate that variable, it's been a little stressful. I might need more cortisol to deal with all this stress. If I need more cortisol, how does that affect progesterone? Turns out the mechanism, if we break down these molecules, the ingredients to create cortisol and the ingredients to create progesterone and like other hormones, all kind of come from the same thing. And so there's research here, you know, if you want to read through all this stuff, like, if your body is going through a stressful situation, if you're digesting food and then you encounter a tiger, your body is going to be like, digesting food is not going to matter in an hour if we're dead. We're going to divert energy somewhere else, to the flight or fight response, the stress response, and we're either going to fight the tiger or we're going to run away. Okay, that's more important than digesting food. And so you use your cortisol, you use your adrenaline, you use a blah blah blah, and you run away. Okay, And at this point, you just got undigested food hanging on your digestive system. That doesn't matter. Who cares? And so when you're in a very stressful situation, your body switches. Yeah, you know, like the parasympathetic, sympathetic system. Yeah, those things. Okay, I won't get into it, but like when you end the stress response, you prioritize certain things. Making babies does not matter when you're trying to run away from a tiger. You know what I'm saying? And so if you're stressed out, the ingredients that would go to make progesterone to help create an environment for babies to grow and stuff, it gets diverted. It's like, nah, dude, we need more stress hormone to help deal with stuff. We're gonna make more cortisol to deal with the stress, as opposed to using these ingredients to make progesterone. It's all up, it's up here. You know, you want to read about it, it's up there. Just, yeah. But yeah, it comes from like cholesterol and stuff. Some of it breaks down to this and this. They're very long-winded names. It's very hard to pronounce. But yeah, it breaks down. But this is the TLDR. Okay, I labeled it like that. So it could be that due to my very stressful like situation in life and whatever, my body has naturally diverted a lot of my stuff, the ingredients of stuff, to make more cortisol. And therefore I have less progesterone. I have a hormone imbalance where I have estrogen dominance and I got PMDD for whatever reason, maybe because of the cortisol. I don't know, something weird. But it leads to me having lower progesterone. And if I have lower progesterone, then that means I don't have it blocking the CCK, and then the gallbladder is just contracting as much as it wants very forcefully. All the bile is getting sent out, and now the gallbladder is just this empty sac and it's all shriveled and it's inflamed and stuff. That's what I'm saying. Also, I want to mention the cortisol thing. If we go all the way back here, we go all the way back to my history thing. When I took hydrocortisone for my skin stuff, this is why I added it. Hydrocortisone is essentially synthetic cortisol, okay? It's synthetic stress stuff, stress hormone stuff to help you deal with like skin issues, like rashes and eczema and stuff. Some people, you know, you use it and it just works and it's fine. But some other people, you use it, your body gets used to it. As soon as you stop, it needs more. And so then they're on it long term. And the medical field is kind of, the healthcare field is kind of like, yeah, just keep using it, it's fine. And it's just like, there's no long-term effects in that. But actually, you know, there's some people who've been going through some stuff and they're like, actually, I think there is long-term effects about that. That's a whole separate story. Maybe I'll make another video about it. I don't know. But like, it's just, yeah. Let's just say here for like 7, 8, whatever years, I was using synthetic cortisol. And then when I had thyroid issues, I was like, hormones are a big deal, you guys. Like cortisol and like the thyroid hormones interplay like this, and I'm gonna stop this. And so this, I'm not trying to say anything specifically, but I'm trying to just put this all out there. I might have had some hormone issues because of my stressful situation growing up, and I needed some help with the cortisol, and so I took some cortisol for my skin stuff, and then maybe that helped me out for a bit, but then I needed more, but I didn't want to take more because I was like, this might cause issues. And then all of a sudden, you know, I had some issues, the withdrawal symptoms and stuff like that. And then now my body's just like trying to make some natural stuff, and then my progesterone's gonna, it's a whole thing, you know, there's a lot going on here. There's a lot more to research, but at this point, I'll read this. Now that's all fine and fair in theory, all the things I just talked about. The other current issue is if the gallbladder is still so inflamed that it will cause further damage. This is something I'm still trying to resolve. Technically, multiple CT scans and ultrasounds did not catch the imaging of inflammation. However, all my symptoms tell me something is going on, so I'm covered that. Okay, basically what I'm saying here is, okay, now I might know what's happening, but if my gallbladder is basically dying, none of this really matters. The why is interesting to know in theory, but I have to take care of this. If I found out about all this stuff way back when, you know, maybe I could have solved it. Maybe I could have adjusted my lifestyle so it wasn't so stressful. Maybe I could have finally found a therapist way back when and like worked through some stuff when I was a kid. All of this stuff, but it retroactively, it doesn't really matter because I have an active inflamed gallbladder that needs to be taken care of, and it doesn't get taken care of, and it gets gangrenous, okay, and it dies. That can cause issues, and I go septic, and then my other organs start dying. That's the immediate issue. And that is something that I was just like, this is what's important. The logic points to this, 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 and this, but this is what's most important, okay? I have to make sure that, well, this is also why I needed therapy, because I was just like, I have to make sure I do what I can to still survive. But then I was like, for what though? If I'm learning about all this stuff and then like I remove a whole organ, and that, what if that changes who I am, and it got existential, and I'm just like, what am I still living for? And then that's just like, I need to talk to someone about this stuff, and I'm going existential like that. And so at that point, all of this was nice, but it didn't matter to me. So yeah, I prepped for surgery. You know what I'm saying? I prepped for surgery. Okay, wait, snack time. It's a whole thing. Y'all watching all this like in real time? Oh. The whole thing. Now my whole vibe when I make videos is definitely like, y'all, we're gonna just chill out and hang out while I talk about stuff. Usually I have my air filter on, but I decided to turn it off so that the audio wouldn't be so loud and crackly. Alright. I just feel like these days everything's so edited with like filters, and people like literally edit like out their coughs and sneezes and like car noises from the window, and like their cats walking in and out. I don't know. It's kind of nice to just like have something that's like continuous, and it makes me feel more genuine. I tried fixing my audio for this thingy, and that was the whole situation. I was just like, it doesn't sound like me, and everything sounds choppy, and I sound like a robot. I just want to like be genuinely myself. Is that's where we're at, you know? I'm having my snacks, I'm having my food, I'm telling long ass stories. Like the whole situation. And we're just vibing. Learning about science and learning about things people go through. Now, it's not that there's necessarily anything like so wrong with other people making content where they like, you know, edit things. Like, dude, editing is such a big part. I was talking to my roommate the other day. Editing is such a big part of whatchamacallit? Man, I should have made a slide where it's just like intermission, like breakdown while I have my snack. Editing is such a big part of creativity. Sometimes you don't want to hear someone's unfiltered thoughts. When they like curate, when they refine it, then you get, you know, like good stories and whatever. But I don't know, social media has curated a little too much. And so you don't get to see as much like authenticity. People just live in their lives. It's like let's go to the park, but don't like chop up the video into like 50 segments. Let's just kind of just sit in the grass with you. Oh, look, there's a bird. Yeah, like sometimes I'll turn on one of those cat videos for my cat where there's like a bunch of seeds and just like squirrels are coming up and birds coming up, and I'm just like, this is just nature, like unfiltered. It's just happening. Oh, another bird came up. All the birds are fighting now. You know, it's just, it's nice that it like slows down everything. And I feel like that's what I need in my life, to just like slow down and be more present. I'm eating shrimp chips right now. Y'all ever had shrimp chips? Yeah, Calbee brand. It's an Asian snack. My roommate was like gonna go hang out with friends today. And he was gonna go up north to like, he was gonna take like 2 buses up north to the area where I had my hida scan. And I was like, dude, that's where that Whole Foods is. We're buddies. That's a good vibe. That's a good place up there. They take care of you. That's nice. You gonna hang out up there? And I was like, maybe I'll go too. I want to hang out. I want to see that Whole Foods again. But then I was like, actually, I don't really want to sit on the bus for 2 hours right now. Also, I wanted to record the gallbladder video today. And yeah, that's probably gonna take at least 3 hours. But yeah, so that was nice. It was a coincidence that he went to that area. He's there now. And yeah, I'm talking about this. Okay, let's go. Surgery stuff. So, pre-surgery prep. Because I was able to get the canceled appointment, I had 1 week to prep all this stuff. And so some people have to wait like months to be able to get their surgery, and so you know, whatever. But like, it's all pretty much the same though, depending. Like, regardless of how much time you have to prep for it, these are some of the things that I did that really helped me with like post-surgery stuff. So I got a bunch of broth, like simple foods to eat, like applesauce, some crackers. I got these like rice crackers. That is strictly just rice cracker. It was at Whole Foods. I think it was expensive there, but like I was really trying to go for very bland, very simple things with ingredients that I could read and things like that. And so on the back of this box, it was just like, it's just brown rice, and then they like pressed it into crackers, and I was like, okay. Whereas usually I like Ritz, you know, but then that has like a lot of fat and like salt and like all that stuff. And so, but I was just like, I don't know how I'm gonna feel after surgery. I just want to go as basic as possible. Also at that time, remember, I was decreasing my quality of life, and I was just having like a bread and avocado and like broth and like chicken. So I had the broth, and I was like, maybe I need applesauce though, because like I could get some more calories. Like if I'm not gonna be able to eat like, you know, solid foods, then at least applesauce will have a lot of sugar and it can help give me some calories. Things like that. There's other stuff, but like that kind of stuff, like mashed potatoes and things like that. I got Miralax, which is basically like a laxative. It says lax right there. And so after surgery, you'll have some digestion issues. And so I was like, if I get constipated and I need to loosen it up, I got the Miralax. If it's a little too loose, I got the Metamucil, you know, to help tighten it up. Yeah, but then Metamucil also can help make things right, you know, things like that. I got Tylenol. Oh, there's a comment right here. Tylenol for some general pain. Okay, these type of things. Other people might get other stuff like psyllium husk, or I don't know. There's other like health thingies that people can like, you can research and stuff, but basically stuff for constipation and stuff for diarrhea. Okay, that's basically the, and then stuff for pain. That's what I got. Other supplies that kind of goes outside of the boxes. I got a cane for myself because walking is very important after surgery to help remove gas from the surgery. And I also got this Rollator. It's like a walker, and I thought it was cool. Usually old people use it, but I was like, I don't care, and so I went to, it was a whole thing. They were very expensive, like $300 and up and things like that, but I found one at Goodwill for $25, and I was so proud of myself for finding it. And because I went to the rich neighborhood, you know, you want some street shreds, like if you go to the rich neighborhood and you go to their thrift stores, you can get some really nice stuff. And so I went to the rich neighborhood, went to their Goodwill, and I found this walker. The thing is, nearby was a health care store that had a bunch of walkers. And so I was like, I want to go visit that healthcare store and look at their walkers, but I'm also going to swing by the Goodwill nearby thinking maybe someone would dump their walker here while they bought a new one. And lo and behold, there was a walker there, and it was a nice one. It was a little dirty, clearly had been used for a while, but I was like, I can clean that. My roommate can clean it up for me. Hell yeah. It was they got this like leather stuff and shit. It was really exciting because when I had done the research online, okay, so this is the part where, you know, if you haven't noticed in the past 2.5 hours, I really ramble and get into side stories here. When I did the research online, I looked at all the different types, and I found this specific model, the Nitro model, okay? And I was like, this is nice, but this is super expensive. The wheels are thicker, it has a basket, it folds up, but I was like, dang, I don't know about this. And then definitely when I went to the healthcare store and they had some, I was like, this is too expensive. But $25 to then just have to have my roommate clean it up for me, hell yeah. So I bought that. Anyway, so I had the cane and the walker, the Rollator, and then we prepped up with some ice packs, hot packs, heating pads and things like that. And I decided to get a voice recorder because I like documenting things, and I was like, I don't know if I'm gonna be able to like use my phone and type or like do anything, I'll just get a voice recorder and we'll record things. And because I was also like, I kind of want to know what I say after I get out of anesthesia. That's usually the thing people used to like get recordings of, like after they get their wisdom tooth taken out and things like that. And so I was like, okay, I'll give my roommate the voice recorder and then like he can record and sort of like when I say stuff. It was pretty funny, that some of the stuff I said. Anyway, and then I got a bidet. So when my roommate went to Japan a few years ago, he was like, dude, bidet is where it's at. And I was like, I can get down with that. I go, yeah, we can get bidets. But then we never really did it. But then I was like, dude, it's time. It is time to get a bidet for the apartment. Let's go. And so, yeah, we got a bidet. And then he was like, you know what? I'll set it up in my bathroom and you can try it out. In case you don't like it, then it's in my bathroom. Because he really wanted a bidet for himself. And I was like, okay. So he got the bidet and he set it up. And I was like, I want one in my bathroom so I don't have to go to your bathroom all the time. And he was like, okay, I'll do that. And so, yeah, that was the situation. We now have 2 bidets in the bathroom. And oh my God. Later, let me talk about the bidets though. And okay, so then I prepped my like work and school. So, you gotta like take some time off and like get yourself situated and all this stuff. People say you gotta tell people you can take time off and like not talk to them and whatever, all that stuff. So I had a week to prep all that and I went and did that. Okay, moving on. The day before surgery, definitely could not eat after a certain hour, and I had to shower with this thing called Heavy Cleanse. Okay, it's a cleaner thingy. And you can buy it over the counter, but they very specifically like use this in it. And so with surgery, when they cut you up, you don't want any of that bacteria and like other stuff sitting on top of your stuff to get into the body. Like that's literally what your skin is there for, to like not let that stuff go in. And so what this does is it cleans up a lot of that stuff. So the day before you clean yourself with this, and then the morning of surgery you clean yourself with this again. And so at some point, after a certain hour, I couldn't have food. And then the morning of, like solid food, I couldn't have certain liquids. And this is really dependent on what time your surgery is. And so the nurse would call like the day before, but since my surgery was on a Monday, they called the previous Friday to tell me about like the time, like because they had to, because of cancellations and like organizing staffing and all that stuff, they try to let you know and confirm it as close as surgery as possible. And so Friday was when they were able to confirm, okay, you're locked in for this time for surgery, and so that means from this time is when the cutoff is for food, and this time is the cutoff for liquid. The thing is, if you don't abide by that and they find out about it, they're gonna cancel your surgery. But don't lie about it, because there's a legit reason. If you're gonna lie about anything, don't lie about this, okay? It's important to follow the food liquid rules for safety. They will cancel it. The reason is, if you have any food stuff in your stomach and you get anesthesia, and like all this other stuff, whatever, some of that food stuff can get backed up. If you have food stuff and other things in your stomach, that can get backed up here, okay? It goes up, and I didn't draw the other one, but then it can go up your esophagus, and then it can go down your other pipe and go into your lungs, and you can just choke on that stuff, okay? And nobody wants a choking patient while they're digging around your abdomen, okay? And so you have to abide by this. They don't want you to have issues and stuff. And then if the stuff goes all over the place, it can cause more swelling, and then like they might have to maneuver this and the organs and what. And so really that's why. It's a precautionary thing for safety. It's not them trying to like, ruin your life like some people say. I'm so hungry, they're ruining my... Okay, you're being a little dramatic here. Listen, it's for your safety. If you eat because you don't want to ruin your life a few hours before surgery, and then they're doing surgery on you, and then that food gets all over the place and it chokes you to death, you ruined your life by eating. Okay, I'm just saying. Of course they're gonna try to like deal with it and like make sure, but like they shouldn't have to deal with that. They should be focusing on what they're actually there for. You know what I'm saying? So it's like I'm spending more time talking about this because it is such a serious thing. Because I would read about people complaining about all this stuff, and I'm just like, all the things you're going to complain about, you're going to complain about this. But at the same time, you know, now I'm reflecting, maybe it's one of those things where it's such a non-issue that it's easier to complain about it than some of the more serious things to complain about. And so I guess people do things like that. Okay. Anyway, point is, it's important, the food and liquid situation. Okay. So my situation, I'm getting crazy with the slides. Okay. So when I was in the hospital, we ended up walking there. I used my walker, the roller tour, and we walked to the hospital. And we get into the check-in area. Okay, this thing is happening where I'm like visualizing everything that happened. I'm trying not to give all the details, like the high chair that I wanted to sit in the lobby. Okay, you don't need to know all about that, but like, it was okay. So you know how involved I get in my stories. Oh my god. So we go to the check-in area. I check in, my roommate goes to sit down, and then we're gonna get called. In the lobby area of the surgery area, there's this huge ass TV, and it has the initials of the doctor and you and like your patient, the patient number, the doctor, and what's gonna happen and the status of it. Okay, it's kind of like at the airport where they have the status of like the planes and stuff, but this is for like the surgery stuff. And so after I checked in, I looked at the monitor and it had my name, and it said checked in the lobby. And then for some of the other people, they would have the different patient IDs with this whatever doctor, and it's just like in the prep area, active surgery, okay, in post-op, back to their room, things like that. And so people who are waiting, you know, this stuff takes hours, and so people who are waiting can get an idea of like what's going on and stuff. So you don't always go up to the front desk, ask them. It's on the TV there, and then like you can kind of see, oh, they're still doing prep, like okay, and then you know it's gonna take a while for them to actually do the surgery, so I can leave and like go get snacks and stuff, or like go rest or go back home and shower and then come back, that kind of thing. So that was there. That was in the lobby check-in area, so I saw that. Eventually, they called my name, and you know, I drew this picture, and it's all this swirly stuff, and it's just like chaos, but you guys stay calm, all that stuff, you know what I'm saying? I go to the pre-op room, and it was a room for me to put my stuff in, that stuff. I read all the documentation though in the packet, and so I didn't, like I gave my roommate all my stuff. I just walked in there with the clothes on that I had, and so when the nurse person who was helping was like, okay, here, you gotta fill out this form of all your belongings and stuff. And I was like, I just have my clothes. And she was like, oh, no phone, no wallet, no that. And I was like, no, I read the packet. It said just like to leave that somewhere else so you didn't have to. And she's like, good girl. And I was like, oh, thanks. Okay, I do follow rules. But yeah, so they gave me this like clothing bag thingy with like a hanger to put all my clothes in, and then that was just hanging there. And I was like, yeah, it'd be kind of like sus if like I had all my other belongings with me and they're just sitting here by myself, by itself while I'm in surgery and stuff. Like I don't want to deal with that, and so I just didn't have to deal with it. My roommate held on to it for me. And so in the pre-op area, they would like do testing and stuff. Like they checked me for COVID. They did a pregnancy test, you know, just the preliminary, like all the things you gotta check. They took some of my blood to make sure that I was fit for surgery. They started, like after those things came back all good, then they started prepping me for the surgery stuff. Like they started giving me medication that would help with surgery, help with pain, help with this and this. Even then, eventually I met with the anesthesiologist. We talked about this and this, about what it would be like. And then my surgeon came in, and then we talked about that. If anything, like actually, like I saw him like walking the hallway a bit, just like, and like I waved, like we waved at each other. And then if you, like later he came in and we actually talked about this stuff. I asked about like where the incisions were going to be, if I could choose, blah, 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 and we discussed it and things like that. And so that's the time to be asking very specific things if you have specific things to ask your surgeon. You know what I'm saying? Like I think some people I've read, they'll talk about like, they don't tell me anything in vision, and it's like, well, this is the time. When you're in the pre-op area and then the surgeon comes in and stuff, or even the nurses are there, you gotta ask those questions prepare yourself to ask these questions, okay? Like, they got so many other things they gotta do. That is like, yeah, they're gonna tell you what you need to know, but if you want to know more, you gotta ask more, you know? Yeah. I happen to pick a very good surgeon, and so, like I said, I was pleasantly like surprised, not just surprised, but like I was like, yeah, I know to expect that he will tell me everything relevant and just a little bit more, because I research and know that he really likes to make sure that patients are knowledgeable and informed about the situation. And I also know that the vibe that he gives off is very welcoming, and so I can ask even more questions. For example, I was like, is there a possibility you're going to take pictures? Because I want to see pictures. If you can even do a video, I would love to watch a video, because I've already watched a few full-length surgery videos on YouTube about everything that goes on. I'd love to see this stuff. And then we kind of make small talk about that. Turns out, they're not going to give me a video. And he did the thing again where he was using the verbiage of no liability. They're like, oh, we can't even do that because usually you have to put it on a DVD and blah, blah, blah. And I was like, yeah, we don't have the thing for that stuff. And I was like, the heck, I know y'all do. How else are these people like putting this stuff on YouTube and stuff? Also, the camera pipes into the Da Vinci robotic thing, so you can see the thing through the camera. And you just gotta click record. I know how it works, but it's okay if you don't want to give it to me. It's okay. In the back of my mind, I was thinking those things, but I was just like, oh, okay. But yeah, if you could take pictures at least, see, I will take you some pictures. And I was like, okay. But yeah, I'm not gonna try to make it hard for my surgeon right before my surgery. You know what I'm saying? Like, it's, you gotta work the system, but not work it too much that everyone gets stressed out. Anyway, so for a while I was hanging out in the pre-op room. Eventually they let my roommate come hang out with me. We were talking about stuff, and I was like, oh yeah, my roommate's gonna pick me up. He's like in the lobby right now. And then the lady was like, oh, he's just in the lobby? You want him to just come in here and hang out? And I was like, if he's allowed to, yeah, okay. And then so they went and called him, and then he came in here. I was just like, he's probably just playing on a Switch right now. He's like, yeah, you can come in here now. So he came in and we like hung out for a while. And then it got closer to the surgery time, and some of these medications were timed. Like they gave me some things for like blood clot stuff, and they gave me some things for this and that to help with like sedation stuff. What is this? All this stuff. It's all written down somewhere, but like you gotta ask about these things if you're super interested in it, okay? Like I had done some research on these things, so I kind of knew what to expect, but like definitely if you're concerned about those types of things, like for example, on my list of allergies, there are some like shellfish allergies and stuff like that. And so they're like, oh, okay, then you might not be able to take this certain thing, but we can change that to this other medication. I was like, okay, yeah, cool. And then that kind of changed things. And then at a certain time, they timed a certain medication to start working. So then by the time I got into the actual surgery like table, it would start procking, it would start doing this thing. And so at that point I was like, okay, if you're gonna give me this stuff that's gonna do a bunch of stuff, the thing is I'm probably gonna start reacting to it because I got autism. And it's not that I'm anxious, it's that my body is so resistant to stuff. But I do want you to give it to me if this is gonna keep me safe. But I'm probably gonna start shaking, and I'm probably not gonna be able to talk as much. I'm gonna go nonverbal. But it's all good. Like I'm giving consent for all this stuff right now. I want to keep going through this, but I'm probably gonna like not be able to talk for a while, and I'm probably gonna start shaking as I go through it. But then after like 5 or 10 minutes, I'll probably be okay. And then everyone's like, okay, cool. And then my roommate was there, and then it was even to my roommate. I was, I'm so proactive about this stuff. I was like, okay, dude, when I start shaking and I can't talk to you, you gotta say stuff that's like reassuring, but like, don't make me do stuff because I'm probably not gonna be able to do stuff. But like say things like, oh, remember to count, remember to breathe, remember why we're getting surgery, we're doing this, remember we're gonna eat at this place once you're recovered, and like just keeping my mind active instead of thinking about what my body was going through. And so that was right. I prepped him for that. When I started shaking, when I started going nonverbal, he was saying all the things. I was like, this is great. I'm so glad that I've learned all these things about myself, and that I can like, make things comfortable for me and the people around me. I don't want the people around me getting stressed out, because if they're stressed out, they're not gonna be able to take care of me. And I need everyone to take care of me right now because I'm getting sedated. You know what I'm saying? I'm letting other people take care of me. So I want everyone else on their best, at their best, being able to do what they do. Okay. And so at this point, the shakes go away, but I'm still I'm getting woozy. And they're like, all right, let's go. And I'm like, okay, so yeah, I got a thumbs up and stuff. And then I hear my roommate like, bye. And I'm like, okay, bye. And then they push me around, and it feels like we're going so fast down the hallways. It felt like we were a race car, but it was because I was slowly like drifting out because of the pre-sedation stuff. I don't know. It was a whole thing. I had a lot of drugs in me, and like I said, the drugs were good. It's for surgery, okay? It's like you gotta eventually put the person to sleep. You gotta take the pain away. You gotta make sure their blood is like hanging out good, the blood pressure. It's all this stuff. And so I was like racing down the hallways, and then we go to the operating room theater. I put theaters in quotes to remember this because like we're basically doing Mario Kart down the hallways. And then all of a sudden I see signs that say to the theater, and I'm just like, we're going to a movie theater? Like, what's that? Because I was starting to get, I was losing it. I was like, why are we going to the theater? Why do they have a theater? Like, oh wait, do they have a theater like right next to the surgery room? And it's like the Haunted Mansion thing where you like listen and watch your stuff before you go to the actual ride. And like all these things were like crossing my mind. And then finally we go to like the surgical theater, and the doors open like automatically, and it's just like, wah! There's a big ass table, a big ass machine, and then a big ass other machine, and all these people hustling around doing stuff, all in their like surgical gear and stuff like that. And I was like, oh shit, this is a theater. They have fucking windows on the top, just like the House. Have you watched House, like the TV show? Or other like medical shows where it's like the CEOs and like other top officials are standing on the second floor looking down at the surgery. I was like, I see why they're calling this a theater now. Damn, this is huge. You really could have a giant screen in here and be a theater. This is bigger than like those little movie theater rooms that they have in the apartments. When you go tour an apartment, you can see the amenities and stuff, and they are like, yeah, this is our movie theater room. And it's just like, you got like 10 chairs in there, which are fancy, nice chairs, but it's not. But this is like a mini movie theater for real. It's so big in there. Damn. Okay. And so at that point, there's just a lot going on. I get moved to. They're like, hey, can you move yourself over? And I'm like, I think I can do it. And I'll move myself over to like the main table off of the wheeled thingy, and move myself to the table. And then they're hooking me up to this and that. They're like strapping my legs with stuff, because you gotta make sure you don't get blood clots, you know what I'm saying? So they strap your legs with stuff. And then they're like trying to make small talk with me to kind of like distract me from this and that, and like think about this. And then I get the oxygen thingy, and then the anesthesiologist is like, all right, I'm gonna give you the thing. And then I'll close my eyes, and then usually at this point, people is just blank. It's just blank, right? You wake up and you're just like, oh, okay. You're a little woozy, and you're like, oh, and this is when stuff happens. After the surgery, they send you to the post-op recovery area, not back to your pre-op room. It's just this other area outside. It's like where I think maybe other people are also hanging out there post-op. And you hang out there enough to the point where you're not as sedated, and then you can go back to your room. For me though, like when they sedated me with the anesthesia, I felt like I was waking up again, but I didn't open my eyes. I just felt a presence. Someone else was like yelling at me and yelling my name, telling me to wake up, it's time to wake up. And in my mind, I was just like, no, I think I'm good. I'm like so tired. Like, y'all done with the surgery already? Okay, I'm just gonna rest. It's okay. I know we're probably in the pre-op area, right? Like just give me some time, man. I'm gonna go back to sleep. And then I think I went back down. And then I felt it again, like someone like slapping my chest, shaking my shoulders, yelling my name. It's like, you gotta wake up. Your roommate's waiting for you in your room. And I was just like, man, I don't care. He knew this was going to take hours. Well, he got his switch on him. I'm not worried at all. He's fine. I'm the one that had surgery. He'll wait for me. He rescheduled his whole trip to see his mom so he could take care of me. I'm not bothered by that. And they kept slapping me and trying to wake me up, and I was just like, you guys are the ones who gave me the drugs, okay? Like, I'm just going back to sleep. And then it happened again. Like, I felt like sleep. And then it happened again. And then I like finally opened my eyes a little bit, and I was like, yeah, I'm still in the the post-op recovery. Like what's going on? I don't think I was actually saying anything out loud at this point, but like they kept shaking me and trying to get me to wake up. And then at some point I mumbled like, yeah, okay, like I'm awake, like what? And then I heard them just say things like, you've been here for hours, and I was like, yeah, I know. I thought I'm supposed to be here for hours. Like I read the thing, it can take 2 to 3 hours. I know. And then eventually they're like, okay, well she's awake enough, so I think we can wheel her back to her room. And then someone else wheeled me over, and then someone else was like talking. The person who was wheeling me was this guy, and he was like, oh, is it room blah blah blah? And then the girl was like, no, it's room blah blah blah. And then they got to this room, and then I was like, no, it's this one. Like I put my hands up to I think the number 7. And then the girl just started laughing. She was like, oh, she's saying it's room 7. And then the guy was like, oh, okay. And like, I was not talking to them. My eyes were barely open, but I was able to be cognizant enough and could control my hands enough to put that up so we could go to the right room. And then, yeah, they wheeled me in there, and I just fell asleep again. And then every so often, I'd feel the slapping. They would just be slapping my chest and like, you know, shaking my shoulders, slapping my legs, and like pinching my feet. And they're just like, you gotta wake up, your roommate is here. And I was just like, again, I was like, okay, I'm awake. And then I just go back to sleep. And then they're just like, oh my god, I don't know. Like, it turns out that was happening for so long that like they were getting worried. Like legit, the nurses and the anesthesiologists were like getting scared or something. Like later when I saw my surgeon again, he was like, I found it sounds like you really gave the nurses and the anesthesiologists like a scare there. You weren't waking up. And I was like, yeah, seemed like it. Like I can't control that. Like they're the ones that gave me the sedation. And I'm just sensitive. I told you guys I'm autistic. I told you I'm sensitive to stuff. And he was like, well, you did tell us that. But yeah, so that was a whole thing, and that lasted so long that yeah, I got wheeled to the room, right? And I was so sedated, I didn't want to wake up. But the thing is, at some point I woke up because I felt the need to pee. And it had been so many hours since I had last used the toilet that I need to pee. I did not mention this, but that day when I was prepping for the surgery, I started having severe diarrhea. And I was like, if I was second guessing getting surgery at all, this painful digestive situation is making me realize I gotta get, because like when you got gallbladder problems, your poop is all over the place. Sometimes it's chalky white, like I had, you know, all way back when. Sometimes it's like super pale and floating. Sometimes it's diarrhea. Sometimes it's constipation. It's a whole thing, okay? And so, like, yeah, the day before surgery, I was like, I can't eat, but I am getting rid of everything. Legit, there's not gonna be anything left in my digestive system to get backed up into anything. Because I'm just like, what is going on here? And so. All the way up here, after I got checked in, I was just like, I'm really having digestive systems issues, and so I'm just gonna go again. And they're very understanding. Clearly, I am there to have surgery to help my digestive system, and so I was not shy about telling them I need to take a shit right now. Okay, like I gotta go. And the thing is, like the bathroom connected to my room was also connected to the other room next to me, and so it went to another patient, and there was a locking mechanism, and usually I'd be like double triple checking to make sure, but I was just like, man, I don't give a shit. I flicked this thing, I gotta sit on the toilet right now. If that person wants to walk in here even though I clicked the lock thing, that's their problem, okay? I just gotta go right now. It was very like systematic. I was dealing with some stuff. My stomach was hurting, my right side was hurting. It was the whole thing. When you're dealing with that stuff, there's no room to be shy, you know? So yeah, anyway, when I finally woke up on my own without getting slapped and all that stuff, or getting yelled at, they weren't yelling at me in like a bad way. It was more just, they were very concerned, and they were trying to make sure I could wake up and stay up, you know? Because it is scary. You put someone down and then you don't wake up. That's what most people are scared of. the anesthesia, like they're afraid of going down and not waking up again. But for me, I was just like, dude, I woke up enough. I'm aware. I want to go back to sleep. I am so tired. Just let me rest. I've been dealing with health issues for the longest time. Just let me rest. Jesus Christ. But yeah, they just kept trying to wake me up, understandably. But I couldn't pee. And this turned into like a situation. So it turns out if you are very sensitive to anesthesia, it can, the anesthesia is very complicating, okay? It affects your central nervous system. And so a symptom of that is if you can't control your pee, as in you can't pee at all, then something has really affected your central nervous system. And so for me, the fact that I was so heavily sedated and I couldn't pee on my own turned into a situation. Like they would, I could not keep my head up on my own. So they tried to get me to, pee in a commode, which is like a chair with a bucket, and I was just like, I'm not doing it. And like I kept flopping my head down, I have long hair, and so they had to like tie it. There was like 3 nurses in there helping me try to tie it up and all this stuff and flopping around. And then the one nurse was just like, if you can't pee here on your own, then we're gonna have to put a catheter in. That's gonna be very uncomfortable. And I was just like, I want to use the toilet. I know I can use the toilet. I've never sat in this chair thing before. It's uncomfortable. I want the real toilet. I think it's a mental thing. I think I gotta use the toilet. And they're just like, no, you can't sit up by yourself. Your head is flopping. It's not gonna work out. And then I looked up. So there was a lady to my left, there was a lady in front of me, there's a lady to my right. And I looked up, like I tried to swing my head up at each of them, and I said, teamwork. And they just all started like smiling and chuckling, and like that became an inside joke. They kept bringing it up throughout the time, right? And so they're like, okay, let's try. And so we teamworked it. We took the 4 of us, the 3 nurses and me, wobbled me into the bathroom, and I sat on the toilet. And the thing is, we got in there, and like they're like, okay, you can sit down. And I was like, the paper thing, the seat cover. And like I was very much structured. And they're like, okay, yeah, we'll put the seat cover down. So they put the seat cover down, and I sat down, and it took a while, maybe like 5-10 minutes, and I tinkled. And I was like, that's all I can do, but I think there's more. And then they were like, okay, yeah, that's not a lot. And so eventually they had to bring this like ultrasound type thingy, and they did, I'm not sure if it was an ultrasound, I think it was, but they checked to see how much fluid was in my gallbladder. Not my gallbladder, sorry. At that point I didn't have a gallbladder anymore. My regular bladder, they had to check that, and there was like X amount of fluid, and they're like, yeah, that's way too much. And so eventually I did have to get a catheter, and I was just like, this is fine. I'm gonna experience this at least once in my life, and then I'll be able to tell people about it, and then maybe I'll never have to experience this again. And so that was interesting. They were very much like cautious about it. They're like, you don't want to do this. Like, it's painful, it's uncomfortable, it's blah, blah, blah. And I was like, I don't care, I just really want to pee. This is an uncomfortable thing. And so I think because I've heard so many stories about how painful a catheter is, I was expecting it to be really bad. But for me, because at that point I was still so sedated, and at that point I had already like pooped so much in that bathroom, and like, I went through surgery and all this. I was just like, I had no room to be shy about anything. And when they put the catheter in, they're just like, okay, this might pinch a bit. And I was just like, this is nothing compared to the right side pain that I've been experiencing like for the past few months, and then also the past few years. Like, whatever, it's just, oh my gosh, I'm peeing now. It was so relieving, and I was like, I feel so much better. And then the ladies were just like chuckling and like being like, man, she's so funny. And I was like, yeah, thanks. And then they checked again to see how much like fluid was left in my bladder, and like most of it came out, so that was good. But yeah, I was struggling to pee on my own. And so that, and the fact that I was so still sedated, I couldn't keep my head up by myself, they were just like, yeah, it seemed like earlier it seemed like she wanted to like go home, like she brought the walker and everything, she wanted to walk home, but like, we don't know, like we can try to do it. But then even my roommate was like, oh, like, yeah, no, I mean, I guess we can ask her, blah, blah. And I heard these things, but I was like, no, I hella want to stay here. I don't want to go home in this condition. My roommate can't take care of these issues. yeah, no, what are you talking about? Yeah, if I can get a room to, and but then like I couldn't vocalize any of that because I was still basically sleepy. And so they called to see if there was even a room and stuff like that, and then eventually they like woke me up again. They're like, okay, the thing is, we know you want to go home, but because you can't pee on your own, you can't even hold your head up, we think it'd be better if you stay here. And I was like, yeah, I want to stay here. I would rather you guys make sure I'm okay before sending me home. Who said I didn't want to stay here? What's going on there? So I think there was some miscommunication, because earlier in the day when I checked in and my roommate wheeled in my walker, I was so excited telling everyone. I was like, yeah, I'm gonna walk home. I got this thing for $25 and we just cleaned it up. It's nice, and it's a nice model and all that stuff. And so I think they took that excitement as I really wanted to go home later. But to me, I was like, I much prefer staying overnight in the hospital and make sure like my blood pressure is okay, like nothing rips, and like there's no infection starting. Like I just had surgery. I'd rather be like cared for there. I don't want to go home. Nobody's gonna take care of me like that at home. My roommate's gonna try his best. You know, props to my roommate, but like he's not gonna know all this stuff, and I'm gonna be too tired to be able to explain it to him. And so yeah, just book me a room if there's a room. So they booked me a room and then they wheeled me up, and then yeah, the nurses were really nice, and yeah, they kept bringing up the teamwork thingy and like chuckling about it, and like because the nurse had even told my roommate about it because he had to go pick up some medication for me and things like that. And so that became a whole thing, and I had a hard time like staying awake and then also sleeping. It was a little situation. My roommate was there with me. He was trying to sleep in the chair, in like the recliner, and then he was sleeping on the floor. It was a whole thing. And then he was eating stuff, and like I was like, I guess I could try to like drink some water, but then like I think at some point I tried to eat like the next morning or something, but it was not going well, and so I just like had some broth or something. And someone would come in and like check my vitals and stuff, and then they try to help me with the commode, and then eventually by the next morning I was able to walk to the bathroom by myself and like pee a bit. And I watched so many different movies and like the Food Network channel on the TV just to pass the time. I was on so many pain meds, man. They were giving me all this stuff. And yeah, eventually I was able to use the walker and like walk around the floor, the hallways and stuff for a bit. And then I was able to pee a bit on my own, and so then everything was good. And then I was able to go home. But before that though, since it was like the next day, my surgeon came to visit, and I was like, see, this is also a Benny of like staying here. Like I can talk to the surgeon. So I talked to the surgeon about the stuff, and like he checked the wounds, the incisions and stuff, and he was like, yeah, do you like the belly button one? Because like I know you're worried about that. Because earlier when he came to visit before the surgery, I had asked him about the incisions, and which I will talk about later too. There's like different places you can do it, and I was concerned about the belly button incision because it's a very common one to get. That's where they put the camera, and I was like, can you put it somewhere else? Because I'm autistic and I have a hard time with change. I'm fine if I have a new incision somewhere, but I know my belly button to be a certain way, and if that changes, I feel like I'm going to have a hard time with that. And so we talked about it, but then that's when he was like, yeah, well, it's just the safest place to put it because of this, and I was like, dang, that makes sense. Okay, just do what you gotta do. But that next day when we talked about it, he brought it up again. I was like, because he's a good surgeon. He was just like, yeah, did you see the incision in the belly button? Like, I think I did a good job on it. And then I was just like, yeah, I saw it. I can't really tell. There's stuff in there. But I think that was the point. I couldn't tell. And that means he did do a really good job. It didn't look any different. Like it had gauze and stuff in there and stuff like that. But like it would, not gauze, it was just glue. They did the surgical glue and stuff like that. But it was just, it wasn't so different. And I was also still on drugs. And so I was like, yeah, I think you did a good job. And so that was nice, talk to him. And then again, he said, yeah, you really scared the anesthesiologist about not waking up. And I was like, yeah, I don't know about that. And then he was like, yeah, I think because you're so sensitive to like the medication. Maybe if you don't need like the certain prescribed stuff, just don't take. Just take Tylenol. Like if you really. But then if you really need it, you can take the other prescribed pain method. And I was like, okay, good point. And so I was glad that I could have that conversation with him and be reassured. And it's like, if I don't have to take the heavy, like, medicine, narcotics, is that what they call it? Then I would prefer not to, because like my brain is just so sensitive to all sorts of things, like meds in general, that like I would have a harder time dealing with everything if I was anxious, if I was depressed, if I felt confused in it. Like I've kind of talked about this many times in like my other videos, but like I feel like if this was like a D&D character sheet, you know, I kind of max stats in the intelligence and have like almost no stats in the physical health and strength. And so I think what's carried me through all my health issues basically my whole life is that my mind is so strong. I'm so intellectually curious and curious, and I blend the two, so I have creative critical thinking and all that stuff, and it helps me deal with all the physical health issues I keep having to encounter in my life. And so for me, it's like, yes, I might have physical pain, but if I take medication for it and it ruins my mental health, I'm definitely not going to be able to handle anything, because I rely so much on my mental state, like to keep me reassured and calm and like taken care of. I might be okay with a bit more soreness, and so I'll try just the Tylenol, and if that takes away some of the pain, sweet, I'll just deal with the rest of it. But if it is really, really bad, yeah, I'll take the heavier pain meds, okay. But like, I like having options to like inch up to it and like weigh the cost. And so I like that this specific surgeon that I picked was receptive and sensitive and detail-oriented and empathetic enough to understand all these things that I was saying, as opposed to other doctors who might just be like, here, just take these pain meds and you'll be fine. And it's just like, well, but can I take this? And, well, why not just take the heavier one? And it's like, no, bruh. Think of me as a human being, okay? Like, and so yeah, this doctor specifically was very good at that kind of stuff. And so I liked that he proactively and like preemptively said, since you were so sensitive to the anesthesia, maybe don't take these if you don't need it, but take it if you need it. Just stick with Tylenol for now. And I was like, okay, cool, sounds good. And yeah, so that was the whole thing. It did me all sleepy and stuff, you know what I'm saying? Okay, so this next session is going to be more sciencey. We're going to actually talk about the surgery, because back here I went to there, and then I was like, I want surgery, and then I got anesthesia, and then I just woke up, right? But now we're going to go into what actually happens in surgery, not just my experience of it, but like the scientific part. But let me have a snack. It's been a while. Dude, we're past 3 hours. I was kind of wondering if I'd make a 4-hour video. I think if I make a 4-hour video, it's going to be the longest video I ever made, like continuously. Actually, I think the last one, the one that I made, was like 3 hours and something. It was about raiding in Final Fantasy 14. I think I had to do that in sections though, because I was not prepared. I had to like stop and like get snacks and stuff. But this time I brought my snacks. Isn't it fun? Just hanging out, learning about gallbladders and surgery, chilling. It would suck if something happened to the recording though. If something happens to the recording, I'm gonna be so pissed off. And then I'm gonna be like, okay, tomorrow I'll just record it again. I hope it's fine though. I hope everything's fine. Okay, so with surgery, there's a few different types. We have open surgery, laparoscopic, and robotic. Okay, these are kind of the same, but yeah. So open surgery would be traditional surgery that most people think about, which is they cut you up and then they open it and then they get in there and there's stuff. This takes a lot longer to recover from, because they're doing like a big slice and then they're exposing all this stuff to you, and it takes a while for your body to like you know, for the stitches to go back together, the skin to go back together, and the muscles to go back together, all this stuff. And so that's why it takes longer to recover from. And the surgeon will go in using the tools, like the instruments and stuff to get into your body and like do this stuff, like cut things up, move things around, things like that. With laparoscopic, this is also called keyhole surgery. There's minimal scarring because they do small, tiny cuts. They do small cuts, and then they put tools into those little cuts, and then they put other tools into those tube things. They're called trocars. There's an image after. And this is, quote unquote, easier to heal from compared to traditional open surgery, because here you have tiny little cuts as opposed to one giant cut. And here, for just regular laparoscopic keyhole surgery, the surgeon also uses tools with their own hands. Okay. Do I have a picture? Yeah. So here, open surgery is like a large cut, and from there you're cutting blood vessels, you're cutting muscle, and things like that, and you gotta get in there. And so it takes a while for this whole thing to, but with the laparoscopic one, you get a few tiny little ones across, either across the belly or like in different areas, or just one single one. And so these tinier cuts, sometimes they're able to just avoid the muscle, sometimes they're able to go in, or sometimes like just the amount of muscle they cut through is just a tiny little bit, and so it's a little bit easier to spread it out and have a tiny little thing than this whole big open wound. So here, the robotic assisted laparoscopic surgery it's the same thing. There's tiny little cuts, but there's a robotic machine helping, robotic tools, as in there is this giant machine that helps with tiny little things. It's not necessarily like a robot, like AI is doing the stuff. It's that there are tools that can move ever so slightly at certain degrees. It can rotate certain things and stuff, and the surgeon controls it at the console. They sit at a console, like in front of a camera, and they have tools where they put their hands in this thing, and they're just controlling these tools, and those tools then respond to it inside the body, the surgery stuff, right? And so instead of the surgeon standing there over the body, and if they need to rotate a tool, instead of rotating their hand with the tool in their hand and rotating the thing in the body, they rotate their hand that's holding the basically controller, and then it will indicate to the computer, the robot thing, to then rotate that specific tool ever so slightly. What this does is it improves dexterity. And so it's like, if the surgeon, for example, if the surgery is taking a long time and they're physically getting tired because they're human, they might make some mistakes. It might take a little bit more energy to be precise, and that can cause issues. But over here, the surgeon is doing that for the computer, and it's just like, okay, I just need you to rotate 10 degrees, and the thing would rotate 10 degrees. But over here, if you're using the tools, it might rotate 10 degrees, but also flick their wrist this way, and then that might cause some issues. So it's more precise over here to have the surgeon use specific tools a certain way. Okay, there's also improved visualization because of the way the camera works. All this stuff, is a lot. I'm trying to go high level because I don't know how much people really want to know about this stuff. I thought it was fascinating. There's a lot to read about it. There's a lot of different brands, but the most common, like kind of the big name one, is the Da Vinci machines. Okay, that's the one that I got, that helped out with my surgery. The Da Vinci one. I think it was Da Vinci 2 or something like that. I don't remember exactly. I wrote it down somewhere, but yeah, it was a Da Vinci machine. But yeah, so with the robotic one though, you can have they call it single port surgery, where they just do one slice in your belly button, and then they put a thing in there, a trocar. It's like a rod, a hollow tube thing, and then they put all the instruments through that one tube, And then by the end of, and then they do the stuff, and then they take everything out. They take your gallbladder out. This type of surgery, actually, the laparoscopic stuff, they can do. This is just a method of surgery, and it's a common one to do with gallbladder surgery. But they do this for the other organs too. Like if you have endometriosis, for example, and you got testing, they'll do laparoscopic like stuff and anything. But yeah, this type of surgery is either they open you up a big area, or they do tiny little cuts in different areas, or they do a single cut in like the belly button. And it really just, it depends on the surgeon, their skill. Like some surgeons prefer to do a whole line, some surgeons prefer to get closer to the thing. And if the hospital that you're actually getting the surgery in, if they have the machine itself, and if they have the machine itself, if it's available at that time for your surgery. And so that's why they have to like book all these things and make sure everything lines up, and then they'll call and verify your surgery date and time like the day before your surgery, or if your surgery's on Monday, they'll call on Friday. And so yeah, some people, they're able to do the single port one, and then it's just a tiny little scar in your belly button, and it seemed like you didn't get surgery at all. But then some people do have these tiny little like scars that eventually go away, or some people get like a giant thing. Okay, it really depends again on what the surgeon is comfortable with, what tools they have available, and all that stuff. Laparoscopic surgery. So this is what it looks like. You're laying down on the thingy, and then they drape you with the stuff. You're off over there, and then they put these tubes in there, the trocars. Okay, and then this camera goes into the belly button. This is not to scale, this MS Paint thing, okay? But yeah, so the camera goes into the belly button area, and they see this stuff. And they also, this is where they inject the gas to blow the abdomen up so there's room. So they put CO2 into your belly so that there's more space to like work around and to be able to see stuff. And then they do other incisions, they add these other trocars, and then they put other tools into the trocars, like the little pincers, okay, to grab onto stuff, the cautery rod to start taking stuff out, and then eventually the bag to like pull the thing in. It's all this stuff. Okay, I'm trying not to get into it. We're gonna spend like 5 hours here. Okay, but basically, what happens during surgery, specifically gallbladder surgery? Cholecystectomy, remember this means gallbladder, and ectomy means the removal of it surgically. Okay, so what happens is, they get in there, they put the gas in so they can see everything, and then they have these little pincer things to grab onto stuff, and they kind of assess the situation. Now the way that I drew this is I drew the liver, and I drew the gallbladder, and I drew the arteries, right? You see the red stuff is arteries, right? But inside it can look a little different. Okay, hang on. Inside, there can be scar tissue. There can be visceral fat all over the place. There can be all sorts of stuff. There can be adhesions, which is basically scar tissue. There's just like stuff attaching to all sorts of stuff. And so they gotta clean up all that stuff to get to this stuff. And so that will affect your surgery time. If they have to move all this other stuff out of the way and cut it up and clean it up and all this stuff, it's fine. I think it's better to give them as much time as they need to make sure the surgery is a success. But having a long surgery doesn't always mean it's like horrible. It's just they're just trying to be careful, okay? And so here, you can see the gallbladder, you can see the artery, but actually this is encased in a bunch of like tissue, okay? It kind of has this like protective filmy stuff in there. For example, here, it's got this protective filmy stuff. Okay, I watched a bunch of actual live surgery, so I've been seeing the film. And then the thing is, the gallbladder might be attached to the liver, like with a bunch of stuff. And so they also gotta take care of that. So they'll use the little, the little trash picker-upper things you can use like at the beach or like wherever. It's kind of like that, except it's, professional. It's like not that the trash picker upper is not professional, but it's smaller. You just gotta go into the body. It's like metal. It's whatever. So basically, they get the little pincers, okay, and they move the liver around. They kind of assess the situation, see what they got working for them. And then they got this other tool. It's like a cauterizing, like a heat stick, basically. So they use a heat stick to then cut some of the tissue that is adhering things to each other. Okay, so you got a little, have you ever taken a chicken apart? You get a chicken, like a raw chicken, and you gotta cut it up, and there's like thin membranes and stuff between stuff. It's like that. And so you gotta detach it from some things every now and then. They probably try to peel chicken skin off of like a chicken, and so then you can, or like a turkey, so then you can stuff it with like herbs and stuff like that. You got that film and stuff. It's kind of like that. So they have to detach that type of membrane film, but sometimes it might be adhered to the liver, and that can take a little bit more to like kind of clean up and stuff. So basically, you gotta remove the gallbladder from the liver area, and then you kind of, like they might have to go from the top, and the thing is, the gallbladder doesn't always sit like this. It can sit like this or like wherever. Your body is just, everyone's a little different, but it's similar enough, so there are markers to look for, but like it doesn't always perfectly look like a textbook version of like what you see here. And so after they do some of that, sometimes they do a little bit of it just so they can get room to get access to the cystic duct and stuff, but then they have to clean up the tissue that kind of encases all this. Okay, they open that up, the encasing, and then they make sure that they can figure out which one's the artery and which one is the actual cystic duct. Okay, it's very important. And so after that, they clip them. There are different ways. There's different clips too. Some people use staples, and it's literally like a clamp. And then some people use these things called hemolocks. It's kind of like a zip tie. It's hard. Yeah, it's kind of like a zip tie or a staple. There's different types, okay, and it really depends on your surgeon what you use. And so I don't know, if you're sensitive to like metals, if you're sensitive to plastics or something, you can ask about those things. Sometimes these staples, these surgical staples and things they use to secure things might migrate. It's not common, but it does happen. And so if you're someone who's very concerned about those things, you can ask the surgeon what they're going to do. You can ask all these questions. That's why I'm making this video too. I'm getting all the details. But yeah, so they do staples, or they do these hemolock things that clip. So they use like zip tie type things to like secure things. It's a whole thing. There's different things, okay? But basically, once they figure out which one is the artery, which one is the thing, they might clip it all like this, or they clip the independent, whatever. People have different techniques. I'm not going to get into all that, but they clip it, okay? At least, okay, we'll simplify. Let's say we put a clip here. Wait, there's a drawing tool. Yeah. Wait, let's do a different color. Yeah. So let's say they put a clip right here, okay? And then they put, so that the connection, the blood does not continue here. They put a clip there and put a clip there. So here, the blood does not continue going in, and the cystic duct also, like the bile doesn't come out and stuff. And then they put a clip on this side so that the stuff inside the gallbladder doesn't come out, okay? And then they snip it right there, okay? The thing is, I think there's a few other things. There's a lot happening, really. Like, every surgeon's gonna do their own thing, but it could be also, wait, can I delete? How do I delete? How do I delete what I drew? Oh, here, this one. Oh, it deletes all of it. Okay, but like here, so we put a clip here, a staple here, a clip here, okay? Some of the people will then check the bile ducts. They'll do a x-ray, or they'll do a dye. There's different ones, okay? Cholangiograms, okay, you can look it up yourself. But they basically check to make sure the bile flow is good. that everything's good. They check they check things, okay? There's checks that they gotta do. And then when everything's good, they'll do a snip, okay? I'm generalizing, okay? Don't quote me on any of this stuff, you guys. Like, I'm not a professional, okay? But generally, that's what I have discerned. They check the stuff, they make sure it's all good, okay? Then they clip it. And then after they clip it, like maybe, and then now maybe they check this stuff. You know, it really depends. There's so many different variables going on, okay? But then after that, this is detached. You know, if they need to finish up removing it from the liver, they can keep doing the cautery thing, the heat gun, the heat detacher thing, okay? Or maybe it's already done. And then they take one of the tools out from one of these trocar things. Like, you got a pincer here to grab stuff, you got a pincer here to grab stuff, you got the camera here, and then you got this other thing with a cautery tool, you know, whichever. Okay, so at that point, the pincer, yeah, let's draw this stuff. The pincer is grabbing it. It's like, hey, buddy, okay, you got the pincer here. And then you got the cautery tool. Okay, we're cleaning stuff up. Okay. And then the other thingy is the one that put the staples in. And then you got a camera over here watching all this stuff. Okay. Yeah, watching this stuff is going out the belly button and stuff like that. And eventually they're like, okay, we don't need this anymore. And then they take it out. And then they put this thing in. Hello, it's a net. It's a basket, it's a little bag, okay? So they put the bag here, and then the pincers go over here, and they're like, yeah, I'm gonna drop the gallbladder in there, okay? And so then after that, you know, here, whichever, yeah. The thing is, actually, it's more common, like they might do this, right? So we're holding this over here like this, and then we got the camera here, but then they might switch the camera up to be over here, and then into the belly button they put the bag, okay? So they might move that. So then they put the gallbladder into the basket, and then they pull it out of the belly button. It really depends. Some people will pull it out from one of the side incisions. Some people pull the bag of the gallbladder out through the belly button. It's up to your surgeon, okay? You gotta ask them about it. Just let them do what they do, whatever they're comfortable with. Or some people don't even use a bag. Sometimes they'll just pull it out directly if they're like, yeah, I'm pretty sure this one. But the bag's a little bit better to make sure the stuff doesn't spill all over the place, you know what I'm saying? Because sometimes you can, when you're doing all this stuff can happen, and then you spill bile all over the place, and they gotta clean that up. If you got stones in there, which is a common thing, you know, you got stones falling apart all over the place, you gotta clean all that up. And so that's what I'm thinking. I was like, the bag's kind of nice, you know, you put the bag, you put the whole thing in the bag and bring it out. It's clean. It seems clean. I'm not a surgeon, but I'm just saying it looked cleaner with a bag. Okay, so yeah. That's basically what happened in surgery. And then at this point, this thing is, you know, when they snip this, they're using the heat gun tool. They're snipping it, like, and then it gets cauterized, okay? And as in cauterized, as in it's just like sealed up because it's so burnt that it just congeals. So that nothing's going through like that, basically. And so ideally, everything, they do their checks, you know, they gotta look at this stuff, whatever, and then they try to, you know, clean it, make sure everything's clean. And then, you know, at that point, they give you some anesthetic stuff. Some people get this, some people don't. I don't know, it really depends. I got it. They put some anesthetic directly into the muscle area of this and this and that. And so it's like, it's more numb, so you don't feel as much pain. This is why, like, after surgery, you might not feel that much pain, because you're on pain meds, but you also have this anesthetic medication, like, that was injected into the walls of the stuff. But then by day 2 or 3, you feel a lot of pain because that anesthetic wears off. Just saying. Okay. So, yeah. So then after that, After that, then they take the trocars off, they sew things up, whatever, and then, you know, they check things and stuff, you know, making sure everything's good, and then you're wheeled off, and then you're good. So that's the surgery. That's how that works. Yeah. Okay, recovery. Well, I still have some smoothies, don't you? Okay. Recovery stuff. Ideally, you don't lift anything over 10 pounds. I know that a lot of times it's really hard for like pregnant ladies, because it's like, I just gave birth and then I had to have gallbladder surgery and I gotta take care of my baby, and I can't lift them up because they're above 10 pounds now. And it's really hard. I get it. But legit, I'm gonna say, I've read some stories about women who just like dealt with it. They lifted their baby anyway and then they injured themselves. And so mama time is, you know, taking care of yourself first before you take care of others. Okay, like you don't want to be pulling, you don't want to get a hernia. If you get a hernia, where basically things like the muscle gets poked into the incision, or if you pull a muscle of that is gonna send you back to the emergency room. That's gonna send you back to surgery so they can fix that. And so it's like, bro, don't lift the baby. Okay, make other people take care of the baby. At least for like however, like 2 weeks. 4 weeks, depends. It really depends on your surgery and your recovery time. But I would not risk it. But again, I'm not a mom. I don't know. I don't have those hormones. So I didn't have to deal with resisting that. But like, man, I feel for those stories where they're just like, yeah, I thought it would be okay. But then I actually had to go back and get surgery because I got a hernia. That sucks. To like have gone through pregnancy and then had to give birth and then immediately get gallbladder surgery and then immediately have to have a hernia surgery. I'm saying, man, you guys. Ugh. Okay, but anyway, for other people who don't have babies, don't lift anything over 10 pounds. I know there's some people who are just like, no, I gotta go back to the gym. I gotta do this, I gotta do that. And it's like, okay, I'm not out here trying to argue with anyone, but I'm going off of the medical research and what is suggested and also how I felt. I was so weak. I was so tired. And it's like, there's no need to be pushing yourself so much. Society says you gotta always be proactive. You gotta do this, this, this. It's actually okay and fine to rest, you know? Giving your body time to allocate resources to heal. Like, you got cut up. Even if you got like the keyhole surgery, the laparoscopic one, it's not as bad as the open surgery, but it's still surgery. You got cut up, your body needs time and like resources to do so. Why are you trying to push yourself so much? That's all I'm saying. Anyway, so if you feel bad for just slouching around doing nothing, I'm gonna say first you gotta get up and walk to get rid of the gas pain. But also, it's fine. It's fine, you know? Do what you gotta do. You really gotta focus on your health. So anyway, the incisions, tenderness is expected. Some bruising might be expected. It might get itchy because it's like healing. Inflammation in general can make you itchy, okay? And because you just had surgery, your body gets inflamed as it tries to heal, and so that's part of the immune response, and that can cause itchiness. It might start weeping a little because, I mean, it's an open wound. They try to sew it up, but some stuff can go through, and it's fine generally, but there are some things to look out for. Usually they'll send you a surgery packet to tell you all this stuff, but like, if it starts turning a certain color and viscosity, well, you might want to get that checked out in case it's infection, potential infection, okay? But just clear liquid usually is okay, from what I read from my documentation of stuff, okay? A little bit of blood is also okay. It's original, you just had surgery and stuff, but if it's like actively bleeding, that's probably not very good. You gotta get that checked out. Belly button pain is also very understandable because that's where they, you know, probably did the biggest cut to put the camera in, and usually where they pull the gallbladder actually out. Like for me, in the notes, like even the doctor told me, yeah, we had to like make the belly button a little bit wider when we were pulling the bag out, and so that's why he was talking about, he was checking it. But yeah, so the fact that the belly button ended up being the biggest incision, it ended up hurting the most, and also because there's so much movement there as opposed to other areas where it's like a bit flatter. Anyway, it's the whole thing. But belly button pain is like a big deal that a lot of people have experienced with this. Okay, for me, and a lot of other people, a sore abdomen is very normal and common because you had it cut up. And the bloating was like no joke. People were talking about how they felt like they were pregnant again after they already delivered their baby, and it was like more bloated than whatever. And I was just like, oh, interesting. But yeah, I was just like, I know what they're talking about now. This is probably the closest I'll ever get to like experiencing a pregnant belly. I am so bloated. This is just round, rotund. It is like a fake baby. My abdomen hurts. My back hurts. Like, I'm sore everywhere. It's hard to get up and do things. Oh my goodness. I don't ever want to be pregnant. Yeah, so there's a lot of stuff. The thing with the back pain too, though, is like the way the body works, there's like checks and balances. This like pulling and pushing. Like there's complementary muscles and stuff like that, right? And so your back and your abdominal muscles like push and pull each other. And so now that your abdominal muscles are hella sore because they got cut up and whatever, your back muscles are hella compensating for it. And so it's pretty common to have back pain. And also for me, I had to sleep sitting up because it was so hard to lay down flat. Like, it would require my abdominal muscles to constrict a bit more. And so yeah, just sitting up was the way to go to recover until my abdominal muscles like healed up. But because I was sleeping sitting up, my back was like killing me. And then also the thing with the menstrual pain that I talked about earlier, the like retroverted uterus, the fact that my uterus like hangs back towards my spine, that was also causing problems as soon as I got close to my period. So that was hella frustrating. And yeah, so there's a lot going on. My back was hella painful. Gas pain is normal afterwards because of the CO2 that they put into the body to like see during surgery. And with that, it's floating free gas, and it can radiate up to your shoulder, and that is very common. And you really just have to walk it out. So the way it works is like when you walk, you will breathe more, essentially, like gentle walking. You'll breathe more, and that will help remove the gas. Like the body starts absorbing the CO2, and then it gets funneled to the lungs, and your lungs will just breathe out the CO2. And so that's why they try to encourage you to do light exercise, specifically walking, just walking, okay? But the walking will also help with water retention and like sore legs and stuff. You want to get your blood moving so you don't get swelling and blood clots and stuff. So some people are recommended compression socks, some people aren't, but I read all about it, and so I was like, I'm just gonna wear these. So I wore compression socks to help with the swelling, circulation, and things like that. But also rib pain. Okay, so for rib pain, that kind of combines to these things. Every time I would cough or sneeze or cry or laugh, my ribs would hurt. And I was just like, it's probably because I'm like moving my ribs every time I do these things, and it's moving the muscles in the general area where I just had surgery. All these things are combining, and it's just painful. And so it was really difficult to try to deal with. Like taking deep breaths sometimes would be too hard, but it's all normal, okay, for a while. Oh yeah, mental health, emotional. I didn't make a whole timeline here though. I thought about it, but meh. Because some people, their timeline is, oh yeah, I took like a day or two rest, and then the next week I went back to work and everything was fine. And some people, it's like, I could not do anything for a whole year, and then I started feeling better. And so it's kind of, it's hard to say. Generally though, the first few days, the first day or two is like, oh, it is sore, it is painful. And then the third day is when you feel it more, like I said, because of the anesthesia that they injected into the muscle itself, like that wears off. It's different than the anesthesia for the sedation stuff. It's like a anesthesic or something. It's a numbing type thing for specifically for the muscles. Like that wears off within like 48, 72 hours. And so you can't feel more on day 3. And then the digestive situation, it might take a while to be able to poop, for example. So you might experience your first bowel movement within like the day like 4, 5, 6, 7, something like that, because you had to fast before surgery, right? And then during post-op, like you might only, like for me, I just have broth. So it's not like I really had much poop to be pooping out. Like my body was just taking whatever I was consuming and converting it into energy, and I didn't have anything else to really push out. And so it might be something similar like that. Or you might have what I kind of experienced with the not being able to pee thing. You might have trouble with that kind of stuff. And so all that is pretty much normal, but I would say, yeah, if you have issues, you probably call your surgeon or call the office in some way and like ask them about it. And then, yeah, by like the second, third week, most people start feeling fine. And then you have your post-op like appointment where they check the incisions and all this stuff. And so that's kind of the common thing. A lot of times people will talk about how this is such like a common surgery, it's so easy. You'll be like back to work the next day or the next week and everything is fine. And I'm just like, that was not my experience. It was still like a serious thing for me. Like I took a long time to recover because I have health issues, you know. My physical health is not great. And so I took a long time to recover. But in general, I would say most people within 2 weeks or so is when they start feeling normal, quote unquote normal, and better again, from what I've seen. Okay, so some important things that I think need to be noted is your mental and emotional health. Like outside the physical health issues, what I struggled with the most was my mental health and emotional health, because already in general I have a hard time with self-care in my regular day-to-day life. You know, I'm always trying to hustle, trying to be a perfectionist, trying to be productive and all this stuff. And so I already knew I would have to actively make space for doing the self-care stuff, watching movies, listening to music, doing puzzles, watching TV shows, like I'm slashing around here, doing arts and crafts, chit-chatting, playing games, like all these fun, superfluous things are actually very important to maintain my mental health and give me time to just kill time and let my body do its thing, okay? Decrease expectation. Don't set yourself up for all these things, because actually you're not going to set yourself up for success. It's going to make your body more tired. You're probably not going to be as good at doing whatever as you used to be, and you're going to get frustrated, and that's going to cause stress, and then it's going to cause more issues with your healing time, okay? So comfy time is where it's at. You just got to do what you got to do to, like, you know, chill, basically. Post-op depression, that is very common because of the way the drugs affect the brain and the body. So anesthesia, you know, pumps a bunch of stuff into your body, and it shuts down certain things in your nervous system and all this stuff, and it's very complicated, okay? And then after the surgery, it's like, ooh, I'm so sleepy, I'm kind of and because you're sleepy and you're kind of just initially recovering from the surgery stuff, it's like, oh, of course I feel bad, of course it's it. But then as the days go on, you start feeling better. Those moments of like, oh, I kind of don't feel good, turn into more common, like depression stuff, where it's just like, I don't know, I just get these mood swings all the time, I don't feel good. It's because you still got the anesthesia, the drugs in you. And if you're using the other pain meds, the prescribed stuff, it's gonna affect you mentally. And so I think that's something that needs a bit more focus on, to expect to have some mental health stuff you need to be aware of, okay? Like, if you're prone to anxiety, your anxiety is probably going to crop up, and you're kind of be like, I don't know what this pain is, I don't know what this pain is, I feel depressed now, I can't just, you know, that is normal after surgery because of all the things that was pumped into you, all the things taken out of you, you know. Yeah, removing your gallbladder itself, like the gallbladder also has, you know, it was part of the whole system. It also affected other organs and like hormones and stuff like that. And so now all of a sudden it's not there. And so the body has to figure out how to function again, find your new regular, basically. And like the digestive system affects like the brain too, the gut, brain, the whole axis, the hippocampus and the pituitary gland. Is it hippocampus? Hippocampus? Hypothalamus? One of those. Okay, I'm mixing everything up. But my point is, taking care of your mental health and your emotional health is very important after surgery. Like, as much as taking care of your physical health is good and all that stuff, the mental health and emotional health is where it's going to be at, okay? So just, if you have a very strong mental health and good emotional health and good support and stuff like that, great, awesome, maintain it. But if you kind of struggle with that, prepare more for it, okay? I had stations. I was like, this is the station I want to watch movies. This is where my office supplies are at. This is where this is, and this is that. Okay, when I need to do this, I'm going to have it set up. Because I know that I'm very sensitive to medication. And I gotta do whatever I gotta do to make sure, especially during those times of sensitivity, that I got something distracting me, to keep me going, to maintain positivity so that my body does not have to use all of the resources to make sure I'm feeling okay, and it can just focus on my physical health recovery. Yeah, so learning to, if you need help, then ask for help and all this stuff. Like, I definitely don't like asking for help, but I was just like, no, I'm definitely gonna ask for help whenever I need help. So I'd be like, hey, Rumi, can you make me this? Can you get me this? And you know, I just had to learn to be okay with needing help, and then I got the help, and that took resources, or it allowed me more resources to just focus on my physical health, okay, to recover and stuff. So yeah, it's very important. Digestive health, bruh. Like I said, the bidet is nice. I highlighted that a few times. Okay, we got bidets going out. I also got a squatty potty, and I read all about like the natural way to sit when you're pooping and stuff, and how it helps with bowel movements and blah, 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 and like the position of, you know, the large intestine and the rectum, and so that, and I was like, I'm gonna set myself up for success here. I got the bidet, I got the squatty potty. I'm gonna make sure I can do whatever I can to get my poops regular. Okay, so like I mentioned, it can take a few days after surgery to have your first bowel movement, because you have to fast, and then your digestive system has to figure out how to do stuff again. Colors can vary because your bile is changed now. It's not concentrated bile anymore because you don't have a gallbladder, unless you have multiple gallbladders, which I thought was interesting. Some people have multiple gallbladders. It's not common, but you know, some people do. That's interesting. Yeah, I read like some stories about how people are like, yeah, I had it removed, and then a few years later I had the same problem, and then they scanned me and they're like, you have another gallbladder in here. And it's like, or it's a gallbladder issue, and they're like, I had it removed, and they're like, yeah, I saw the record of that, but it turns out you have multiple gallbladders. And then they found like 2 more, and it's like, oh shoot. And so yeah, that's an issue. But yeah, so the color of the poop can change depending on how the bile goes out and stuff like that. The texture can change, and by texture I mean you constipated, it's hard, it's diarrhea, it is very soft and like, you know. And so all of that is normal as the body regulates its stuff. I think if it gets so severe, like in the Metamucil and the Miralax and like all the other stuff, like the fibers not, then yeah, maybe you should go check it out and like get some testing done to make sure everything's okay. Because sometimes it can be because of unrelated issues or issues related to post-surgery and all of this stuff. Yeah, but after a while, like it does start to regulate for most people. I think because everything was slow for me, super slow. It was probably a few weeks before I had like a good poop, and I was so happy. Yeah, or maybe it was just like a week or 2 later. I don't know, but it was a celebratory moment where I was like, you figured it out. I pat my belly, I'm like, you figured it out. You're doing a great job. This is what I'm talking about. And then after that, it was like trial and error, trying to figure out what I could eat and what I couldn't eat, okay? And so you can look at Bristol stool chart, and it shows the different types of stool textures, and then you can tell, like, you won't be scientific about it. You look at it, what texture you're at, what level, and then you're like, oh, I'm constipated. I should take some Miralax. Oh, actually, this is in the diarrhea area. Like, I'm at level blah blah, I should take this much fiber of blah blah blah. You know, this is the whole thing. You can look that up. Yeah, so food issues for me, I needed to eat every 2 hours or else my stomach hurt. And at first I just had a liquid diet, but then I noticed whenever I started feeling I hadn't eaten in a while, I'd feel nausea. And that's also common after recovering from the surgery. And I was prescribed nausea medication, but I definitely knew like if I was hungry at all, I'd feel nauseous. And so I had those crackers, the brown rice cracker thingy stuff, and I was just like, I just gotta eat it. I just gotta like fill my stomach with stuff, because when you don't have a gallbladder, you got more bile just dripping. It's just dripping straight into your small intestine, and it's got to figure out the right balance. Is still dripping though, it's just constant. And so at the beginning, I think that, so like after surgery I stayed the night at the hospital, and then the next day I walked home. But that next night I woke up and I was so nauseous, I threw up, and I threw up bile. It was green and yellow, and I was like, okay, it's only been one day. I can't say for sure that surgery was not worth it. So far, I think it's still worth it, but if I experience throwing up every day like this, I don't know. I think I might regret. I hate throwing up. I don't like the feeling at all. But I was very present, and I was like, I really hope this is not the rest of my life. I don't want to just, it could be this, and this. And then I was like, you're right, it could be this, and this. It could be because the bile is just leaking. I haven't eaten real food in like 2 or 3 days, and it could be my stomach had nothing in it, and that's why bile came up. So I just gotta make sure I eat real food today. And after that, it was soft. I didn't throw up again, okay? And so it really was, if you have no food in your system, the bile is just hanging out, and then if you start feeling nauseous and bad, when you throw up, it's just gonna be whatever's in there, which is bile, because there's no food, there's no nothing. And so it's just straight up bile. And so I threw up straight up bile that morning. But then after that, yeah, I started eating bread and other soft foods and stuff, and it regulated a bit. Fiber is a common thing that people will kind of throw out there and be like, oh, you're constipated, have more fiber. Oh, you have diarrhea, have more fiber, and all this stuff. For me though, I found out that I could have certain fibers. So there's insoluble fiber and soluble fiber. I think insoluble fiber is the one that does not digest through water. Hang on, let's look it up. Soluble fiber, yeah, soluble fiber dissolves in water and forms a gel-like substance in the digestive tract, while insoluble fiber does not dissolve and adds bulk to stool. Okay, so I discovered that I could handle certain fiber, but not others, okay? And I can't have vegetables. I don't process them very well, and most vegetables have insoluble fiber. It adds bulk to your poop, which is why people will say if you have diarrhea, like, you gotta add more bulk to it, you absorb some of that, whatever. But if you're constipated, you gotta add more bulk and like fiber stuff to your poop, so that it's a little bit more moist, you know, so you can poop it out instead of just being a hard rock. And so there's a delicate balance of fiber. But for me, I have discovered that having too much insoluble fiber from like vegetables makes it really hard for me, and then I feel like horrible because my body can't digest it and stuff like that. And actually having insoluble fiber, having too many vegetables, causes diarrhea for me. It's like kind of the opposite sometimes. It's a whole thing. And so all of this to say, fiber can be good for you, but if you're having issues with certain fibers, it might be that you need to figure out if you do better with insoluble fiber or soluble fiber, okay? And then after that, you figure out, well, can I slowly start adding this or adding this? This is the game. After you have your gallbladder taken out, you gotta figure out what you can't eat, what you can't eat. Some people were just like, yeah, after my surgery, I went and had a steak, and I had mac and cheese, I had soda. I was fine. Other people, it's like, I had a cracker, and I was throwing up, and I was at diarrhea. So it was really dependent on your body. I mean, maybe a month ago, I'd be joking about, yeah, it's not the worst thing in the world to not have vegetables. But now I'm kind of like, man, it's tiring having to pick out vegetables. I would prefer to just be able to eat it, okay? It adds variety to my meals. It's kind of annoying that if I eat any of these vegetables, like I'm gonna have a bad time. It's gonna mess with my digestive. And so it's like I'm slowly trying to figure out how, like, if I overcook it, you know, is that gonna break it down? Actually, overcooking it made it way worse. Okay, now I really can't have this. And so there's a lot of trial and error. Okay. Again, I mean, it would be bad if I couldn't have like protein, for example. But it's like today, my roommate was gonna go to that bougie shopping area that is legit, you know, my friend. And I was looking at restaurants in the area because I was like, oh, maybe I'll go with you. And then I was like, ooh, vegan place, can't eat there. And he was like, what do you mean? They've got all sorts of things you can probably eat. And I was like, dude, it's probably all vegetables. I can't have any vegetables right now. And he was like, oh yeah, but what about blah, blah? And I was like, that's made out of vegetables. And he was like, oh, what about blah, blah? And I was like, that's also made out of vegetables, dude. And he was like, I didn't realize. I was like, yeah, because it's okay, but I do all the research and stuff, and I know that, yeah, I can't have this stuff. So anyway, it's like, it's not the worst thing in the world what I'm going through, but it's definitely like, everyone's probably gonna have a little thing that they have to figure out and deal with. This just happens to be mine, the vegetable situation, but other people might not be able to have like chicken. Some people might not be able to have fish or beef or pork or fruits, you know, like all this other stuff. You gotta figure it out. Some people can have like fat, like a lot of fat. Some people not have fat because it's like, if you produce way more bile than you consume, then that bile can just wreak havoc on your system too. And so it's like, if you produce a lot of bile, you gotta use it up. You got, like, there's medication for it too, like where you can like re-up, like your body can just bring it back and reuse it if you have way too much. But some people are just like, yeah, I just have to make sure I eat enough fat in the day to use up all the stuff that my body like produces, and if I don't, then I feel bad. And it's just like, oh no, I have to eat a steak every day, or oh no, I've got to make sure I'm having mac and cheese, you know, gotta use up that body. So it's really dependent on your own individual system. Yeah. Nausea issues, vomiting, yeah, so these things I kind of mentioned already. That is normal to have nausea if while your system's figuring things out. Menstrual cycle nausea is like so annoying. I did not have that much nausea with my menstrual cycle, but after surgery I started getting a lot of like really bad nausea at points in my menstrual cycle that other people have said they get nausea. And so for me, I'm like, oh man, I'm glad I didn't have to deal with that when, you know, I was dealing with period stuff since I got it, but then now I'm starting to experience it, and it is so annoying. What did I write here? Multiple toilet visits. Okay, sometimes you're gonna be going to the toilet multiple times a day, but then that'll ease up and then it's just like you're regular. But some people, like years out, they're still having issues, and I'm just like, well, I don't know what to say. Either go to the doctor or do your own research, try to figure out what's happening, you know? Like, not that I'm trying to blame anyone, but it's like, sometimes if you just believe the doctors and they say everything's normal, then you go 4 years with pain and then nothing happens. But if you're proactive about taking care of yourself and do research and test things and blah, 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 you can solve some of your problems. And so for me, I'm just like, it's not acceptable for me to experience this and this. I'm gonna fix this and this, okay? And so if you kind of go into this with that mentality, it's like, you don't want multiple toilet visits, figure out why you're like pooping so much. Conversely, if you're not pooping at all, go figure out why you're constipated. You know what I'm saying? Like, figure out what you want in your life and then work backwards to that. For me, I was just like, I go to the toilet multiple times. I tracked the foods that I was eating, right? I knew for real I could not digest carrots, and even before my gallbladder removal. So I was like, I'm gonna have a carrot and I'm gonna time how long it takes for this carrot to leave my body. When it shows up in the toilet, I'll mark that time. I'll do this a few times. So it was a tracer. I had a carrot tracer, and I figured that out. And so from then on, every time I had a deviation from my bowel movements, I would track, X amount of hours before, and what did I have? Turns out there was a pattern. I had a vegetable heavy meal, 72 hours before, and now look at this, on multiple toilet visits. But then during this point in time where I was kind of indulging a little bit more and not eating vegetables, my poops were actually fine. Oh my goodness, is there a correlation? And then I started doing testing. I would track it, and then I figured it out, and now I stay away from vegetables and my poop is fine. Okay, except it's not as fine because like I recently had COVID, and that also threw everything for a loop. But that's its own separate thing. But having knowledge has really helped me figure things out and not just get overwhelmed and be like, but the doctors were okay. The doctors are not superhumans, okay? They try their best, they can't do everything. And so yeah. But yeah, for me, I also made sure I had clear paths to the bathroom, just in case. And then I always have some nausea crackers next to my bed, just in case. Because like, especially those first few weeks, months really, after surgery, I would start feeling nauseous in the morning. And it's because when you're sleeping, you're not eating, and so that bile kind of builds up. And so as soon as I wake up, I'd be nauseous, and so I would eat a bunch of nausea crackers. My nausea crackers being like, it was just rice crackers. I just wanted filler in my stomach to just go in there and soak up some of that bile. And that helped me a lot. I don't need it as much anymore. See, I had surgery in January, February, March, April, May. 4 or 5 months ago. Okay, and so by 4 or 5 months later, like I don't need to be eating nausea crackers immediately, but if I don't have breakfast within like an hour or so, I do start feeling nauseous now, still. But it's not as bad as before, where I would wake up being nauseous and needing to like consume crackers and like bread and stuff. Like, yeah, usually at night before I go to sleep, they have this thing, most people are just like, you shouldn't eat too much before you go to sleep and blah, 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 because, it stores this and it takes away from your diet, like your recovery when you're sleeping. But for me, I usually try to have some sort of like filler material, like fiber-ish thing, like bread or something before I go to sleep, just so my stomach, my digestive system does have something to kind of munch on, so the bile doesn't just sit there and then causes nausea in the morning. So that's the thing, like I'm different now. I'm changed. I can't just rely on what normal people abide by, which is not eating 2 hours before bed. I'm just like, I gotta eat something immediately before I go to sleep so that it soaks it up and I don't feel horrible in the morning. And then yeah, I mentioned the menstrual cycle nausea thing. That was so annoying. Oh, hey, we're gonna talk about menstrual cycle. So yeah, my PMS got worse. I got the nausea, the back pain got worse. It's because of like, after surgery, you got a lot of inflammation going on in your abdomen. And then, the ovaries are kind of near there too. And they can cause more inflammation. Like when you're getting, like your uterus is building up, like the walls and stuff, and then it breaks it down. There's a lot of inflammation going on. There's a lot of stuff happening, and that's why you get the cramps, and then you get bad poops, and you get mood swings because the hormones are into play. Digestion goes in because of the inflammation, because of all the shaky shakes, the high prostaglandins. I can't pronounce that. It causes, on the regular, it causes nausea, fake poops, back pain. But with recovering from gallbladder surgery, it made it all worse. I feel horrible, and that's where I had to like figure out how to alleviate some of this stuff. And then that's when I made the connection here. The retroverted uterus can irritate back muscles in general. And so yeah, I noticed my ribs were starting to hurt, and then I pulled back. I was like, okay, my ribs hurt here. These rib muscles connect to my back muscles here, and actually my ex-gallbladder. That general area is right here, which is around the same area as these muscles here, which is around the same area as where my retroverted uterus is, probably where it's getting inflamed because it's prepping for, my period. It's probably irritating my spine right now here, and if we go down that pipeline, it's all going out to me. So I made all these connections. I was like, okay, can I do anything about the uterus not touching my back then? And then so I found some yoga exercises specifically for retroverted uteruses, and I was like, oh my god, this is relieving the back pain, which is relieving the rib muscles. And then I was like, oh thank goodness, this is just a muscle issue then, because I was worried if there was like some irritation or some other like issue with the gallbladder area itself, because you can develop other things, you know, like after surgery, like issues with the sphincters, the sphincter of Oddi. You can get pancreas issues. I was worried about that, but because I was able to alleviate the pain by myself by certain like movements, I was like, it's probably just a muscle issue. And then when I talked to my surgeon about it, he was like, yeah, it's probably just a okay. Science, research, knowledge is power. Okay. Uterus and luteal phase increase abdominal irritation. Okay, yeah, so in general, when you're in the luteal phase, which is the 2 weeks before your period, that's the PMS stuff. It causes irritation, and it just makes the irritation of the recovery process even worse, and so that causes issues. Ovulation causes pain and soreness in general for some people. Some people know when they're ovulating. Some people know when the egg shoots out of the ovary, right? When that happens, you know, you got other stuff going on in there from recovery from the surgery, and it's inflamed, everything's sensitive, and then you get like this egg being shot out of this other thing, and it's like, hey, yo, what's up? And then you feel it more. Some people feel it more. I can usually feel the egg shoot out of the ovary. So annoying. But what's interesting is I can feel it like when it goes from one side to the other side every month, you know. But I definitely, when it happened, I was like, oh my god, I'm ovulating right now and everything's painful. Everything's just all over the place. It's painful. So yeah, you menstruate, it's gonna be annoying. Yeah. Heating pads are good. Ice packs are good. You know, light exercise is good. Certain yoga positions are good. All this stuff. Drinking water. Okay. Anyway. Oh my goodness, we're at the end. Okay, reflection. Any regrets? No, I don't regret anything. If I'm gonna be like really picky about it, maybe I'll say things like, maybe like prepping specific like applesauce more, because the applesauce we got was not the brand that I usually like, okay? It was just at the store closest to us, but I only had a week to deal with it, and trying to get the specific applesauce I like was not a priority, okay? But you know, I'm being pedantic, I'm being a little specific. If I really have to come up with regrets, it would just be tiny little insignificant things to help the process of recovering. Those things. But I wouldn't say like the bigger stuff. I don't regret the stuff. Maybe like, nah, I think regret is such an interesting concept, because it means that you need to reflect on your current life and then figure out how to make changes to that, with the idea that maybe those changes in the past can like change your life for the better. But I would have to be so dissatisfied with my life right now to regret something. And honestly, I am such a logical person, and I also really advocate for like accountability and responsibility and stuff, those types of like mental health things, that I understood the risks of surgery, and I understood I could have a lot more symptoms, and I deemed them worth the risk so that I didn't have to have pain anymore on my right side and other stuff. What I wanted out of surgery was just to remove the pain, the constant pain I had. And then another layer was potentially remove those headaches, potentially remove the shoulder pain that was not going away unless I had pain somewhere else. Remember, it was either the head or the shoulder or the gallbladder area. Either one of those were hurt, and it was all connected. It was all right. As soon as I removed the gallbladder, it all went away. What I hoped for was that I just don't have any worse symptoms. And then what I was really just like, you know what would be nice is if it gets rid of some of my other issues, like my lactose intolerance, like not being able to have leftovers, not being able to, like these other people said. They were like, I had problems for 10 years, I got my gallbladder removed, all of a sudden none of these things are problems anymore. And I was just like, oh shit, am I allowed to have hope? I had this is why I figured I needed a therapist. I had, what's the phrase? I had accepted, there's another word for it, but I'll just use accepted for now. I had accepted that my quality of life would be a certain way. I had gotten used to not eating red meat, not having dairy, not having leftovers, not drinking alcohol. Not that I care about alcohol now, but like, you know, not having cheese, not having this and that, and doing this and all this stuff. Not eating fatty foods, not having soda, not having this and this and this and this. And I still got so sick. And so, but I was like, I'm tapering it down to the point where I'm only having like bread, broth, and avocado. Like, come on, how much do I have to take away from my life? But the thought of having hope to change any of those other things, the hope of being able to have a milkshake and not like feel awful for a week, the hope of being able to have like a hot dog and just be like, oh yeah, I can just celebrate whatever with other people in the summer. People have hot dogs and burgers and stuff here. I was like, I think it's too much for me to have hope like that. And that's when I started getting emotional. I was like, am I allowed to just be healthy like other people? Am I allowed to not have all these health issues? I feel uncomfortable. I feel like this is too much to ask. And that's where I was like, I should talk to a therapist about this, because it was getting existential. I was like, yes, I do want to get rid of this pain in my right side that keeps happening over 4 years, but quality of life, what is that even? You're telling me things can get even better than whatever? There's a better to this? My version of better is just like normal people's physical health. Am I allowed that? So that triggered me a lot, and I had a lot to work through for that. But at this point, I'm just like, I had a sandwich yesterday that had cheese. I'm fine. I had an eclair that had cream in it, and I'm fine. If anything, my roommate also had the other half of the sandwich, and then he also had an eclair, and he was like, oh, I think I might need to get some of that lactate stuff, because man, I don't feel good if we're gonna have pizza later. And I was like, dude, man, removing my gallbladder really changed my life if you're having dairy issues and I'm not. And then I realized actually he had like this other drink and it had milk in it. He drank straight up milk, so that's probably why he had problems and I didn't have problems. And he was like, oh, actually. But anyway, the point is, it actually has changed a lot. I can have leftovers. I can meal prep food for myself, and that helps so much with my executive dysfunction issues. And like, that has changed my quality of life. And so with those things, yes, I don't have a gallbladder anymore, but it's not like I was actively looking at my gallbladder every day. It was a part of me, but like, you know, and now it's not there. Yes, I had to deal with a bunch of changes with my digestions. I still can't really have vegetables and blah, blah, blah. But like, I can have milk. Well, I don't drink straight up milk, but I can have like ice cream. I can have a milkshake every now and then. I can eat a little bit of cheese. It's okay. And then I can, like, you know, have a burrito and not worry so much about stuff. I just got worried about not too much vegetables in my burrito. But like, it has gotten so much better. And so, no, I don't regret things because it exceeded my expectations. Like, I expected certain levels of success. I would have just been fine with it if I didn't have worse symptoms. If the right side pain did not go away, but I still, like, if they removed my gallbladder and I still had the right side pain, but I had no other symptoms, I would have been fine with it, because then I didn't do damage to myself. But, you know, what would be bad is if they removed it and then I had worse symptoms and everything's horrible and stuff. But what happened is they removed it. I went through recovery. I can eat more. I have more energy. My mental health is a bit better, probably because my digestive health is better. And like, that's good to me. I accepted that actually being healthy and being able to do things that other people do is okay for me. I have to work through that mental health hurdle. And now I'm just like, I'm thriving in it, you know? I'm having snacks. Why not? So no, I don't regret it. What was the worst part? Here, the worst part? I think throwing up. Throwing up bio was pretty bad. It was like, I saw this meme, or someone wrote a post recently about, it wasn't specific about gallbladder stuff, it was just like talking about life in general, that throwing up is the most like natural zen moment that we have now, like in modern society, because at that moment it's such a visceral, somewhat painful experience. It requires all of your senses to just focus on that, and it makes you be present. It makes everything else not matter. You are not worrying about anything except the fact that you're throwing up. And so this person was arguing that that's the last really truly transcendental experience humans can have these days, because there's so many distractions, so many blah blah blah. And I was like, that's an interesting take. Okay, I don't think about this for a bit. But yeah, I would say maybe that's the worst part, because I really don't like throwing up. And it was scary, honestly, to have come out of surgery, had some issues, overcame some of those issues, like the peeing situation and then the walking, and then all of a sudden all this stuff comes up that I usually don't see. You know, it's all green. It's green, yellow stuff coming out of me. Ugh, out of my throat. Ugh, I don't like this. And it was burning. I was like, damn, this stuff's spicy. And just being exhausted, and just like, oh, like, is this really gonna be the rest of my life? Like, that was scary. So I think that was the worst part. All the other stuff was also not that great, but like, I think that was the most jarring moment for me. Yeah. Unexpected. I was gonna say maybe like the vegetable thing, but actually even before gallbladder surgery, there were certain vegetables I really could not like hang out with, and I had to cook my vegetables all the time. I couldn't process raw vegetables very well, even before surgery, but now it's like even like cooked vegetables I'm not doing well with. So that was unexpected, but I'm not surprised. Like, I expected there to be things that I could not have. I was happy with the fact that there are things I can have now, but I did not expect it to be the vegetable problem being the worst thing. You know, the fact that I can have a more variety of foods and expand my palate, but still kind of have the same issues with vegetables, just more pronounced to the point where I'm avoiding them. That's not so bad. It was, I didn't think, I had more extreme ideas. You know, I'm kind of an extreme person. But yeah, so the vegetable thing probably. Not horrible, but kind of annoying. The pooping situation. It wasn't horrible, but yeah, it was kind of it's annoying when a lot of people will be like, oh yeah, like how bad is the pooping situation? Like everyone on TikTok and like blah 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 is talking about how much they have to poop multiple times, and I don't want to get surgery if and it's like, okay, that's understandable. The thing is, talking about poop is such like a taboo topic, and it's just like, ooh, hot takes, ooh, where this, nobody likes talking about this, I'm gonna make it a thing, I'm gonna present it. It's such a natural thing though. Yeah, it's dirty because literally it's like garbage coming out of your body, but like it's a natural thing, and I think people should be able to talk about it. I've always been really comfortable talking about poop, but I hold myself back because I don't want to make other people uncomfortable. It's a whole thing. But like, I really like pooping, okay? Because I see it as my body is doing a good job. If everything else in my body is working well, that means I have enough energy allocated to processing food. You know, reverse stress like situation, right? Because like I said before, the tiger thing. If you're stressed out, your body does not digest food. It's allocated to running away or fighting. But if everything is good, I'm just straight chilling and living life, my digestive system is good, I poop out a healthy looking poop, everything's good, dude. You know, the way the body is created, The way the nerves work and all this stuff, it's satisfying to have a healthy poop. It feels bad to have a bad poop because your body's trying to tell you something, okay? If it feels spicy after you have Taco Bell or other stuff, you're pooping out spicy stuff, your body did not coat that poop in a way to let you know that was good. And you feel bad. And you feel bad because your body's trying to tell you, don't eat that shit again, man. Because this is gonna happen again. This is not good. Don't do that. But if you eat whatever other stuff and then your poop comes out and just like, bloop, and it's just like, yeah, that was good. Positive reinforcement. And it's like, okay, yeah, I'm good. This is fine. You know? Then it subconsciously, biochemically, it lets your body know, yeah, everything's good. We're good. Continue as normal. Continue as we are doing like routine stuff, whatever, it's fine. And so to me, when I have healthy bowel movements, I'm just like, hell yeah, I'm doing a good job in my life. Because like I said, I've had health issues my whole life. I got stuff going on all the time, but as soon as I got that moment where I'm like, oh shoot, it's time to poop, and it comes out and it's just nice, I'm just like, yeah, I'm motivated, let's go. That's like, I wish I could poop again, but actually I don't want to because that means it's probably not good, but you know, yeah, this is fine. The issue is diarrhea is not fun, okay? And so if it's inconsistent, I get annoyed. I'm just like, I know that my digestive system is gonna take a while to do the thing. I'm not annoyed that I have to go multiple times. I'm annoyed that it's taking a while, but I have to manage my annoyance because I have to be empathetic. I have to understand that it's trying its best. I gotta give my digestive system some time, patience and stuff, right? That, you know, like, but like I said, I really value healthy bowel movements, and so sometimes I catch myself getting annoyed. The thing is, again, because I enjoy having healthy bowel movements, like literally I enjoy sitting and passing that and being like, let's go. The rest of the day, you all got nothing on me. I can do whatever I want. If that changes and I don't poop, I get so frustrated. Like during COVID, these past few weeks, it messed with my digestive system and I didn't poop for 2 days. I was so mad. I was just like, how dare you affect me like this? And then one day it all came out. It was horrible diarrhea. And I was just like, okay, this is fine. I'm actively fighting an infection. This is fine, but like, don't you dare do that to me again. And then I didn't poop for 2 more days. And then I was like, this is not gonna be my regular. At some point I was complaining to my roommate and I was just like, he was like looking at some Pokemon cards. And I was just sitting there near him reflecting, and I was just like, I really don't like it when I can't poop every day. I feel like it really takes away from my human experience. And he was just like, oh, okay. And I was like, yeah, seriously. Like I was totally just in my own mindset. I was so frustrated. But then eventually things regulated. I got better and things like that. So it was fine. But like, damn. It's not horrible, but it's kind of annoying, okay? I would rather poop multiple times a day than not poop for 2 days straight or multiple days straight. Even if I miss 1 day of pooping, I get so frustrated. It's just like, why are you holding on to it? No, just push it out. If it's not where it's at, just push it out and I'll try to get you something else. Just let me know, talk to me. I value communicating, okay? Don't just hold on to it like that. That's what I meant. So current issues, yes, vegetables are still a struggle. And it was definitely like, I was slowly trying to get back into the vegetables, like trying to trial and error some stuff. But after I got sick this recently, I was just like, you know what, never mind. I'm just gonna go back to what I know I can eat. And I'll trial and error some stuff later once I regulate my bowels again, okay? Current meals, yeah, it's a little all over the place because of my most recent infection. Right now, this month at least, I was having broth and like rice noodles and some chicken, and then I would have this pork and quail egg stew with rice, and then I'd have a banana strawberry smoothie, or sometimes I'll just have banana by itself and strawberry by itself, but sometimes I'll mix it up into a smoothie. It's a different texture. I can snack on things like shrimp chips, I got Pocky, I got Hello Panda, things like that. But it's mostly chill right now just because I just finished recovering from COVID. But I would say, yeah, I can eat most things. Like I had pizza yesterday, and I had a sandwich from this bakery, and I had an eclair, and I was okay with that. But those are kind of just like one-off type things. I am trying to expand a little bit more. Like I was able to have sushi like a few months ago. And let's see, I remember like 2 months or so, a little bit after the surgery, I was like, I'm gonna try to eat out, and I had pho, like Vietnamese rice noodle soup, and it was good. But then that was around the time I noticed like, ooh, maybe I shouldn't have had that. And then I started realizing, oh, maybe it's because I had all these vegetables, and because like when you have that, it's like broth and noodles and then meat, and then they give you like this pouch of like vegetables and stuff, and I was like, is it just the vegetables? And so I did experiment on that, and yeah, I think it was just because I put a lot of vegetables in my soup, and that was causing issues. Yeah, current bowel movement, yeah, in general I was doing well, but like I said, right now literally I'm trying to regulate it again, just because of my most current illness with COVID. Which again, dude, when I was dealing with that, like, whenever I would tell people, oh, I got COVID for the first time, they'd be like, the first time? It's been like 5 years since I started. It was the first time you got it. And I'd be like, yeah, I really tried to avoid it because I have a lot of physical health issues and stuff. Yeah. But, yeah, I was worried about some of the symptoms of COVID and how it would relate to my gallbladder situation. Definitely digestive wise, it like fucks it up, dude. It's like all over the place. And so current bowel movements are kind of up in the air right now as my body tries to regulate everything. Okay, I'll just leave it at that. I am hopeful for the day this is normal and good. It was kind of like that today, but it was a little sus at the end, and so we're still waiting, okay? Still waiting. Oh, my stomach's grumbling. I have been here for 4 hours. I've eaten most of my snacks. I gotta eat soon. Like, oh, wait, I got Pocky. Wait, but I'm still having my smoothie. I can't mix those. It would taste weird. I'm almost done. Post-op appointments. It was 2 weeks after the surgery. I had an appointment to talk to the surgeon. Everything was fine. He looked at the incisions and stuff like that. But then I think it was around the 2-month mark or so, like week 7 or 8. That was when the incision glue for the belly button finally came off. And so I didn't talk about this, but like after the surgery, they seal things up. It really depends. Some people seal it up with stitches on the outside, some seal it up on the inside, some people use gauze, some people use surgical glue. I had surgical glue on the outside, and really you're supposed to just leave those alone and let it fall off on its own. If you try to pick it out, you're gonna pick your skin off because it's very strong glue. And so slowly but surely the glue kind of fell off, but then the belly button one stayed on for like 7-8 weeks. And I was just like, I read that you're not supposed to pick it off, and I just leave it. But then after it finally fell out, I did end up getting an infection. And so I went to get it checked out at urgent care, and they did swabs, and they gave me some antibiotics just in case it was. And then it turns out it was, and so yeah, I had antibiotics for that. And then I took care of it. When you use antibiotics, you have to use it the entire time. Because if you don't use it the entire time, if it starts looking good and then you stop taking it, the issue is that there could still be a few of them hanging out there, and then your body starts to resist antibiotics. You become antibiotic resistant or something like that, and then the next time you need antibiotics, it doesn't work for you. And so you got to use the full thing to really get rid of all of like the infection of whatever it is. Okay, I'm just saying, if you've never heard that before, look it up. It's a whole thing. But then after that, it was like, okay. And yeah. Oh, maybe something I do regret is like, I don't want to get into an argument with anyone, but I definitely am someone who gets all my vaccines, okay? And I don't want to hear all that shit about like autism and vaccines. Like, that's such a boring conversation to me. But like, I want to talk about, like, I got all the COVID vaccines because I was very cautious. I'm one of those people. And I got all the booster shots and whatever. And I never caught COVID these past 5 years. I also just stayed home for the past 5 years because I'm a homebody and I really enjoy staying home. But something that I regret is that the timeline for when I could have gotten another booster shot was around when I had the surgery. And you know, when I was recovering, I was dealing with so much stuff and I was like, I don't really want to get a vaccine right now because I'm already feeling bad and I don't want to like have that counteract with all this stuff. So I'll just wait until I'm more recovered. And you know, my recovery took a few months. And so sometime in April, I was like, oh, should I get like another booster shot? But then all like the political stuff is like, should I wait for like the next one? Is there going to be a next one? Or should I get the current one? And I thought about that and then I kind of just didn't really want to deal with it. And then by the end of April, I caught COVID. And so if there's anything I would change again, that I don't think, well, I don't know how much it would significantly change my life, but you know, if I could go back to the beginning of April or sometime in April, when I started feeling mostly recovered from my surgery, then I would have wanted to get another booster shot to make sure that my immune system is like up to date with all that stuff. Because by the time end of April showed up and then I caught COVID, like I was pretty out of it. Like, I'm surprised that there's only one more week of May left. Like the majority of May kind of just passed by me and I don't really know what I did. On paper, I passed the class, I did this and that, but like a lot of that was me recovering COVID. I spent the time to like record my symptoms and all that stuff. I was keeping track of stuff, even though I was going through so many fevers and stuff. I experienced a lot of the symptoms, all the common symptoms and some of the uncommon ones. And I was worried about this and that. It was a whole thing. This is not a COVID conversation, but like that's something that I kind of regret, that I was so overly cautious about how my body would do post recovery and if it would be too risky to do something that I've always done, which is to get my vaccines and stuff. And then I decided, no, I'll just wait a little bit more to give my body more time to like deal with this and this. And then this happened. Yeah. And so it's like, if I had gotten another booster, like when I got infected with COVID, when I was exposed to it, would I have experienced all the symptoms I experienced? Or would I have just not had to deal with any of it? Like, I don't know. And the thing is, like, where I am right now, fortunately, I was able to overcome it after 4 weeks. And so it's like, I'm okay, but maybe it would have made it a little bit easier on me. You know what I mean? But again, it's hard to say. And you know, this is not a time travel situation. And so I don't want to really sit in that mindset. Because I think if I just swarm in all those negative thoughts, and I'll just feel bad about myself, and I'd rather focus on the present, which is I made some decisions, I ended up catching COVID, I ended up recovering from it, and now I'm like slowly getting back to my regular bowel movements and slowly getting back to eating more solid foods and slowly getting back to like doing this and that, and like I'm at an okay place right now. And so I don't want to say it's such like a heavy regret or anything, you know what I'm saying? Yeah. That's been things I forgot. I'm pretty sure I was pretty thorough. 4 hours and 35 minutes. I think I was pretty thorough about all this stuff, and there's definitely more things I could talk about, but like I said, I was trying to hold myself back and not get into all the details. That's why some of the slides were just like highlights of like November, December, January stuff, because I knew if I made individual slides of every single thing, I would over explain all the stuff. You read all those details, I got it, but it's like, nah, man, I don't want to make this a 24-hour video. That'd be kind of funny though if I ever made a 24-hour video. I think, doesn't YouTube have like a 12-hour limit or something? Maybe that's a live stream. But anyway, I don't think I forgot anything last minute. This is kind of cute, right? It's like flying or something. I'm not a very spiritual person, but when I was thinking about surgery and all this stuff, and then even after surgery, I was like, as the most spiritual I will be is that my gallbladder is now, you know, back to the universe, and it's gonna wait for me to finish the rest of my timeline, and then I'll join it again. It'll be like, hey, I was watching you from wherever, and like, yeah, like my gallbladder hung out with me for the majority of my life thus far. Well, yeah, thus far, and now it's tapping out to go rest and waving for the rest of me and my body, the rest of us, the rest of the organs and stuff, to keep going a little bit. And it's like, we'll see you. It's all good. It's all good. Don't worry about it. Just keep going. Keep going. And I was like, yeah, okay. If I was a spiritual person, realistically, I know that my gallbladder ended up in this, you know, container, and then it got sent to pathology, and then they opened it up and then like tested it and looked at his stuff so they could write the pathology report to say the thing. Yeah. The thing is, if we want to tangent a little bit, is that like this whole time I was in school, right? I think I told this story in one of my Let's Plays before, but we're here. This is basically done, okay? This is just another random story. When I was younger, I really liked math, but at the same time, I couldn't take higher level math classes for reasons such as I couldn't pay for the AP class fee, testing, whatever stuff. And then when I eventually went to college, I had a lot of mental health issues. I had issues with my family and blah, blah, blah. And then I finally took calculus, but then at that point I hadn't done math in so long because I was dealing with other stuff. And then I failed that math class, which was calculus. I was waiting so long to take calculus because I couldn't take it in high school, that by the time I took calculus in college, I forgot all this stuff, and I was so depressed and, you know, not doing well that I failed that class. And I was like, hell no, I did not, what the I've never failed a class. I always do so well. I always get good grades. What's going on? And I was like, this is like a wake-up call. One, I do not fail classes, and two, how could I fail calculus, something that I was looking forward to for so many years? And so that's what led to me leaving home early. I was just like, okay, the situation, the stress that I'm dealing with, the full body hives, is causing me to now, it's affecting my schoolwork and my grades, and that never has faltered for me. And so this is a problem. This is a real problem. I gotta deal with this. Never mind the fact my physical health is like shit. I cannot accept having bad grades. I'm leaving. Whatever. And then over the course of the past few years, despite all the health issues and whatever, like academically, I kept trying to go back to college because I never finished college. I kept trying to go back to college. I taught myself programming. I'm like, if I can teach myself programming, I can finish school. I want to do this and this. Like, I just wanted to take calculus, right? But then school wasn't working out for me for this or that reason, whatever. So I tried just doing math by myself. I was like, I gotta pass calculus, man. I failed calculus at one point in my life. I gotta show up and show that I've grown. I'm different. I go and do this stuff. 10 years later, sometimes every year, finally I'm able to like start school. I find a school that works out for me, and then I switched my major to math, and I was like, this is where it's at. I don't want to do this other thing anymore. I want to do math. I'm going to finally take this calculus. I'm going to take a calculus. I'm going to accomplish this thing that I've wanted to do in my life. I'm going to do it. I got to do this first semester stuff, whatever. Second semester, I didn't take calculus. And then the headaches happened, and then the left side pain happened, the ER visits and whatever. And then I got into my second term in December, or like October, November. But I was like, I'm in my second term now. I just gotta take these 2 classes, and then I can take calculus. So and then by January, around the time where I was having that second consultation of the surgery thingy, I was like, I got some time. I got like 2 weeks before the surgery consultation. I'm gonna open this calculus class. Oh, I'm so excited. I was dealing with the pain. I was dealing with my lackluster diet. I was dealing with all these things. But I was like, if I die in surgery, I'm gonna at least pass calculus before I die. I swear to God. Not to be dramatic, but god dang, I'm gonna pass calculus. Open the calculus class, you know what I'm saying? At this point, my track record for passing classes was pretty fast. Most people spend like, 4, 5, 6 weeks on a class. I was getting classes done like within like 2-3 weeks because I was excited. I really like learning. I like researching and stuff, right? So that was my trajectory. But because I was getting so sick all of fall, October, November, December, I kind of had to slow down to a normal pace, an average pace. And that's fine. It was fine. It was fine. I had to fight against my perfectionism, but it was fine. I was physically ill and did not have energy to study. And so I passed my classes like an average student, and it's fine. It's fine. So I opened the calculus class, and I'm just like, I got 2 weeks before the surgery, consultation, and then honestly, most people have to wait like a month or two before surgery. And so I think with that timeline, I can probably finish calculus before surgery. If the earliest surgery is going to be in like mid-February or something, you know what I'm saying? That's what I said. And then, so I opened the thingy, and then freaking, there were issues. They pipe out the stuff into 3 third-party tools. You got a third-party textbook, you got a third-party video thingy, you got a third-party homework assessment, whatever thingy. And the thing with math is, if you want to get good at math, you got to do math. You got to actually do the exercise. You got to do homework. So I had access to the textbook, I had access to the videos, but I did not have access to the homework. And I was like, this is unacceptable. How am I supposed to do the work? How am I supposed to reaffirm what I've learned? How am I going to actually learn? By doing these things. So I emailed the teacher, I emailed my mentor, I emailed the IT people, and they're like, oh yeah, there's a problem, blah, blah, blah. And I was like, how long is it gonna take to fix that? And they're like, oh, we don't know. And I was like, bro, you guys, come on. And then that dragged out for a while, and then they were just like, yeah, maybe you should open a different class. I'm like, I don't want to take another class. But then I opened another class, I finished that class in like a week or so, and then I'm like, is the calculus class open now? And they're just like, no, bro, you can't do the calculus. No, we're still fixing the blah, blah, blah. And I was like, oh my God. So then I got another class, and I was like, man, I don't know. It was just so annoying. It wasn't even math. It was some other general education class, and I was just like so bored. And then the surgery consult happens, and then I find out that like, yeah, like I could get surgery if I want to when the surgeon messaged me, and then so after the surgeon consult, he did a write-up, because you gotta write up all this stuff when you see people, right? And his diagnosis for me was cholecystitis, inflammation of the gallbladder, but also A calculus. A is similar to this, where this is not good, abnormal. When you add A in front of a thing, it usually means it's not good or it's not there. Okay, without. It means without. Look up the suffix and prefix and all those things. It means without. And calculus means a stone, and so A calculus means without a stone. And so I had cholecystitis without calculus, or acalculus, which means no calculus. And I was like, why is the universe doing this to me? I keep getting cock blocked from taking calculus. Why can't calculus be in my life? Not that I'm saying I want any gallstones, because that sounds painful. I have my own problems. I don't want that additional problem. But like, dude, why you gotta bring up calculus all up in here, you guys? Like, well, I'm not that spiritual, but what are you doing to me? What is this? So of course I complained about that to like everybody who would listen to me. I was so frustrated. And then I went back to the school thing, and I was like, can I take this calculus class? And they're like, no, you can't. You can't have this. And I was like, no. And then I had the surgery, and it was the whole thing, yeah. Eventually I took the calculus class, and honestly, it was no big deal. It was so fun. I had so much fun learning calculus. I was like, this is great. I love this. Even though like the rest of my body is like, oh shit, this fucking sucks right now. Like, I gotta go poop again. I was like, let me learn this stuff. It's so interesting. Oh, I get it now. We got derivatives, we got limits, and shit. And so that was nice. And then, I passed the class, and I was just like, cool, I did it. Yeah. Now I gotta take a bunch of filler classes of other stuff, and then eventually I gotta take calculus 2. And then eventually I'll take calculus 3. I'm currently taking calculus 2 right now, which is also probably why I'm like in a decent mood, because it's cool, it's fun, I like it. Anyway, that's that. That's the last of my last minute things I forgot. A little fun anecdote. And next steps, really, my goals are to, again, regulate my digestive system, try to have my safe foods so I get regular bowel movements, and then I'll probably start testing again for the vegetable situation. So I'll probably have to keep experiencing up and down bowel movements as I figure out what vegetables I can eat. But I do want to do that, you know. It's still good to have vegetables. There's vitamins and minerals and stuff like that I would prefer to eat from food rather than get from like pills and supplements and things like that. So I do want to figure that out. And yeah, there's like the thing with COVID though is like, because I was coughing so much with COVID, I experienced the rib pain, but because I had the rib pain issue while I was recovering from the gallbladder issue, I knew it was a familiar thing. I was like, I think this is just a muscle issue. And so I wasn't too worried about that. Eventually I did have to go get a chest x-ray to make sure it wasn't like pneumonia or anything. But yeah, I'm pretty sure it was just a muscle issue. And most of it is still kind of sore, which is also why I held back on recording this long ass video, so that I could breathe comfortably and like, you know, not have to cough up so much mucus and all that stuff. But for the most part, that's okay. But I'm still trying to like be a little bit chill and make sure all of this resolves, the COVID infection, resolve the vegetable situation, and then hopefully soon be able to like get back into some strength training, so that my muscles are stronger. I'm very weak right now because I dealt with recovery, and then I was okay for like a little bit, and then I dealt with a COVID infection. So it's kind of a lot. I've been dealing with a lot of stuff this year, okay? Like, yeah, I don't know about this whole, yeah, you'll go back to work the next week situation. Ain't no way. But again, it's really dependent on the individual. Some people feel worse for a while, like a whole year they're still dealing with symptoms. And so I just dealt with it for like 4 or 5 months, which was kind of slower than the average, but not as bad. And so yeah, that's where I'm at. Slowly trying to add things back to my life, okay? Very slowly. When I was dealing with the COVID infection, I watched so many Marvel films and man, just but you know, when I started feeling better and stuff, the other day I went and saw I wasn't infectious, or I wasn't contagious anymore. I tested negative and all that stuff. I went to the theater, which I hadn't been to in a long time, and I was like, I'm bringing movies back, movie theater stuff back into my life, which is something I couldn't do for a while because I had a hard time, you know, walking and breathing and just being outside, pooping and all this stuff. I went and saw the most recent like Marvel movie, and I was like, this is alright. Yeah, I like being able to do stuff. It's okay. Like, life is worth living in some ways. Yeah. So that's mostly where I'm at. That's the end. We're good. Should I keep rambling so this hits 5 hours? No, I think that would be, if I intentionally do that, I'm gonna remember. But yeah, I'm actually not even done with my smoothie. Yeah, I hope that was informative and or entertaining in some way, all the little stories and stuff. I think it would be cool to make more videos and stuff like this, because sometimes, like I'm saying at the beginning, I just stand in front of those bosses in Final Fantasy and I'm monologuing to them about all this stuff, and I'm just like, yeah, they're probably getting bored of me just talking about myself. I should probably just actually initiate the fight so then they can use the next dialogue sequence I did. But yeah, this happens a lot where I really get into my stories, and it would be nice to have like a creative outlet in some way to express all these thoughts. And so perhaps I will do a few more of these if there's like any overarching themes and stuff I can talk about to just bring together all these stories and things. Yeah, so this was cool. I lasted longer than I thought I would with my current snack situation, and I'll just end it here. Thank you. Goodbye.